of Karnataka's path forward guidance by citizen center values, deeply aware of his heritage and firmly focused on a confident, transformative future.
Thank you very much. Can we have the stage set, please?
ల్యాప్టాప్ పెట్టి ఓకేగా ఇక్కడ ఇన్పుట్ ఎట్లా వస్తుంది అంబియన్స్
Mr. Kishore Gadiraju, Chief Evangelizing Officer, TALHospitals, Director, Touch a Life Foundation, and Chief Technology Officer, Solix Technologies, Kishore. May I now invite Sai Gundavelli, Founder, CEO, Solix Technologies, and Founder, Touch a Life Foundation. May I now also invite Sri Govinda Harigaru, Founder of Association of Healthcare Providers of India, President AHPI Telangana, General Secretary of Telangana Specialty Hospitals Association, and former National Secretary of Vision 2020, the Right to Sight India. We now also invite Mr. Sarvesh Singh, CEO Life Sciences, Government of Telangana. Last but not the least, it's an honor today to have with us Sri N.S. Bosuraju Garu, Honorable Minister for Minor Education, Science and Technology, Cabinet Minister, Government of Karnataka, and Leader of the House in Karnataka Legislative Assemblies. Thank you very much, sir, for having us here. May I now request Sai Gundavelli to provide a bouquet to the Honorable Minister. Can I now request Mr. Govinda Harugaru to provide a bouquet to Sarvesh Singh? And may I now request Kishore Gadiraju to provide a bouquet to Govinda Harugaru? We would also like to request Mr. Govinda Garuharu to provide a shawl or facilitate Honorable Minister N.S. Bosuraju Garu with a shawl. Thank you very much, sir. So it's an honor today to have Mr. Sai Gundavelli, founder, CEO, Solix Technology, and he's also founder for Touch a Life Foundation. I would like to invite Mr. Sai for his welcome keynote. Thank you.
Wow, what a day. Can you hear me? Okay. First of all, thank you, sir, for taking your time and coming over here. He's such a busy person. I went to his home a few months back. Maybe thousands of people were standing outside just to get a glimpse of, for about a minute of him actually. And for him to take his time and come all the way over here. And also, I also want to acknowledge he's a visionary from a quantum computing perspective. For him to kind of really, bringing in huge investment in Karnataka on the quantum computing and thinking forward, it's amazing for, even though you're such a busy person, still thinking about all those things. So thank you very much, sir. I also want to use this to acknowledge, very distinguished and many celebrities over here. Nishit Desai, sir, thank you. He's one of the eminent lawyers in the world and global policy and all of that stuff. Thank you for coming in over here. Mihir Parekji, thank you. Thank you for coming in. And Krishna Yallagada Garu and lots of many people. And Mark Lee flew from US all the way. Thank you, Mark. Joe Lancaster, thank you. Suresh, thank you very much. Really, we brought the best team from all over the world, and there are some very distinguished celebrities, guests over here. Devashri from Triple I team. Devi, thank you again very much for being over here.
Quality చూడండి audio quality.
So a little bit about Solix. Large enterprises in optimizing their data infrastructure and also help them on their AI
Quality చూడండి
optimization, both
అవి quality
data
చెప్పారు.
optimization as well as data monetization using AI is what we do, and that's the profit angle for the company. And purpose is is Touch a Life Foundation. We are using all our employees to contribute their time to
अभी मैं
focus on
mic
one.
दिया ना,
There are about like a
इसका
10
mic
million
उधर है।
non-profits globally. How to
नहीं,
build a
इसका
social
MacBook
platform
का ही
for
रखो।
among this 10 million non-profits. The other area that we are working is on the healthcare. I think there is a fantastic opportunity all over the world from a healthcare perspective. In North America, for 300 million people is spending $18 trillion in healthcare. And India, for 1.4 billion population, they're spending about $300 billion. And 1.4, 300 billion and 300 million, $18 trillion. The entire India GDP itself is about $3 trillion. So there's an opportunity to bring healthcare to all the people globally. And I think the mission that we kind of really put it is that irrespective of the location, irrespective of the age, irrespective of the wealth, one should be able to access healthcare. And India can play a role on that aspect. More than 100 years back, we used to have Ayurveda, yoga, the wellness care. There's an opportunity to revive all of that stuff. There are a lot of AI models that are coming that are able to predict Alzheimer's, able to predict cancer, etc. If you're able to bring all of that, there's a phenomenal opportunity, opportunity that we can really do. I think this is an ambition for a small company like ours, larger than our life, to be able to tackle this stuff. But you know what? There's no money involved. We are monitoring our time, our resources to be able to do that. And I really feel there's an opportunity to do that. And you will see some of the technologies that we are building. One is TALHospitals, bringing in any doctor, any hospital who wants to provide pro bono service all over the world. We are bringing them to a singular platform. Every doctor can at least do one service for free, just one service for free. Imagine, one subsidized or one service for free all over the world, what we can really do with that. And for people who are uninsured or underinsured, what a goal. Again, we're simply connecting people who want to provide pro bono service to people who need it. The other thing I also want to bring up, a few years back, one of our lawyers, when they reached out to me, saying that he has pancreatic cancer. He said, "Sai, can you refer me to any doctor or any new medication for this pancreatic cancer?" And luckily, through the TAL network, I was able to connect him to a hospital in Portugal, which does pancreatic cancer specialty. And from Portugal, he was referred to in Tokyo, in Japan, to another hospital. Right now, he's living happily since last 3 years. And so that really told us, you know what, healthcare is not local, healthcare is global. And today we are launching a product called TAL Medora. And this product is almost like a LinkedIn, it's a social platform, bringing in all the doctors from all over the world onto a singular platform. And potential for doctors to network with each other, potential doctors to learn from each other, potential doctors to provide second opinion on the platform, potential for doctors to work with multiple LLMs on the healthcare side. And that's the platform we built. And today you can see the demo of the product. And any doctors here, we really welcome to join the platform, because what you say, what you talk can be very valuable, because we are going to use them to train the LLM models on go forward. It's not always about the prescriptive care, it's about preventive care too. And they used to be seeing our kitchen at home is a pharmacy, like a turmeric powder and all of that. My mom used to tell why it is important when we are eating and all of that stuff. So bringing all of the data of preventive care, the wellness care, is an ambition of TAL Medora. You will hear about that, you will see that, hear that today. And once again, this entire event, beyond the celebrities and beyond all the speakers over here, both the TAL team and Solix team really worked very hard to put together this event. They really need an applause, so please. I think today it will be a very inspiring content, and please spend some time, look through the content. There's a great networking all the way till evening, where multiple people are coming throughout the day. Some of the guests from tomorrow, the BioAsia conference, some of those people are also coming in over here. Minister for IT, Sridhar Babu Garu, are also going to be coming in later today. So it will be a great networking. It's a great, thought leadership and an inspiring proposition over here. So I look forward to, catching with all of you. And thank you very much for being in here. Now I'll let Kishore, my colleague, to kind of continue this discussion to the next level. Please intro. I'll let
Maybe now request Honorable Minister Sri N.S. Bosaraju Garu to speak a few words. Thank you, sir.
Respected dignitaries on the dais, guests, healthcare leaders, innovators, members of the Touch A Life ecosystem, ladies and gentlemen. It gives me immense pleasure to be here today to inaugurate the TL Health 2026. I congratulate the entire Touch A Life family for creating a platform where healthcare and technology come together to save lives. As a Minister of Science and Technology, I strongly believe that innovation must have an impact on society. Recently, we launched Karnataka's Quantum Vision, a step to take our state to next generation computing and advanced research. Quantum technology have the potential revolution fields such as healthcare, drug discovery, medical imaging, cyber security, and data processing. While this initiative strengthens the Karnataka's innovation ecosystem, its vision extended far behind our state. Our goal is to contribute meaningfully to India's technological leadership and to build up capabilities that benefit humanity globally. When we invest in science, we invest in solutions that can address global challenges, including healthcare and medicine. Total A Life has demonstrated how technology can create a real impact. When a rural patient can consult a doctor digitally, boundaries are broken. When a blood donor is matched in a time through a digital network, technology becomes a lifeline. When a healthcare system collaborates through digital platforms, comparison becomes a scalable. This is innovation we must promote, inclusive, ethical, and purpose-driven. A healthy society is the foundation of economic growth. A healthy population strengthens national progress. A healthy ecosystem drives a global contribution. Karnataka has long been recognized as a hub for science, life science, and digital innovation. But our ambition is not limited to a regional leadership. We aim to contribute to India's rise to as a global innovation powerhouse and to ensure that the technology develop here serve communication across the nation and beyond. TALHealthFest is such a platform that accelerates this mission. It comes policymakers, startups, healthcare professionals, and social organizations to create healthcare solutions. The government of Karnataka remains committed to supporting innovation ecosystem that collaborate, responsible, and globally relevant. As we inaugurate TALHealthFest 2026 today, let this be more than an event. Let it be a catalyst for inclusive innovation, for accessible healthcare, and for technology that uplifts society. Thank you. Jai Hind.
Thank you very much, Minister sir. May I now request Govind Hari Garu to speak a few words.
Namaskaram. Respected Honorable Bosaraju Garu, dignitaries on the dais, my friend Sai and Kishore, distinguished keynote speakers, founders, healthcare leaders, innovators, my dear friends. It's a great privilege and an honor to be here today at the TALHealthFest, Touch Life Foundation, along with Solix Technologies for curating such a powerful platform where healthcare, technology, policy, and compassion all converge. The theme that echoes through today's agenda, from data governance to the future of life, from quantum and AI in healthcare to global medical access, from mental health, the most important one after COVID, to community changemakers, tell us one clear truth. Healthcare is no longer just about hospitals and doctors. It's all about ecosystem, data, trust, innovation, and of course, people. Technology is now getting redefined through diagnostics and treatments. Data is becoming a new backbone. Patients are more informed. They are mobile, demanding quality, transparency, and of course, dignity. But at the same time, we are facing as hospitals across the country and of course across the globe, I suppose, the rising costs, workforce shortages, deficits in trust, and inequitable access, especially for the vulnerable. Many of the African countries and of course many global south countries across the globe. This is where forums like TALHealth become very essential, important key role players to bring everybody together, not as a conference, but as a catalyst for change. As the founder and general secretary and president of nationally accredited and nationally relevant Federation of Hospitals, both small, medium, and big, I stand before you to represent a wide spectrum of healthcare institutions across the country, large, small, as I said. We are all united for a purpose: to ensure that quality healthcare becomes accessible, ethical, transparent, as data custodians, technology adopters, training institutions, and partners in public health. Post-COVID, public health has become one of the most important, relevant aspects of healthcare, especially in India and Global South. We strongly believe that collaborations between government, industry, startups, hospitals, and civil society is very relevant to keep people healthy across the globe. It's the only way we can build a resilient health system. India is no longer just a destination for affordable care. We are fast becoming a global healthcare innovation hub with world-class clinical expertise, cost-effective models, which is very relevant to the Western world, a strong digital backbone, and a young and skilled workforce. I am sure India in the next decade will produce the largest number of specialist doctors, super specialists, and of course paramedicals, allied health professionals. India can lead the world in ethical, tech-enabled, patient-centric healthcare. The panel I read through the agenda is going to discuss on global medical tourism and India's strategic role in not just about attracting patients, it's all about trust, standards, continuity, and of course, affordable healthcare. It's also going to discuss, I saw, on mental health and community impact, which is most relevant in today's world of healthcare initiatives. I'm particularly glad to see 2 dedicated sessions on mental health and 1 on community changemakers. Because true healthcare transformation does not begin in hospitals, It begins in homes, schools, workplaces, and communities. If we want a healthier India, we must break the stigma, empower communities, design a system that takes care of both mind and body. Let me conclude. The future of healthcare will not be built on organizations or by hospitals, not on one technology or one policy. It will be built on and by partnerships, trust, and shared vision. I once again congratulate team TALHealth, Solix, and all others, and the organizers who have so quickly, beautifully put things together today to make this TALHealthFest 2026 a grand success. May today's conversations turn into tomorrow's solutions. Jai Hind. Thank you.
Thank you very much, sir. May I now request Mr. Sarvesh Singh to speak a few words.
Honorable Minister for Minor Irrigation Science and Technology, Bosraju Garu, Sai Garu, CEO for Solix Technologies, Kishore Garu, CTO for Solix Technologies, and Govind Garu from the Hospital Association of Telangana, and everybody here in the audience. It's great to be the part of this TALHealthFest. And when I was getting introduced to people here in the room, I was quite impressed with the different walks of life from which you have come in for a very noble cause, that how we can make healthcare affordable and accessible for everybody here on the planet, right? And when I was looking into the agenda, I could see that there are a lot of things which people will be talking on reimagining health and well-being, not just for individuals, but even for communities and nations. I could also see that there are several people who are visionaries and change makers here in the audience, and they will be speaking on the entire landscape of health, including your physical health to mental health. So this is a great forum, and I'm really looking forward to see the conversations which will unfold on accessible, affordable, innovative, and empathetic healthcare. When I was sitting with Honorable Minister, he was talking a lot on quantum, and I was just in my mind visualizing that how quantum, along with AI, machine learning, and other technologies which are coming, can actually reshape the healthcare delivery and the healthcare innovation. I could also see that there are panels on longevity and wellness. So here in today's event, we are not just going to talk about cure, but we are also going to talk about prevention. That is why topics like wellness and longevity are there. Even Sai Garu was talking about yoga and some other traditional means, and all of them are around our healthy lifestyles, so that we do not even get the disease, forget about getting the cure. So I'm really looking forward to today's event, and tomorrow and day after we have BioAsia, where you'll see a lot of industry leaders coming in high techs, and they will also be again talking on very similar things which you will be talking here today. So wishing all the best to today's event and looking forward to a grand success. Thank you so much. Thanks for the invitation.
Thank you very much. Thank you. Thank you, dignitaries on the dais over here. Thanks a lot. A special thanks for the Honorable Minister, Sir Bosraju Garu. Thank you very much, Govinda Hari Garu. And thank you very much, Sarvesh Singh, sir. We'll take a quick pause here to just rearrange the stage. Thank you. Thank you very much to the team over here. And now I'd like to request Mr. Kishore Gadaraju for his keynote presentation. Kishore.
So thank you everyone. Thanks for Honorable Minister N.S. Bose-Raju Garu for joining us today. It's a great honor to have him here. And likewise, all the dignitaries. Govinda Hari Garu, thank you so much, sir. Thanks for joining. Nishit, sir, thank you for joining us today. Today, this event is all about Touch a Life. I would like to quickly introduce what is Touch a Life, and we'll focus on the healthcare side of the Touch a Life. As you see on the screen, we built a Touch a Life ecosystem. This platform is primarily meant for helping people who are in need, and we are trying to connect people who are in need and people who are willing to help them. So that's how we built this platform. There are many verticals, namely TAL Giving, TALHospitals, TAL Leaders, TAL Youth, TAL Talks, TAL Radio, so many verticals, but today's focus is all about on TALHospitals. So we'll go to the next slide and we'll talk about the TALHospitals. So the TALHospitals, we are focusing on enabling the digital technology to help people in terms of healthcare. So we built the digital platform primarily to transform healthcare, and obviously using digital technology. We built a TAL hospital ecosystem, namely TALHospitals. TALHospitals primarily meant for connecting patients, doctors, and hospitals for pro bono healthcare services, bringing doctors and hospitals together, and also provide some discounted care where certain treatments cannot be given for free. So that's the primary purpose of TALHospitals. So we have more details and we'll share more details. And we also built a digital doctor. And this is one of the latest and greatest offering from Touch a Life. We launched a few months ago. It's almost like your personal doctor available on your mobile phone, and you can access this digital doctor at any time in your preferred language. So you can speak to the doctor in your local language. It'll provide you the primary guidance, primary information about any specific situation you might have. It's great especially for rural communities where doctors are not available or accessible. You can speak in your local language. And it also helps uploading some of the medical reports. So one of the challenges that we have seen is most of the medical reports are in English, and people may not be able to read what that means. And if you upload that report into this digital doctor app, it can translate that report and summarize it, and also kind of voices out. It speaks the report in their local language. So it's a great tool we are trying to promote. And it's again available in both Android and iOS platforms. So that's one of the focus area. And then TAL Blood Aid. This is another major initiative. I think you're all familiar with the blood banks that we typically are aware of. So what we thought is maybe we can solve that problem using technology in a slightly better way. So what we tried is we connected obviously the people who are in need of blood and people who are willing to give the blood. We connected them in the platform. So anytime a person needs a blood, they can post a request on the TAL Blood Aid platform, and members of the platform who matches the blood request or blood group, they can sign off saying that, hey, I'm ready to give the blood, or one or more people can sign off for that. And immediately they can connect online digitally, and they know the locations. So they can come and provide the blood through the application. So they can track the movement, they can track the activities on the app itself. It's a great application we delivered from Touch a Life. And lastly, we're going to launch a new platform called TAL Medora. So TAL Medora is again a digital platform for it's like a networking for medical professionals. So there are a lot of other networking sites for various purposes. LinkedIn for professional networking, Facebook for family social networking, but we haven't found a really a true professional networking, kind of a platform for doctors and medical professionals. So we built the TAL Medora primarily targeting only the doctor kind of a profile network. So they can basically exchange their knowledge, and they can also learn from others. They can create a group of doctors, and they can create their own network, and they can also obviously know more about what's happening in the healthcare industry from other doctors across the world. This is not limited for a specific country or a specific region. This platform is available for the entire world, so anybody can become a member. There are no charges associated to it. It's completely free. It's a great opportunity from the doctor's perspective. So a little bit more details about TALHospitals. Again, the challenges with the healthcare right now is some of the treatments are very expensive, hard to find trusted doctors, and it's very difficult to find treatment on time. So what we did is, as I said, we built this platform where pro bono healthcare services can be delivered, with willing doctors and hospitals. As Sai was saying earlier, if every hospital can do one free service per year, we are not talking about every day, or we're not talking about every month. If every hospital does one free service per year, and I think we are making a real impact through the platform. So, and again, connecting all the doctors, patients, and hospitals, and also using this platform, we're also enabling medical tourism. So the doctors' profiles are online, and people can find what kind of treatments are being offered at what place, at what charge. Some of them are free, some of them are very discounted. So it'll be a great platform for medical tourism. We just started. You can see some numbers, how many people registered, how many doctors on the platform, how many requests we got, and how many campaigns, how many free services have been offered on the platform. So we just started, and we see huge growth there. So this is a quick brief about TALHospitals. And on the digital doctor, again, as I said, it's available. Anybody can download right now. You can speak in local language, ask anything, the medical advice. It's freely available. You can download it, and it's available 24/7. So, and then TAL Blood Aid. Again, it's a digital app, mobile app. It's available online. Download. Please promote and let your friends, colleagues know about this platform. They can use it for requesting for blood, and you can track the person who is willing to give. It's also create a trusted network of the blood resources, or blood pool, blood donations. So, it's available for free to use. And right now, the TAL Medora is a new platform that we are launching today. Again, it's a professional network for doctors. This will help connect, collaborate with other doctors, and also learn and grow. And also, there's an opportunity for doctors to know more about other doctors, and other doctors will come to know about you. So again, a great platform. We would like to, again, we just started last few days ago, piloting with some of the doctors who are, advisors for us and well-wishers of us. I would like to thank this new platform that we are releasing today, sir. So please come on to the stage, sir.
Sir, please come on to the dais. Thank you.
So just ready? Look, sir, press change, sir. Yeah. Look, sir, please.
professional networking platform for doctors and healthcare professionals. TALHmedora. Better healthcare begins when professionals are better connected. Yet today, the global healthcare community lacks a dedicated professional network built specifically for its needs. This gap called for a purpose-built platform. TALHmedora was created to fill it. TALHmedora is a professional networking platform for doctors and healthcare professionals, designed exclusively for healthcare. It enables doctors and specialists to connect, share professional updates, and exchange medical knowledge. Healthcare professionals can discuss cases, share clinical insights and research, and stay informed about developments across the medical community. The platform also enables collaboration on pro bono consultations, surgeries, and medical services for patients in need. TALHmedora helps connect patients with trusted doctors and healthcare facilities across regions and countries. It supports professional referrals, collaboration, and medical tourism opportunities. TALHmedora brings the global healthcare community onto one trusted professional platform because every connection can change a life.
Thank you very much. Kishore, may I now like to request you to provide the Honorable Minister an Speaker Appreciation Memento. Thank you very much. Thank you. Thank you. Thank you, distinguished guests. We now take our attention to a subject that forms the very bedrock of digital health and modern enterprise systems. When we talk about healthcare, we are not just
days, we're seeing a rise of
created. So this creates a massive hurdle for global research. How do we collaborate on life-saving treatments when data is locked in these geographic silos? So we'll talk more about that as we go through. So Joe helped me pull together some headlines to illustrate the points I'm talking about. And these headlines are very recent. You may have missed them, but this one is at the National Health Service in the UK. Cyber attack leads to patient death. So here's one of the biggest challenges that we face. So to set this up, those of you that remember the 1980s, in America we had a president, Ronald Reagan, and he popularized a phrase from a Russian proverb, trust but verify. Anybody remember that? So that term, trust but verify, is more relevant today than ever before, particularly when it comes to AI and data. In the world of AI, it's all about making sure that your data is properly prepared so that you can trust it and take action on it. So there is a credibility gap. And AI is as amazing as it is, it can produce results that seem perfectly accurate. They seem incredibly detailed, like it came from the best expert in the world, very sure of itself, but it might have inaccuracies. How do you know? So in IT, there's an old saying, garbage in, garbage out. In AI, that saying gets modified, garbage in, garbage squared. And the reason is AI amplifies any mistakes that are in your data set, any problems in your data set, and it's only trained based on the data that you provide it. So if you provide it with inaccurate data, you're going to get inaccurate results. And if you take action on those results, it could result in great harm. So another challenge is governance. The way that we've done governance in the past, what I refer to as legacy governance, has not kept up with the pace of change that we're dealing with in the age of AI. So basically the legacy governance model is broken. It's backward looking, it's static, it documents processes and procedures as they should be, not necessarily as they are. And the safety rules that are part of this legacy governance don't work unless they're active and in real time at the instant that you're using your AI. So this system has got to change. So what is Solix doing? There's a lot of challenges, a lot of problems. So So the first thing we set out to do was build what we call the trust layer, and it's based upon our new data platform that we call Solix Enterprise AI. And with this platform, we have a govern first approach, so that we believe that governance and security is the foundation for innovation. It's not an obstacle, it's not a problem, it's not a cost to bear, it's really the foundation for innovation. So our fourth generation Solix Enterprise AI platform embeds governance and security at the very core. There's a number of features in Solix AI that are of great use to our customers. So the first is intelligent search and access. So this capability makes it possible for practitioners to securely access and analyze their data, whether it be patient data, any sort of data that is relevant to your organization, in a self-service manner without having to request help from IT. So EAI includes a semantic layer, and that's a word maybe you don't use in everyday conversations, but basically all it means is it's a universal translator. So for example, you take raw hospital data, it's in very complex form, you translate it into things that the practitioners can easily understand and then be able to use it more effectively. We also include intelligent classification and governance to allow you to group your data, your records together in like groups to make it easier to manage. And lastly, we have a very flexible way to manage data either across national borders, within national borders, so that you can meet your data sovereignty requirements. So next, our teams have been working hard to build the next generation of data governance. We call this enterprise data governance, and we're using the tagline Solix Intelligence for this new capability. So we're working to deliver what we call a control plane for your entire AI and data estate. So it's being designed to help you illuminate data that's hidden in your organization. So this dark data can create risks that you may not be aware of. Also is incurring costs that can be eliminated. It will also provide AI capabilities designed to deliver answers to your questions that are grounded in your data. So it's one of the ways to put guardrails around your AIs to make sure that it really understands the data in your organization that you need to run your enterprise effectively. And it's trained on your data with full citations and audit controls to make sure that you can trust the answers that you're getting back from your AI. So there's a number of components in our EDG platform, starting with the Unified Asset Catalog. This is just an inventory of all your data assets across your organization and a way for you to assess the value of those assets. A model registry to allow you to track the evolution, lineage, training, updates of all your AI models to build trust so you know that the answers that are coming back from the models are correct and within your policies and guidelines. The semantic layer, like I mentioned earlier, is the universal translator, and it's really a way to help different organizations within your enterprise have a consistent understanding or meaning of a particular piece of data. So for example, if, say, the radiology department, the neurology department request, or they want to look at sort of the reoccurrence rate of a particular condition, there's a definition for that. There's a mathematical formula for that in the semantic layer so that they are always using the same definition for each of the objects within your data enterprise. Federated governance is an amazing capability that we added to the platform just about a year ago. Prior to this capability to apply governance on a record, we had to have that record physically moved into our data platform. With federated governance, now we can look across the entire data estate and govern records wherever they sit without having to relocate them inside our platform. Active enforcement is absolutely key. So there are many governance platforms out there that document governance, that document policies, that try to make sure that everybody is on the same page in terms of what those policies and governance rules are, but they have no way to enforce them. With our federated governance capability and active enforcement, we can take these governance rules that you set up for your organization, design them specifically to meet the needs of your organization, and then enforce them in real time. And AI and safety and security, really important to put guardrails around your AI to make sure that it does no harm, and to make sure that the information that's coming into it and out of it is accessed securely, so that the people that need to have the information can get the information. People that are not authorized to get the information cannot. That's really obviously important with PII, HIPAA, and all the privacy regulations that you have to deal with in healthcare. So one of the industries where AI is having a huge effect is in the pharma industry. So for our pharma partners, we're working to dramatically shorten R&D timelines. So by using predictive models, we can prioritize the most promising drug candidates and help reduce later stage failures. So there's a number of things we're building into our EAI Pharma solution: AI-assisted drug discovery, AI-assisted drug repurposing, and then something that we call the semantic content library. And this allows you to curate your own data alongside an extensive library of both public and commercial data, creating a ready-made AI marketplace to accelerate discovery. Now, our CEO, Sai, challenged us all last year: how can we make all this great functionality available to more customers and make it economically viable for them to take advantage of this technology? So we created something that's called the Solix Enterprise Edition. And it's really focused around this theme that I talked about, making your data AI ready and building trust. So I'm not going to go through all the details on this, but basically the idea is we have a tremendous amount of functionality for all types of data use cases, governance use cases, security use cases, and we want to make it available to customers using consumption-based method where customers pay for value and outcomes as opposed to paying upfront for expensive software. We think that will be a game changer for many of our customers and make it possible for them to adopt these trust-building capabilities and make it work for their organizations financially. So there's many different use cases that we can accomplish with the Solix Enterprise Edition: analytics workloads, creating AI-ready data products, preservation use cases. You may know the history of Solix. We started out as an archiving company. We now talk about archiving in the terms of preserving system or record data, which can be incredibly valuable in the age of AI to train your data models based upon what has happened in the past. Compliance use cases, reporting workloads, data sovereignty, training AI models, unified governance. So that's the Solix Enterprise Edition. And the last part of the Solix product that I want to talk to you about is our newest area of R&D, and it's focused specifically on healthcare and it's called the Solix Health Information Management System Platform. It will be demonstrated at the BioAsia conference this week by my colleague Suresh, who's heading up our efforts here. And we're looking for hospitals across India to partner with us on this new endeavor to help us pressure test this new capability that includes obviously the basic electronic medical records, cognitive clinical care, operational support, clinical data management, governance and security, tremendous amount of functionality that will help hospitals on their AI journey. And we'd love to talk to you about it if it would be something that you'd be interested in participating with us in our early access program. This is just a quick view of, oops, I think I messed this. This is a quick view of how that software looks, some of the flows, the menus, etc. So to wrap up ultimately, all the technology that we've talked about to make AI-ready data has one purpose, and that is to protect human beings at the other end of that data. So when we create reliable AI-ready data, that builds reliable trust. When we protect the information reaching a doctor, we give her the most valuable tool of all, the confidence to make the right call for her patient in a time of crisis. So in 2026, governance is no longer overhead, it's no longer a cost to be borne, it's a core strategy. Trust is no longer assumed. Matter of fact, you'll probably hear the term zero trust. You should have zero trust about anything in your enterprise. So you have to construct trust. You have to construct trust, you have to build trust, you have to earn trust, and that's what we want to help you do with the Solix technologies that I just covered. So thank you very much for your attention today. I hope this has helped you understand what we're doing at Solix. Again, it's great to be here at TALHealthFest. I hope you have a great rest of your conference. Thank you.
Thanks a lot, Mark. Thank you very much. So it's just about time. I think we're just a few minutes away from with our typical time for us to take a tea break. But we're just going to take a tea break for 10 minutes and we'll be back over here again for an exciting session on the future of life. That's the keynote that we have from Nishit Desai sir and Meher Pari. Thank you very much. Yeah. So the tea is on the right hand side, my right hand side and your left hand side if you're viewing it on the left hand side.
As a lawyer, but I did a lot of work with Vinoba Bhave. I don't know how many of you heard of Vinoba Bhave. Very few people. In the 60s, he had that. He was the most saintly politician and one of the profound thinker. Very few people might remember him. But he wrote an article in 1955 saying that now we got independence. So forget about Jai Hind, talk about Jai Jagat. That's how he came up with the concept of hail the world. And that's what Sai, congratulations to you and all the team members and everybody who have been supporting you. I'm really impressed with your vision and the kind of passion with which you work. So it's been a pleasure for me to come here and talk to you. So traditionally, all of you know that whom did you go to know the future? Astrologers, right? Now you have to come to lawyers. How many days you should spend in India if you're non-resident? When should you come? When should you? All the dates are decided by lawyers and tax lawyers, right? Because if you exceed, you got some disaster consequences. Similarly, lawyers also now shape the future of law, future of life. So what, as a law firm, we do, we are international, globally, we call ourselves India-centric global law firm. So we are based out of India, but we have offices in Palo Alto, Boston, New York, Singapore. So we think that India is a great laboratory where cost of experimentation is low, but scalability is high. So you can develop a lot of models here and can export. It can be a center of gravity, particularly for technology. And the way in which we pursue our practice, we are research-based law firms, so almost 40% of the time is spent on research, academics, thought leadership. And we believe that every new technology, every new business model, every new social, political, economic development brings along with it a new strategic, legal, tax, or ethical issue. So what we try to do is try to gaze into the future, particularly from 10 to 15 to 20 years from now. The reason is if you want to develop any policy framework, it takes 8-10 good years. You know, otherwise tsunami of technology comes and we all look around each other and try to see what to do with that. In the process, when government has to look at, they're very worried about bad actors. And they bring regulations in a hurry. And then creates a patchwork and becomes very difficult for business people to handle. So we, as a law firm, have two futurists. One is Dr. Mihir Parikh. Please give a round of applause to him. He did his PhD 30 years ago in AI. According to him, he said he didn't get a job, so he became professor, tenure professor in the US. And about 20 years ago, he joined us. So he guides us as to what are the new things that are going to happen, particularly from 10 to 20 years from now. The 50-year horizon will take 5 years. AI is present to us today. Now we have to look beyond AI. Even for skilling, we say we need to do reskilling. We say no, we have to do the skilling for the future. Because that's where the opportunity is. I think, Sai, you mentioned in your own talk as well. So he is one of our futurists, and he'll tell you more about it. And we have another futurist, Dr. Chintan Vaishnav. He was chairman of Innovation Mission. Of course, he's at MIT and he leads our Boston office. And his job relates to the last part of the last slide that I saw, balance. You saw balance in the last slide? So developing a technology or the policy framework is a very delicate and strategic task. So when you start looking at the policy, industry wants to promote industry and government is worried about bad actors. And they think everybody could be thief. Industry think everybody is saint. Truth lies somewhere in between. So you need to really balance the policies. So whatever papers we do, we try to balance it in a way that you promote industry at the same time contain bad actors. Otherwise industry will not grow. So that is the approach we take. We have a research campus, you can see in Mumbai. So every one of you most welcome. And it's only blue sky thinking center, so it's not for hard workers. It's for thinking, ideation, changing the world for the better. And if you're anything, it's a private property for public good, so we don't rent out, but we are welcoming high level thinking and anything that you want to do with Nobel Prize winners and others come. So what we thought today, telling into health tech, right? And what is the future of health? What is the future of health tech more so? And therefore, I thought it would be useful to share some ideas. We do not say we are astrologers, but at the same time, future is uncertain, as they say, but it's not unthinkable. So based on that premise, we try to see this. Let's prepare for that together. We do nothing ourselves. It's always together. And all of you, we co-create. Let's shape the world of tomorrow. So with those words, let me invite Dr. Mihir Parikh, who will give a presentation on future of life, health takeaway.
Thank you, Mr. Bhai. Thank you, Sai Guru, Kishore Guru, Akshat, Ramadevi, the entire TALH's team. This is a wonderful event. I have been to Silicon Valley event. I did not get a chance to go to San Diego event. I happened to be in New York for a talk. So thank you again for inviting me. The idea is to look at how technology is changing our world. So we started looking into AI. As Mr. Bhai mentioned that I happen to have a long association with AI. I looked at AI when we could do only 10 nodes in neural network. Today we have billions and billions of nodes. The system is still the same, but the quantification has changed quite a lot, and which has enabled a lot of commercial applications. So let's look at how those technologies are affecting life. When we think about life, let's look at circles of care. The most important circle is families. As Sai has always mentioned, that wellness is most important, whether you're coming to allopathy, Ayurveda, or any other system, yoga, all of them. So wellness is very important because we want to have a happy and healthy life. Now, whenever there is a disruption in happy and healthy life, whether it's a mental health issue or whether it's a physical health issue, we get concerned and we start with diagnostics. So the first aspect in healthcare starts with diagnostics. What is the problem? Why are we having this disruption in health and happy life, healthy and happy life? Once we know what is diagnostics, that leads to treatment. So now we look for, okay, now we know what is the problem, what is the solution for this problem. So what we call this a typical healthcare, right? You diagnose and you treat. However, we are moving beyond that. New technologies are coming. What they are doing, they are going to augment our ability. They are going to provide us unique ability that we have not had. Think about a dog. Dog has a very high sense of smell. We don't have the same level of high sense of smell. Can we use technology to augment our ability to smell? Can we use our technology to augment our ability to have a good vision? Think about a surgeon doing a surgery, and surgeon has a very high X-ray vision. What changes can it make in life? What changes it can make in surgery? So this augmenting ability using technology is going to come into our life, and it's already there to some extent. Next part, which we all want to have, is a perpetuating life. How can we extend our life? Think about Elon Musk. He wants to live forever, right? So how this technology are helping us perpetuate life? Again, it's not for the sake of life. It's not being on a ventilator for many years, right? The idea is to have still happy and healthy life. What I call this part as a life care. So not just healthcare is important, but life care is also important. And that's where we have to think about technology helping us in all of those circles of care. So now let's look at what are those technologies that are coming our way. So what I call foundational technology, deep tech, I think you've been hearing a lot about deep tech lately, right? There is an RDI scheme by government which has providing fuel to create sustainable ecosystem in deep tech. And those are foundational technology. Those technologies that come through scientific breakthrough. And those scientific breakthrough that, for example, with AI, when we were tasting and trying those neural nodes 20 years ago, have brought the world of AI today. So those scientific breakthroughs can take time, but it may take a long time. So we are familiar with AI. AI is maturing and is going to be in every aspect of our life. But there are many more technologies like robotics, nanotechnology, CRISPR, which is gene editing. And I'll look at some examples as we go along. Big data, AR, VR, Internet of Things, quantum technology. I think there's a panel that will talk about quantum tech. So all of those foundational technologies which are coming because of scientific breakthrough, and they are getting better and better at it. Those technologies are there. Another set of technology, what I call horizon technology. When you see the convergence of those foundational technology, they create horizon technology. One example, very relevant for us, is a cyborg technology, where basically you are combining robotics, you are combining artificial intelligence, you are combining CRISPR, gene editing, to create cyber technology. For example, locust. Locust has a very unique sense of smell. You know, that's why they all come to your field and eat away your field. They smell. Now, if you can train a locust or create a cyborg locust, which can sense cancer issue, which is just taking position in your body, you can have very, very early diagnosis of cancer. And when you have very early diagnosis of cancer, the interventions that you do will have a very high rate of success. So these technologies are coming. Another example of cyborg technology that I will give you is pesticides that we use in the field. If we create a cyborg lizard which can identify good insect and a bad insect, and eat only bad insect in your field, we can have all those lizards run around in your field. You don't need pesticides. So these technologies are coming. And there are many more of those. There are digital twins. There is a lot of things that are happening in digital twin because digital twin allow you to taste drug before drug is used in. You have a heart, I have a heart, we all have a heart, but our heart is unique, very different because of the way it works, because of the way our lifestyle is. So the drug that they give you, a common drug for the heart disease, is not always the right drug or not appropriate drug. If we can create a precise drug for you based on tasting the drug on your digital heart before giving it to you, the idea of having side effects, the idea of having treatment that does not work will go away. So this kind of technologies are coming, ambient intelligence, precision medicine, DNA as a data storage. Think about data centers that we're building. Huge amount of investment, space, energy getting used in data centers. We all hear about that, right? Our DNA stores huge amount of data by itself. If we can figure out creating a synthetic DNA and how to store all those data in the DNA, then we can have a data center in a petri dish. And taking very small amount of energy because in an entire day of our life, we use probably 2,000 calories a day. And still we are running, right? Brain is running, body is running, everything is running. And we may not be as good as computer in many things, but we are very good at more than better than computer in many other things. Why? Because we process all that data. And it's all happening through only use of 2,000 calories a day. So if we can figure out how we can store data in DNA, and which is basically happening already. I don't have time to walk through all of that, what is happening in different areas, but these are the technologies that
But this, I would also intervene for a moment. They are all the new areas where India has an opportunity. AI game is to some extent lost, except the applications. The foundational thing has already happened. Okay, it requires huge investment. Okay, but when in the early stage, we have opportunity to innovate in every application on this side of the world. Right, basic foundational research has already been done. We can quickly get into the train and be ahead of many others. Like Toyota often comes from behind and takes over a lot of people. So each one of this creates an opportunity for us, and I think this is where we should be focusing on innovations, because it's still 8-10 years ahead of time. It's fun, and gazing into the future is most exciting thing.
Absolutely. So all of these are obviously going to affect the circles that we talked about earlier. So let's look at each one of these circles. Let's look at diagnostic, and I'm going to touch on what is happening. And I'm sure you're familiar with many of these things. For example, in diagnostic, early diagnosis of complex diseases, which we talked about earlier. Complex diseases like cancer, cardiovascular diseases, or neurodegenerative diseases, conditions in the disease stage, if we can identify them using technology, whether it's a sensing technology or whether it's artificial intelligence, doing predictive technology, predictive analysis. So if we can identify those, we can significantly improve the chances of success. Other aspect is real-time monitoring of patient, which is where Sai's idea of having this TAL foundation, extending that. The doctor could be sitting somewhere else, the nurses could be sitting somewhere else, but the patient can be at their home. But the patients are continuously monitored to ensure whenever there is a problem. All the time, the time between the patient has a problem and the time they get a treatment, if we can reduce that time by knowing when the patient is about to have a problem, immediately we can send 108. Right? Not wait for somebody to call 108, but immediately we can send 108. And 108 people also knows what problem is happening before they get there. Right? So those technologies are there.
So we have, just for interruption, sorry for that. I think we have an opportunity to do some policy innovation. Why can't medical surgeon from one country to the other freely not operate so long as global standards are met? So we need to work towards that. Then on a global basis, we can, render a lot of services, as TAL has been talking about. So I think we need to also see that how can we accelerate the process of cross mobility of professionals, particularly medical professionals. It will be great boon to the world, and we can take lead in developing a policy for that purpose. I'll stop here.
Absolutely. New technology that are coming because of quantum technology is quantum sensing. We use MRI, CT scan, all of those. In MRI, what it does, it takes the slices of your heart, right? And every slice is an image. Now with quantum, it can be 1,000 more, 10,000 more slices. Now when you have 10,000 more slices, whatever left between the slices can also be monitored. And if the cancer tissue happens to be there, it can be monitored. So quantum sensing technologies are going to also provide us a lot of information. And through that, we will reduce the chances of negative impact of radiation and heavy chemicals on biological tissues. Predictive analytics, we are all familiar with this, using the historical and real-time data to predict how the disease is going to progress, how the treatment is going to work. And this is very interesting because it's not predictive analysis for only your health, but it's also predicting how an epidemic is spreading. By knowing and predicting how the epidemic is dengue or other, for example, are spreading in which area, we can contain that only on those areas and avoid other people getting affected. So knowing the progress, we can reduce the load on public health infrastructure. Human digital twin. Digital twin is basically digital replica of your organ or your system or entire body. As I gave you an example earlier about your heart, by having a digital twin of your kidney, of your heart, of your liver, You can taste different drugs, you can see how it is going to degenerate over a period of time, and you can be better prepared for that ahead of time. Now let's look at treatment. This is all about the diagnosis. When you know that what is happening, you can predict this, and where you are progressing, you are diagnosing the problem. Next comes the treatment. In the treatment, individualized medicine. Again, example, precision medicine is becoming a big word and big interest of everybody else. All the pharmaceuticals are interested. Of course, pharma model will change because the pricing currently based on doing a big R&D, creating a big blockbuster drug, and everybody using the same drug. Right? Versus precision medicine, the medicine will be only for that individual. Of course, it may come from certain formulation, but the quantity of formulation, the frequency of how often you should take, all of that will come through precision medicine. Another interesting concept is not just the medicine itself, but the delivery of medicine. I believe there is another keynote or panel on precision delivery. Why delivery is important? Right now, when we're taking chemotherapy, you take it to entire body, which leads you to losing hair and all of those side effects. What if we can create chemotherapy which directly targets only the cancer tissue and not the rest of the body? So the delivery mechanism is also very, very important as the medicine itself. So there again, you can start using nanorobotics, right? Which can only get activated when it's in proximity to the tissue that we are targeting, and not anywhere else. Remote real-time intervention, just like remote monitoring, we can have remote real-time intervention where insulin or whatever else is there needed or other drugs can be remotely provided and sometimes even automatically to the patient. Virtual health assistant, it's not only the patient gets medicine. Another important aspect is to educate the person, educate the patient, educate the caregiver. And doctors don't have time, especially in the US. You go to a doctor, they give you like 2 minutes. You ask questions and then, suddenly they'll give you answers and they walk away. So doctors don't have time. How are we going to, from where we are going to get answers? Which is where the virtual health assistants will come into play. And they will know your history, they will know your anxiety, they will know what you don't know. And accordingly, it will provide you the guidance based on your knowledge, based on your risk, based on your anxiety level, it can provide you guidance. And those are based on technology. Augmented reality in surgery. This is another very interesting concept. Right now, when surgeon is doing surgery, surgeon is opening up, let's say they're doing surgery on a heart. They open up the chest and they just see all the mess there, right? Because it's very messy. Anybody surgeon here? Do we have any surgeon here? Right? It's very messy. There's blood, there is noise, there's sweating, there is all those things that are happening, right? Now, if you can help surgeons to augmented reality, your surgeon wears the glasses, the glasses, and the glasses projects the CT scan on the organ itself and identifies where the nerves are, where the blood vessels are, and also identifies the tissue which needs to be worked on. It will be faster, it will be more accurate, it will have less complexity, and surgeon will be able to focus on this, what needs to be done as opposed to what is around it. Correct? So if we can bring this type of technology and help surgeon, they can do their job better, and the patients will get better outcome. And less complexity in the world. So augmented reality, we all have augmented reality right now, right? How many of you have played with those Oculus and other things, Meta glasses, right? It's fun, it's great. Google glasses. But one application is going to be a game changer in surgery would be this. Robotic surgery is already here, Da Vinci, intuitive surgery, surgicals, they have created robots. As a matter of fact, they are already in India. They are operating in India. Next would be autonomous hospital. And I'm not talking about everything will be autonomous, but certain aspect of hospital will be autonomous. Because one of the problems with hospitals is hospital-borne diseases. Right? You go to the hospital and you get infection because of it happens to be your hospital. If we can have robotics play a role, it can significantly reduce the hospital-borne infections. And this is reality. And those are small changes that we can make. You can make huge change in healthcare. Now let's look at ability augmentation. How much time do I have?
As much as you want.
Bionic limbs, which is where the limbs that you have can, let's say you lost a limb or you were born with that problem, you can have a bionic limb, which is basically a combination of bionics, which is your body, as well as electronics and robotics. Another aspect is exoskeleton. Exoskeleton is very, very helpful. I can live probably 30 pounds max. But if I have exoskeleton, it will allow me to lift 100 pounds. As a surgeon, you are operating, you have a 12-hour operation going on. Think about the time it will take, the energy it will take for them to go through this thing. What if you can use some kind of exoskeleton which helps surgeons maintain that, use less energy while they're working? And it's not just surgeons, old people. A lot of old people, many of us have problems with grandfather, grandparent slipped in a bathroom and had a hip surgery. And then it all went downhill after that, right? What if they are augmented by exoskeleton? They can be mobile. They don't need a wheelchair. They won't need somebody to hold their hand. They can have confidence. They can have their own quality of life. So not only for them, for many other applications for exoskeleton can help. Brain computer interface, we all are talking about that. Neuralink and Elon Musk, they will implant chip into your brain, and then you can have the motor skill that you have lost by having simulating that part of the brain or sending signal to your muscles. Augmented vision, we talked about that. Superhuman hearing, again, very useful concept, especially for a lot of people who are getting older. And people who don't have those kind of things. I mean, as a matter of fact, you can buy an auto-adjust speech-to-noise ratio to reduce cognitive fatigue. Because a lot of cognitive fatigue happens in a very noisy environment. Because there is constant noise coming into your head. And you're trying to decipher what is good noise, what is you need to hear, what is you need to ignore. And while you're doing that, it creates cognitive fatigue. And you can reduce, you can adjust by having this technology, what sound goes into your head, you can reduce the cognitive fatigue. Haptic tactile feedback. One of the great benefits we have is touch. So technologies are coming which can help robots and others understand the sensing of touch. Through thermal waves, through motion, or advanced devices like robotic mechanism. Next, perpetuating life. How can we have longer, not just healthy and healthy life, but a longer healthy and healthy life?
So thing would be that
Drug discovery.
in 100 years we think, what is death? We'll have to redefine the death.
Of course, that will create problem for lawyers because the entire concept of succession planning and asset planning will disappear.
But wealth management will be one of the areas. Anyway.
Exactly. So they will have to invest somewhere. So drug discovery, a lot of technology, machine learning, deep learning, genetic AI, quantum simulation are all coming to help us. Today it takes a long time to discover the effectiveness and efficacy and efficiency of a drug. We can significantly reduce this time and bring drug faster to the market, and so that the patient who are waiting for that drug can benefit from it early on. It takes maybe 4 or 5 years before the drug can come to the market, although the benefits are known. So how can we use technology for drug discovery? Regenerative medicine, this is another big area, very useful area. Right? Using your genetics, stem cell research, all of those things are happening. You know, if you know ahead of time that your family has a blood pressure, as history as my family, I got blood pressure because of family history, and maybe more. But if you know ahead of time that this is your history, and if you identify which part of your DNA or your genes triggers that, you can cut that part out and insert another DNA into it. And that can happen at the time of embryo formation, or it can happen later in the life too, because life proliferates. So if we can identify and create regenerative medicine, which means all the future generations will not have the same problem. And somebody was telling me about Gotra system in India. Now, of course, I don't understand much. But the idea of Gotra system to avoid some of those problems related to that. So here we have regenerative medicine, which allows us to regenerate human cells, tissues, organs to restore the normal function. And CRISPR technology is already here. Bioprinting organs. Again, technology is already here, already happening. Taking the actual cells and using bioinks to create 3D organs, which can replace the organ, and there's a high chance of your body adopting it because it's using your own DNA. Artificial skin, a lot of patients have this issue, especially burn patients. We create artificial skin. A lot of patients with the skin diseases, we can create artificial skin. And it's very, very tough. If you have skin disease, it's very tough. It takes many, many months for you to get rid of it. Right? And it's very annoying. Artificial organs, we all know that. Artificial womb, this is another interesting concept being developed. As a matter of fact, I can talk about in Trevor.
Yeah, in fact, I was talking to Tim, and we are discussing this particular subject, and he said he is invested in artificial womb. So it is really happening now. And each one of this technology, I think we can spend a day or whatever, but there is a great opportunity for India to contribute to these spaces.
So the idea here is that can we create a womb outside our body, where basically what we are trying to do is reduce the issues related to pregnancy and the surrogacy and all those issues, prenatal abortion, miscarriage, all of those issues can be, which will improve the health of the child, but also significantly improve the health of women, mother.
So surrogacy will disappear.
So surrogacy can disappear. Genetic time reversal. Now we are really going into the sci-fi side. How can we affect our telomeres so that we can change the time it takes for us to die and just reverse it in some manner? Cryopreservation and revival. Again, if we can preserve sperms and eggs, why can't we preserve our organs? Why can't we preserve our entire body at some point? So after 100 years, again we can wake up. And the last thing is AI design new life form. Using synthetic biology, using the DNA that I talked about, using CRISPR technology, we create an artificial form of life for specific purposes. Right? And those purposes can be of any type. It can be helping cure certain diseases, tackle resistance to antibiotics, clean up hazardous sites, produce chemicals and fuels, and even enhance food security by creating an artificial life, which is designed to do only certain things. Now, there are a lot of legal, regulatory, ethical, social, environmental issues associated with that, and that's where we come in as a law firm. We study this technology, we study the applications of this technology, we think about law, and help shape the future of law. And that's why we are studying this. We are simple a law firm, but we want to see what technologies are coming, how our clients are going to use those technologies, and what kind of issues they will create, so we can have a law, regulation geared towards those applications and help our client flourish. So thank you so much.
First of all, my apologies, we took a little longer time, but hopefully this was useful. It will also tell how many opportunities we have to co-create. Engineers, biotechnologists, lawyers, psychologists. A lot of opportunities are there to co-create the future. And I think we'll stop here. We can go on and on and on, but I think more important talks are going to follow, so we don't want to take too much time of yours, but thank you so much, Sai, for this opportunity. Thank you everybody for joining us here this morning. Yeah, if you have any question, most welcome, but we don't have time right now.
Sir, we have a speaker memento for you. Thank you very much for coming over here. Exciting talk. Really appreciate futuristic thoughts on the future of life. I mean, I think you did talk about some wonderful things in terms of examples of the locus and the how DNA can evolve in terms of preserving the life and creating a better ecosystem of healthcare for human society in future. And may I now request Sai to give a memento, speaking memento to Caesar and Gail. Decision.
Thank you very much. Ladies and gentlemen, I know the world is running. We are also running over here on time. So we will try and see how best we could try to catch up on the time over here. Well, I think Mihir talked about RNAs, right? I mean DNAs. So we are going to go a little bit more deeper and in depth into our next topic, which is all about transforming vaccines, R&D, and innovations in mRNA. And may I now invite Dr. Ramesh Mathur. He is a founder and director, My RNA Therapeutics, for his keynote. Dr. Ramesh Mathur. At the outset, I would like to thank Dr. Sai and Solix TAL for giving me an opportunity to share my experience and give you an idea of what's happening or what's going to happen in the vaccines and infectious field. Just one addition here, I'm not the only guy who founded this company. With my long-term friend, we founded the company and a few others, this mRNA Therapeutics.
my experience after spending a long time in the US and coming back, taking up a more challenging vaccine development. And before that, I would like to give my message that I would intend to share with you at the end of the presentation, but rather push it forward. What's happening in India is, in the previous talk, as Mr. Bishop mentioned, India has a greater opportunity to contribute in several aspects using the AI and quantum and industrial technology. We have a strength and intelligence in biological sciences. We have been very strong in IT. We have been very strong in chemistry. But what about biology? Biology has been a little bit lagging behind, but it is closing the gap now with the greater understanding and greater access to the reagents and science and technology, and also the talent pool that is growing in India for the past decade. So that's one aspect. The medicine and healthcare, as I don't have to emphasize more on it. We already have a significant strength in this field. Facilities and critical technical equipment access, that has been a very limitation. Even today also in certain areas, but that is also, the gap is closing. So as you have the access to these tools, I would say, it gives a more capability, greater understanding, probing, finding solutions to different kinds of things in the field. So what is really required? The right vision, understanding the problem, and putting things together, giving the right direction to the talent pool that is available, make the best use of the talent pool for developing the novel solutions to the complex problem. That's important. So that's something that is India really needs, and take up the complex problems. The opportunity what we have here, an understanding of the mRNA technology, or I would say RNA technology. So we can develop novel solutions to unmet medical needs using all these latest technologies. The limitation with mRNA or RNA-based technology in India is that there are very few suppliers who would enable the full technology development are available in India. But in fact, some of the reagents manufacturers are in India exporting, but all pieces are not there together yet. So with that, I would like to get onto my experience and future plans. So on a high level, in the infectious diseases, every human organ So this is an example, and all other organisms, brain-specific respiratory, lung, systemic infections, and liver, these are all known. So that means there are a bunch of different organisms, virus or bacteria are there for us to tackle as part of your system. And these are just an example of different infectious diseases, vaccines that are available. And on the left-hand side, there's a viral, nucleic acid, the types of vaccine that you could be used to address these or protect these infections, viral, bacterial, and nucleic acid mRNA COVID-19 or COVID disease, everybody knows it. We are expanding as experts in the field on this technology. However, that mRNA technology or RNA-based technology is nothing new. It has been there as a concept for almost 30 years ago, but with the COVID, it's accelerated because of the need. And the other types of vaccines are subunit vaccines, I would say carbohydrate-based vaccines on the down here. They use the bacterial capsular polysaccharides as an antigens to generate the human defense through antibodies. Here, in this particular case, polysaccharides are there. The immune system reacts differently with the age, infants versus adults. So for the infants are most vulnerable to Streptococcus pneumoniae and other bacterial infections. They cannot generate a long-term or productive immunity up to 2 years, or in other words, until their immune system becomes mature. Whereas adults can generate a productive immunity. That creates a huge problem for infants within the first 2 years or 1 year of life, the death rate and so on, fatality, disease burden, and many other things. All other examples are there for vaccines as using the whole cells inactivated TB and others. So in a high level, this is just a spectrum. I'm not going to spend a lot of time on it, but different kinds are based on the infectious organism, bacteria, or the disease virulence factors, what we call disease-causing factors that are produced by these bacteria during the infection. They are the potential opportunities for you to develop a vaccine through the immune system. So these are all different examples. Host-pathogen interaction also plays a very critical role. You need to understand what happens between the infectious agent and the body, how the body reacts, how the infectious agent exploits the host immune system to overcome it and cause the disease. So once you have a full understanding of it, you can create solutions to protect humans from the organism. So here also, there is a vast amount of information available through decades of research. And what is useful, what is just for our knowledge sake, one has to distinguish to develop the solutions. Here again, AI, quantum, all those things would come in future. This is an example of, in India, what happens. Streptococcus pneumoniae, it's a bacterium, disease burden with age. And global, these numbers are for global. This is a page I copied from Government of India's document. This speaks about 1 death for every 39 seconds. Globally, this is. And this is about the disease burden by this organism in India. So this is a report generated by WHO in 2009. And nothing much has changed until 2024, the disease burden in India. However, since the past 2 years, this has changed because the product that I'm going to share some information, the story about our product is being introduced, and it will take about 2 years for anyone to see the statistics of the benefit of this vaccine that after introduction to in India. This bacterium, again, there are 93 different serotypes, and it causes lung, middle ear, brain infections. So there are about 15 or 20 different organisms or serotypes that cause the major burden here. So when we started in my previous company, Biological E, this is one of the most complex vaccines that are in the field, and also market size for Pfizer, it was 7 billion. So we are not so much worried about the market size. However, the unmet medical need and the disease burden we want to create a solution for was the focus. However, it's not that simple like any other vaccine. We need to address the different serotypes. We need to generate the protection against and create a vaccine. The complexity is carbohydrate chemistry, many other things would come. However, for a high-level strategy and innovation, we had to focus on what are all the freedom to operate FTO and what are the technologies we need to develop that is customized to the region here. Also, the manufacturing process we have to focus from the beginning because several blocking patents, number one, scalability because the vaccine dosage need is in millions and millions of doses. You cannot just have a small manufacturing unit and then solve the problem. All the problems or solutions you generate should be scalable. So these are two things. So this is just to figures are the mirror image of the one and the other one. You may have a strategy, but you need to have freedom to operate. That's very critical. And the clinical development strategy is another thing. So just to give an example of what's the background in this, the 7-valent, there were few pneumococcal conjugate vaccines that were already approved. The first one was Pfizer in the year 2000. Before Pfizer, it was Wyeth. Okay. So there are 15-valent and the 20-valent Merck vaccines, and the Pfizer vaccines were also approved. In India, we didn't have it, but we were working on developing a vaccine similar to that. And this is just an example of how the serotype composition would be. We had to focus on what we had developed, what is required for the region. These are the different steps that are complex steps in the developing and then manufacturing of the vaccine. So the most critical thing is from the beginning, you need to have a plan, the complex manufacturing process, address them. And one of the critical components is carrier protein, where we connect or conjugate chemically, couple it to the polysaccharide. That chemistry is also highly complex. One has to develop solve a lot of solution, solve a lot of problems in it. So here, this is just a bird's eye view of what are all the different things that are involved in developing from the concept all the way to the approval. Our product was approved in 22. WHO PQ, the last note, that is the critical accomplishment for it, because that gives us an access to supply to our different countries. These are just ours. The product is labeled, market name is Nubivax 14. Earlier, Pfizer and GSK were the only two products that are. GSK product is not as strong as the 14-valent product. Again, this is just what is required as a vision or as a experience or a maturity or understanding the science and technology to develop the product from concept all the way to approvals. These are different steps, scalable steps that are required, but it takes a long time for the first batch to be made, many months to require. And this is the gist of all the clinical trials, the phase 3, the pivotal trial, and we have to use Pfizer's product as a comparator, and we did demonstrate in vaccines field, something called a non-inferiority demonstration is critical. That is a must for getting a regulatory approval from the government. So we achieved that, and these are all happening from Hyderabad, India. And these are all these different points where we have the advantage in developing the right technology and the right scientific concepts to get the approval of this product. So we have a unique position for this, because even though this product was known, there are hundreds of patents are filed, but we have to find our own solution to it. This is the product, and several patents are very critical. Filing from here, we got a globally approved patents from Hyderabad. And this is infixed, this is first statement is it's not a single, these are all statements from WHO technical experts. And any vaccine, just getting an approval is not enough. We need to get two different groups that need to advise and recommend vaccine administration mass level. This is the potential room for millions of doses that could be required by 2030. For PCV alone, it's crossing 400 million. You could imagine the global market size. And this Indian government introduced our PCV-14 in our UIP for mass administration. Personal touch, waved the flag for the first commercial shipment. And I also had an opportunity, once in a lifetime opportunity, something like this. My mother got this vaccine right after it got approved. We were also recognized by Pre-Gallian India Foundation for best biotechnology product, PCV Nubivax 14. So team, but it's not the end. End is the beginning. After a long time, I came with my long-term friend to start the mRNA-based therapeutics company. I left BE a couple of months ago. Our focus is on cancer therapeutics and vaccines by modulating the immune systems. Just a high-level immune system, what are the different factors there. One example of a respiratory syncytial virus, and this virus has 2 products approved, but one is weaker than the other, so mRNA-based versus traditional ones. It has some limitations in it. In cancer vaccine, we would like to focus on this last one is mRNA and DNA vaccine. It has a link to the LNPs and virus structurally. The LNPs we use to exploit the mechanism of the virus to deliver the mRNA to the targets. This is the structure of the mRNA, what goes into an mRNA. These are critical components where we have a room for bring our own innovation into the design of this mRNA structure. This is where I would like to link to the previous talk where targeted precision medicine. What happens is after you design an LNP in your design chemistry, right now people have been using the monoclonal antibodies, but there are several opportunities to modify to a ligand or a chemistry. Then you can go into target specific cells or an organ and so on. Manufacturing process for an mRNA, what goes into it, a little bit more details. However, new antigen platform, mRNA is not a solution for every disease. Just for you need to develop you need to match the need and the mRNA platform technology. This is just about the human immune system. What are the internal threats versus external threats? External threats are infectious agents. Internal is sometimes your own immune system could go wrong because every human body has an immune defense system. It is almost like a government or a country where you have your own defense administration and all those functions and so on. But whenever some things go wrong, that's where the things happen for cancer. But once you identify it, you can make corrective actions on it. So this is my last slide. With bioinformatics, in silico testing data from organoids, and that's an opportunity for developing new solutions. And then from India, you would see several candidates completing in the next 5 years. With that, I would like to close my. Thank you.
Thank you very much, Dr. Ramesh. May I now request Suresh Mani to come on stage and give the speaker appreciation memento. Thank you very much, Dr. Ramesh. Thanks a lot. Round of applause, please. So we'll just take a quick pause over here for a minute or so to get the stage set up for our next exciting panel on quantum and AI in healthcare. Give us a moment. Thank you. Thank you very much, team. May I now request the moderator for the session, Uday Saxena. He's the strategic co-founder, Whale Tank Biocatalyst. Please come on stage, please. May I also request Mr. Matru Prasad Priyadarshi, Healthcare and Pharmaceutical Advisor and former Senior Director and General Manager, South Asia, US Pharmacopoeia. May I now request Dr. Devapriya Kumar. He is a professor at IIIT. Mr. Shikhar Prasad, IT Director, AI Compliance, Novartis. And last but not the least, may I invite Venkat Kamlakar Bandla. He is the CEO of Markans Pharma. Thank you.
Thank you very much. That was not me. Okay. So, first of all, I'm very happy to be here. I've really enjoyed the session since morning. The only feedback I have for the hosts is if we could stay on time, that would help, because a lot of us has to jump to some BioAsia related meetings that are going on. But from a learning perspective, this has been a fantastic opportunity. So the format for today is, as you know, we're talking mainly about AI in healthcare today, and we have some really heavy-hitting experts that will discuss this with me. And the format I'm going to use is, for each of them, we have specific questions that have been tailored for their expertise. So I'll ask them, and I'll ask all the questions to a particular person in a sequence. I'd like to keep it under 7 or 8 minutes per panelist, so that towards the end, I'd like to really invite a couple of questions from the audience. So Ramesh has already volunteered to ask a question, and he's sitting right there, so. Yeah, so my name is Uday Saxena. I have been in drug discovery for 30 years. I was part of the team that discovered a drug that is called atorvastatin or Lipitor when I was at Pfizer. That's something pretty much everybody in India above the age of 50 will need or is already taking it. So again, let me start with Matru Prasad. No, yeah, why don't you get started? And if you don't mind, for the Gen Z, just introduce yourself for 1 minute, and then we can ask. I'll get started with you. Thank you so much.
Thank you, Uday. Thank you, the TAL team, for the opportunity to be here. So I am Prasad. I bring in almost 25 years of business leadership experience in the healthcare ecosystem, having worked different parts of the world in pharmaceuticals, medical devices, and medical tech, managing hospital operations as a CEO, and then last few years to manage global public health through primary quality standards. Now, all along this, having worked in different parts of the healthcare ecosystem, AI and digital technologies has been passion, because I have seen huge impact in terms of bringing to the patients and to the clinicians. So I'm very excited to be here. Thank you.
Thank you so much. Maybe what I can do is, in the interest of time, because a lot of us have to leave by 1:30 or so, let me start asking you questions, and when we move on to the others, they can introduce themselves and talk. Is that okay? Yeah, just trying to save some time here, so yeah. So thank you so much for being here, and a couple of questions for you, and I'll make this very interactive. If I have a question in response to your response, I might actually go ahead and ask you, okay? You've seen hospitals, medtech, and standard bodies up close, right? I mean, you just mentioned that. What has actually changed in how leaders evaluate and are adopting AI in the patient care in the last, say, 5 years? I mean, what's the big ticket changes that you've seen or anticipate moving forward?
Yeah, thanks, Uday. Very, very pertinent question. When there are a lot of talks going on about how technology is making a difference to patients' life and also to the clinician's life. I think these are the two clear stakeholders. Now, having spent my career in these industries, starting from pharmaceuticals to medtech to hospitals, I think what changes I have seen that from being a vendor-driven relationship, the entire transactional, it is becoming transformative. So everybody, every CEO in organizations investing in technology is looking at how the value is being driven. There is a huge change I am seeing from a regulatory and quality perspective. Because the moment you bring in new technology, whether it is AI or quantum computing, which is the topic for today, we are seeing there are huge challenges in terms of understanding the regulatory mechanism, because at the end of the day, we are dealing with human lives and the quality systems. So that's another second lever of change. Third is, apart from the clinical decisions, there's a huge change happening on the from the financial investors perspective, because you see any new age technology companies, whether it is healthcare or medtech, there is a huge private equity investments coming. So everybody is looking at their exit route, looking at the return on capital employed, return on investment. So I think that's the third lever I see the business leader is evaluating from a tech perspective. And then finally, the last but not the least, I say, looking into the stakeholders. Now, whether it's Dr. Mathur talked about vaccines, whether it's drugs or a medical device or AI-powered digital device, or optimizing operations in a healthcare provider setup, I think two stakeholders are becoming key important. And I would also add the third stakeholder. The first stakeholder is, of course, the clinicians. The second is the patients. The clinicians, how can we support the decision making of the patients? The patients, how they can, there is a huge trust deficit we are seeing in today's world from a patient perspective. So how do the patients rely and believe that this technology is bringing is the best interest of my health? And last but not the least, the regulators, the watchdogs, who really wants to see that whatever the technology is coming from a ethical perspective and also from a regulatory perspective is the best interest. I think these are some of the changes what I have seen in last decade, and it is going to transform going forward to the next decade with new technologies coming.
Excellent. Thank you so much for those insights. Let me ask you a very quick question. Are our best practices in India on par with what's being used outside of India, or are we catching up, or where do you see India versus, say, systems in more developed countries?
Yeah. So I think I would say, I call it the pre-COVID era and the post-COVID era. Like we used to call before Christ, after Christ, AD, BC. We call it PC, pre-COVID, and post-COVID is POC. So I think things have completely changed. The COVID has actually made us, I mean, everybody sitting here will agree, the way we are operating pre-COVID, we have, all of us, including our children, all of us have changed the way the world has viewed us, and we have viewed the world. So I think from a healthcare perspective, Western world was leaps and bounds ahead, I would say a decade ago or 20 years ago. But today, Dr. Mathur was just talking, Hyderabad produces almost 60 to 70% vaccines used in the world. Yes. So there is no question of quality. India produces 40% of the generic drugs being used in US. And Hyderabad, Telangana is one of the major contributor to that. Similarly, the technology perspective. But I think where we need to change, we need to, from being a service provider to an innovator or product provider. And today you saw 3 days back, Anthropic's solutions, cloud, really crashing the stock markets of the Indian software services provider. So I think what post-COVID change is, we are getting into a product-driven innovation mindset, which was lacking. We are just leveraging the cost arbitrage, both in the IT and in the life science ecosystem. But I think that's changing post-COVID, and new technologies being developed in India, because in the morning, one of the keynote speakers talked about why India is important, because we can scale here. Because and every global player is looking at India, because you can create a prototype or a PO, but unless you scale it up, you don't get that confidence in terms of the stakeholder or investors. So I think that's the change I'm looking at going to the future.
Excellent. As we speak, there's a huge AI conference in New Delhi. Starting today. So some really big people are showing up for that meeting. So I think India is on the global map for AI innovations. That's for sure. Let me ask you a second and final question, and if there's time left, I'll come back to you. but thank you so much for your insights. So for a hospital CEO in India starting with AI in 2026, which is this year, what is the first low risk, high impact use case you would recommend and why?
Yeah, so I think this is a very, very important and pertinent question today, because I started by saying when we look at cost benefit from a hospital perspective, because at the end of the day, apart from the public institutions, the private hospitals are mostly investor fed today. So everybody looks at a return on investment. So I think a use case, I would say the patient monitoring system, remote monitoring of patients, especially which was got more evident during the COVID time. Now why I say low risk, because there are a lot of proven cases available for a hospital CEO when he's wanting to invest into technology. Let me give an example of two private providers. One of them which I have worked in my prior before, Apollo Hospitals, which has really proven how emergency setup can be monitored remotely. And then Manipal has got something called the early warning systems, especially for sepsis management by the paramedics and the ICU doctors. So I think there are proven case studies, which is a low risk, I would say. Now why high impact, especially in India, country like India, where you have 1:1,000 ratio, 1,000 patients, 1 clinicians, and our public health systems is so much under pressure, it can create huge impact. Remote patient monitoring, whether it is any non-communicable disease or chronic disease, and especially in a country like India, where the strain on the health system is so high, I think that can create impact. But the low risk is because there are proven case studies, both by the public systems and private, in terms of managing remote patient monitoring, especially in ICU setup and emergency setup. Now, how technology can play a role, the last point I would like to emphasize, because we have all the data sets ready. When we talked about artificial intelligence, we have huge amount of nursing records present in India. We have the vitals of the patients. We have the patient's admission history and data records given by the physicians and clinicians. So the EHR has got huge data sitting. Now, how do we leverage this data rather than talking about that technology is the infrastructure overall? I think that mindset has to change for a hospital CEO. He should look at data leverage rather than infra overall. And how do you leverage this data to use those use case scenarios, which is already prevalent both in private and public healthcare setup, and used to our advantage to create high reward healthcare impact. Thank you.
Very nice. Thank you so much. I have to tell you an interesting story that happened with me. I was in the US and I wanted to get annual physical done, and they came back and told me that it'll take 8 months. And I said, what if I have in severe pain tomorrow? I said, just go to ER and try your luck there. So things really, really need to be fast forward in a big way, even in developed countries. I think we're not the only ones. Some of you talked about what's happening in India. The other interesting thing was, so I finally did a telemedicine, which is you just sign up. They had all my records from my visits in India. I have no idea how they got that. So I asked them, they said certain private hospitals in India are willing to share their records with hospitals outside. So there was, I don't know what the laws around that are, but it was pretty mind-boggling for me to hear that, because that could impact my insurance in the US, right? So yeah.
Can I add just one point?
Please.
Again, for the benefit of the audience, I would give two examples which happened during COVID, what you were talking about today. One is during COVID, I was managing the global project of ventilators for the world's largest medtech company, Medtronic. So we were operating on a 24-hour schedule in Medtronic's largest R&D center here in Hyderabad. And if you recall, Feb 2020, March 2020, the highest mortality happened in Italy, the first COVID, because of the geriatric population and So, and all those ventilators, Medtronic ventilators, the entire global support in terms of analyzing the data and giving a predictive analytics report to the clinicians were being managed here from Hyderabad. And so very seamlessly we were operating remotely, managing the patients. And also because the ventilators who has so much of stress, there has been some burnout, so we are managing remotely. So that's one example. The second example is, I have talked about UK. Like you talked about, for a conventional NHS system, a MRI, you go to a clinician's, I have a knee pain, I have been asked for MRI or a CT, my waiting period will be 6 months. Now, compared to a country like India, which is called developing health ecosystem, I can walk to any private institutions provided I have insurance, I have cash to pay out of pocket. I can do it in 2 hours in a city like Hyderabad. Even a small remote corner village, I can get referred to a government community health centers, advanced hospitals, district headquarter hospital, get it done in the same day. So I think there are now collaboration happening post-COVID, where there are hospitals who have kind of arrangements where you can do remote monitoring.
Yeah.
Teleradiology is a reality today.
Yes.
So many doctors in India offer their radiology reports to a lot of low, medium income countries in Sub-Saharan Africa, East Africa and West Africa. So it is a reality, and I think the law and regulation has been really facilitating to make it happen.
Great.
So that's why I say healthcare is actually a true global market. It's not a local market.
It's a level field now, absolutely. Thank you so much for your insights. I will come back to you if we have time, but I'd like to pass it on to the next person. Could you please introduce yourself briefly and then?
Yeah, so thank you for having me, Solix and panelists and everybody. So I am Deva Priya Kumar, Deva. So I'm a professor and dean of research at IIIT Hyderabad. So most of our research in the area of how to apply modern AI methods for molecular design, drug discovery, and also a lot of work in healthcare. We work with a large number of hospitals in Hyderabad and throughout the country, trying to develop solutions for different use cases. So I'm very happy to be here. Yeah. Thank you.
Thank you so much for being here. All right, my first question to you is, from your work in computational chemistry and AI, can you give one example that convinces you that AI is truly changing drug discovery and not just making it slightly faster?
Yeah, so anyway, let me just start with some kind of a pessimistic note and then end with reasonable optimism. So whether AI or traditional computational chemistry or medicinal chemistry or virology or pharmacology, any area that you take, right? So none of these can come up with a drug, right? So it's just as simple as that. So it's just a conglomeration or confluence of different expertises and different areas that come together to solve this extremely complex problem, right? So now the question is, what is the role of AI? So the one good thing that has happened in the last, I would say, about 7 to 8 years is that things have changed for the better, in the sense that if I am a chemist, for example, I was trained as a chemist, and I could only contribute to a certain aspect in the drug discovery pipeline. So similarly, if you take a pharmacologist, they could contribute to a different one aspect of the drug discovery pipeline, right? But what we have witnessed in the last about 10 years now is that AI seem to be contributing in every aspect of this process, right? Whether you are trying to find which targets to attack for a given disease, or just to analyze the biological networks and coming up with possible ways of trying to come up with a drug, or all the way to the right hand side where just predicting the trial outcomes, or what kind of cohorts we should choose for a specific drug for a specific disease, and maximize the regulatory permissions and approvals and so on, right? So that way AI has kind of disrupted the whole thing, or I shouldn't say disrupted, but has the potential, and we do see a large number of this, and we already see it. The percentage of the molecules entering the phase 1 trials has increased by at least 10%, right? So, and then there are at least 2 or 3 drugs in the market that were designed by AI. Like I said, it's just not AI. It's aided by many other areas and many other expertises, and so now we see a real significant acceleration, right?
So, and then we are able to ask questions, or we are able to solve problems which are traditionally asked before, right? Today, we always try to work solving the forward problems, or, we ask questions in a certain way, while we always look for answers the other way around, exactly 180 degrees, right? I can take examples later, but so now using AI, we are actually able to ask questions exactly the way that we want to ask, right? So, if you want to go from, point B to point A, right? We always asked A to B, and then try to figure out how to go from B to A. So now, with AI, we are able to ask such questions directly, which none of the traditional methods are capable of even addressing those questions.
Excellent. Let me ask you this, in your fraternity, which is academia, I've come across people who are believers, sounds like you are, and there are people who are like, let's not even go there. How much belief do you have in making a decision to kill a potential drug candidate based on your AI in your area of work? Would you say, well, AI is telling me this is never going to make it? Would you kill it, or would you not kill it?
Yeah, see, that's a slightly,
challenging?
Yeah, challenging question to answer, but let me put it this way, right? So, let's just take an example. So, let's say I want to buy a car today, right? So I would like to explore all possible cars that exist, a certain number of brands, certain number of, models within each brand, certain number of variants, and certain number of colors. I'm sure, there are million unique cars that exist today. Right. So if I think that I'm going to explore all these possibilities and choose the best one, I being, let's say, a picky one, right? That's impossible. If the AI can help me maybe sample 100 or, 150 and be able to choose, one out of this million, even if I had, done 1 out of million by exploring all of them, that's a great thing, right?
Yes.
So that way, it's a great tool, but at the end of the day, it is a tool.
Yeah, they're very cleverly answered, I must say. In the corporate world, that answer wouldn't fly. I'll tell you, my boss will say, I'm paying you to give me solutions, not additional opinions and problems. But
if it makes you happy, AI will solve everything.
Okay. No, you don't have to make me happy. No, excellent insights. I want to ask you another. I see a lot of young people in the audience, so this is more pertinent to them. What skills you think young scientists should build if they want to work at the intersection of AI, healthcare, and chemistry over the next decade?
Yeah, that's an excellent question. I get asked this question all the time when I go for talks and stuff. But see, why AI has become successful today in almost every area that we can think of is not because of the AI itself, right? It is because of successful applications in different areas. So that means the questions or the problems have to come from the domain side, and then whoever is working on the AI should be able to work and speak the language of a doctor or a physician or a surgeon or a pharmacologist or whatever it is, right? So to be able to speak in that language to be able to come up with solutions, right? AI just by silo, it's going to be a complete failure, and the domain by itself is gonna lag behind. It's like recently I was listening to someone saying AI is not going to replace doctors, but doctors who understand AI or understand the limitations of the AI are going to replace doctors who don't, right? I think this is true for every area. So so the easier way to get in is just get trained in AI the typical way. There are so many resources, but then if you are interested in a given domain, or if you want to work in a given domain, I think a lot of time need to be spent on learning about the domain and then understanding the problems more.
Great, thank you. Another one final question. Would you allow your PhD students to use ChatGPT to design new drugs and compounds?
Yes.
You would?
Absolutely.
But what is the protocol at the university level? Can that go in a thesis wherein a student has used ChatGPT and designed everything that normally would have taken 6 months in like a day? Would that be acceptable?
Yeah, if the student has worked for a week and did not work for the rest of the 6 months and then said, oh, this is my product, that's absolutely unacceptable, right? But if the student has progressed 6 months of work in a week, but then has done much more,
right? Beyond, much more beyond, that, or, if you start here and you reach here, or if you're starting here and then reach much more, that would be a good thing, right? So, yes, we actually wrote a research article just using ChatGPT, and then we declared.
I actually went through that. That's the reason I asked you that question. So.
Yeah, I mean, because we wrote this paper on generative AI for drug discovery, and then we said, why not use generative AI for writing the article itself? And of course, we take the complete responsibility. Yeah.
So there is no uniform university level policy on this. It's case by case and left to the advisor, sounds like.
I mean, no, at this point, because the landscape is changing so much, right? I mean, tomorrow is a very different day than today. I don't think we have reached to a point where it is very clear what is allowed and what is not allowed, and things like that. So, I don't know where we are going to be in 1 year, 2 years down the line. So policies will become much more clear. At the end of the day, learning is the is key.
Totally. Yeah. Thank you so much. Very, very great insights that you provided, and I hope the young people who are here have understood that AI is something that you must learn, but it's not the end all, I think, is what you pretty much said. So, yeah. Thank you. I will come back to you if we have time, but I'm going to now can you please introduce yourself, and then Shikhar?
Hello. Good afternoon, everyone. This is Shikhar. So I have a background of engineering and MBA, and I have worked with multiple consulting firms across geographies. So I started with technology consulting, then I moved to strategy consulting, and now I am doing compliance. So presently I am with Novartis. I am AI compliance director in Novartis. So I'm working with very deep into SAP technologies and how we can implement AI at scale responsibly. So that's a brief background about me. Thank you.
Yeah, thank you so much. My first question is, in a large pharma environment such as Novartis, and it's one of the largest pharmas in the world, and a European company. So, what are the most common mistakes teams make when they first propose an AI use case?
Nice question. So, I'll give you, personal experience. So, right now, AI is everywhere. AI is the buzzword. Everyone wants to move fast. Everyone wants to create the biggest impact. There is also the, KPI or, the goals, how we can leverage AI in pharma and how we can, meet our timelines and all. But when you are moving fast, we generally miss the compliance part. So what happened in one of the
compliance
examples, that we moved very fast and we completely ignored compliance. And the systems where we were putting AI, those were not legally compliant. So that spiraled into a big problem, and legally as well, and from the regulation as well, because I work very closely with the auditors, and everything got stopped. So because nobody was aware of it, nobody thought about it, and we have to, come 3 steps backward. So I think compliance is very important, legally, financially, everything. And the challenge is there's so much about AI, but no one is thinking about how, you will be able to defend it through and meet the regulations. Because, for example, if you see all the AI models, these are all probabilistic models. Earlier, what we know, right? This is X, this will give me Y. But these large language models which we have now learns by examples, and there is a model drift, what we call, that the answers can change. So there can be some biasness which can come in. So for example, if I give you from one of the other companies I don't want to name, they implemented AI in a very large way for their HR recruitment. They made it fully autonomous. And then in the data set, there was some biasness for, black people or for the women. And the results were very shocking. They were rejecting the females or the people who were black, and then it was caught. So it is very important that you are able to test it. You don't have any biasness, and you move fast, but you have to move in a very responsible way.
So, don't you ever use your intuitive knowledge to, do you entirely rely on these AI systems, or, there must be some intuition. In innovation, intuition plays a huge role, right? No AI can actually tell me intuitively what's the, so in your business, is that intuition at all part of how you manage decisions, or?
So I believe, the root cause of it is training the model, because you take any LLM, but you train them on your processes, on your data. And the key thing here is how clean is your data set. Because if there is some biasness, there is some subjectivity in it, then of course the model will inherit that. So before we start implementing AI in scale, I believe the data sets needs to be cleaned thoroughly. You have to ensure there is no biasness. And presently, in the EU Act of AI in 2024, which came, that's the most comprehensive AI compliance currently. And it plays a lot of importance to the data sets, how do we manage. And there is a way of cleaning it and to make it very objective. And I think that's the key thing, because if your data is not good, the output will have some shortcomings.
Right. Another question is, SEDESCO, which is the Indian US FDA, how are they receptive to using AI in pharma decision making, you think? Has there been any dialogue between Novartis and Indian regulators, or you just focus on European and US FDA regulators?
Yeah, so Novartis has offices and operations across geographies.
Right.
Swiss being the biggest one, and we have recently opened 2 manufacturing plants in the US, which will be operational by end of this year. So like I said, for the EU, we have our own control framework, which is built on the EU Act. Yes. And we have to adhere to it point by point before we go ahead with AI. For the US, we are still framing our control framework, because the plants are not operational. But what I believe is it will just be a subset of what we already have, because we have a very comprehensive controls. There may be few localization needed, but that is yet to be seen. So that's still in progress, frankly.
Okay. Now, the reason I asked is the pharma world, specifically US FDA, is rapidly moving away from doing too many animal studies. Yeah. As you know, they're starting to use non-animal models, and you'd be surprised to know India is the second country to have adopted that.
Yes.
The use of, specifically in cosmeceuticals, we in India, we are not allowed to use any animal models at all. For monoclonal antibodies in the US, they're now saying don't do any animal, because the toxicity is relatively a lot less. What do you think of this, that the fact that India has kept up so rapidly with this, the front-runner US FDA? You think it's a good thing, or we should have our own policies, or what's your take?
No, I think every country should have its own policy. They can, take the good points from others. And if you see, right, the GDPR, which came by Europe first, and then we have US privacy laws again coming up, and then in India we have DPDP. So because it has to be customized and localized with the countries, but I think that's a good starting point. And with pharma, which is heavily regulated, you have to have stringent policies. And since I've been dealing with auditors in and out, for them, less is even more. So it's very difficult to explain to them. And something which is very new, like AI, where you have agentic workflows, which is a probabilistic model.
Yeah.
You have a control, you have principles in place, But to operationalize it, it's altogether a different ball game.
Great, thank you. One very quick thing. You know, the one thing that comes to my mind of using one yardstick for everybody in the world is demographics, right? Our genetic makeup is very different than Caucasians and so on and all. So do you at all worry about the fact that one set of rules that's been used by US FDA cannot directly be applied to India, or that's not something you worry about?
No, I don't think that is something we worry about. And specifically, if you ask me, Novartis, we are targeting both, China, US, Japan. Those are our targeted markets. So the regulations and everything is built on that. The key part is because Novartis drugs are very expensive, and we are into innovative medicines. The spin-off of Novartis, which is Sandoz, it's generics. There, we are targeting the mass market. So we have like a global capability center in Hyderabad, where the complete technology wing, even the drug discovery is in the GVK Valley. But the targeting market is, the US, China, and Japan. So we are selling drugs there. So we are being compliant there. And Novartis India is a very different entity from the Novartis Swiss.
Got it. I mean, those are fairly obvious. They're all high-value markets. So, nobody develops a drug solely for India. I mean, that's fairly obvious. So thank you so much. So sounds like Novartis is started to adopt all this, but sounds like you're still more conservative than a Pfizer. Like I can tell you stories about Pfizer and how they're using AI. It's mind-boggling. So would you agree that Novartis might be a little more conservative?
No, I don't believe.
Is it a European mindset versus a US mindset?
No, because if you see, right, from the technology perspective, we are one of the earliest pharma companies which adopted SAP S4 in a big way.
Yes.
We were successful in US. We are first with SAP AI, which the initiative which I'm leading.
Okay.
How do we use AI? And currently, specifically for SAP, because it's not SAP AI is not generic. It's very specific, and all the business transactions are into SAP.
Yeah.
So you can leverage AI models where your business transactions are, and I think we are very ahead in the game, at least from the SAP ecosystem perspective. And the others are following. Why I say that? Because when I'm speaking to various partners from the big fours and big consulting firms, I can understand they are, still we are ahead, in the game.
Okay.
So when we are ahead, I definitely believe, Novartis is ahead also compared to other pharma giants.
I think you just got your promotion. Thank you so much.
Thank you.
No worries. Thank you so much for your insight. Venkat and I go back a long way. He's a veteran and probably one of the most well-versed in a lot of these emerging topics. Venkat, can you just introduce for 1 second, 1 minute, sorry, and then.
Thank you, Uday, and thank you, TALHospitals, for having me here. Good afternoon, everybody. I know I'm between you and the lunch. I'll try and wrap up quickly. About me, I've had a bit of vacillation between corporate roles and entrepreneurial. I used to run in the previous lives, ran Baxis, Europe, CIS, and Africa operations. Post that, I was with Jubilant as the global CEO for pharma business. It was one big company, Jubilant Organosys. What we have now is 2 different companies, both of them again listed on the stock market. Then I went into entrepreneurial, where we were co-investing and doing a lot of advisory work, co-investing into product developments for US and Europe. I kind of exited my business by selling off the assets in 2022. Then there was a brief lull of 3-year non-compete. And again, I'm now back in the corporate world as the head of Europe for Markson's Pharma. Before I go, quickly, I'll take the liberty to answer 2 of the important questions that you raised.
Yes.
Simply, I don't at least from my pharma perspective, I don't see AI replacing humans, because somebody mentioned about Anthropic and whether it will do away with medicinal scientists. In pharma, what I see is it's more of kind of augmented, reconfiguring roles. Jobs for certain won't get impacted. It might be the tasks will get impacted.
Correct.
Like, for example, if I have to give you an example, I mean, when we were in the labs 20 years back, 30 years back, we were doing a lot of work in, it meant a lot of wet lab trials to come up with leads and target identifications. So now, AI is typically becoming, or the formulator or the drug developer becomes some kind of an in silico architect who's able to design the lead molecule. But from then, the medicinal chemist still has to do a lot of trials to prove its biological viability and safety.
Yes.
And this answer your second question, regulators are accepting AI data, but what we have now is they want a lot of AI explainability. They want to kind of dwell on why. They are not taking it as a, gospel truth. They want to give you the background on this. Now go on, please.
No, excellent points. And I think AI is going to be, I was a non-believer to begin with, like all of us, we are taught not to believe till you experience it. I was the same way, but even to plan my vacation now, I use AI. So AI is here to stay. Whatever you might do.
Absolutely, I agree with you. It's no longer a fashion statement or a trend. It's, if you have to be successful and long-term in pharma business, you have to be AI native.
100%, yes. Venkat, you have a lot of experience, and I know 1 minute. I was the one who set up 1:30. I'll extend that a little. We're having a great time here. So, you've been around a long time. Can you tell me some case studies of how pharma uses AI, especially in preclinical and clinical, maybe? One example each.
AI in the last 5 years is expanded tremendously, both in the patented and innovative drug sector as well as the generic industry. And it is now touching upon each and every aspect of the value chain. If I have to simple tasks like in medical marketing, Pfizer you quoted, is using cases where no longer the rep goes and details out the same story to 20 different doctors.
Correct.
But they are now like kind of becoming savvy data advisors, if you will, where they are doing a lot of data mining, finding out the digital footprints of the doctor and customizing the information for him, which are useful to him in his consultation.
Yes.
In marketing, demand forecasting, AI is playing a lot of role, because in addition to usual trend analysis, they also brings in multivariates like seasonal changes, epidemiological breaks, everything, and then the forecasting integrity is increasing now. Then you have tenders or the rebate. How do you do the tender pricing? Then in the clinical industry, clinical trials industry, they're playing a lot of role in patient selection, ensuring a right kind of patient cohort is selected. There are, of course, a lot more details which can't be explained in 2 minutes.
Yes.
But that is helping reduce the timelines. Then a lot of these complex tasks like genomics library, you can't handle it. It's, I would be surprised if it's I won't be surprised if somebody says it's 15 to 20 times what the entire YouTube's data size is. So how do you manage? That's going to be managed by AI. And Then, of course, you have all those use cases in manufacturing where using the IoT sensors, you are able to do predictive maintenance. I can go on for some more, but if you have
Yeah, no, I think brilliantly said. You know, in large pharma, as you know, and now increasingly in medium pharma too.
And make no mistake, even the generic pharma, it's benefiting. Like their younger cousin Sandoz is using a lot of AI.
Yeah,
it's helping them to, you know, generics is about getting it right the first time.
Yeah.
So when you're doing the patent challenges, there a lot of role is being played by AI in identifying, then identifying if you want to tailor it, your product as a bioequivalent to the innovator. So it helps you to pick up the right kind of excipients.
Excellent. I mean, a lot of experience there and very wise words. So in the interest of time, I'm going to stop the discussion, but any one burning question that you'd like to ask our experts? I mean, I'll take one or two questions and then you can hold up the 1 minute thing. Can you, people are working on coma? Okay, well, which one of you would like to take that?
I don't know about that, but they're identifying some of the protein structures which are undruggable. But I don't know of any instances, maybe the doctor is better placed to answer.
Yeah, I think I can't comment on, your question is who are already in coma, but I think what warning signs I talked about, a very critically ill patients who is in the CCU, ICU setting, the AI can predict with certainty by analyzing the algorithm and say the warning signs and take some precautions, change the medication so that you prevent or try your best to go into not coma but prevent sepsis or infection. So I think that's happening. Now, who are already in coma, I don't have any data points to validate that.
Yeah. Okay, I think, Ramesh. Yeah. Please do, and then we'll stop. Any of you are welcome to ask questions during the break. Or the organizers, I mean, there's a couple of more questions. What do you want me to do?
Yeah.
Be rude and say no, or be nice and say yes?
No, I'm trying to be polite, but I think it's nothing like rude or polite. But my comment, any AI is not for general across it's specific to the field, specific to the case, specific. So as a customer, how would I know how good your AI model is if I'm engaging a third party? Okay. It all, again, Shikhar mentioned it's a quality of data that goes curated, validated. So any insight from anyone?
Yeah, anybody willing to answer how I can evaluate the partner's AI capability? I don't know. Any metrics you would use, or?
Yeah, I mean, so, you know, see, you know, for, if there are like 1,000 AI models developed, you know, you can arrange all these models in terms of a pyramid, and what comes out of, on top or top 1 or 2 layers is what is useful. The rest of them are not so very useful, right? So in terms of how to identify, it's not always straightforward, but you know, the proof of the pudding is in the eating. So unless we explore it and then you know, find if it is actually, you know, most of the times AI models work very well for the test sets that are, you know, within, right? So, you know, unless you go out of this distribution set and apply it to real life problems, you know, it's very, very hard to say, you know, within the
I'm actually being asked to, I think there's other, I can continue? I thought I should cut. Can you just respond in 30 seconds, and we'll take 2 more questions.
2-3 points. Because we were also evaluating models.
Shikhar, 30 seconds.
Yeah, that's one point. Plus cost is also a big factor, because these models are pretty much the same, these LLMs. Even with SAP, you can take any of the models. What matters is how well you train them. what data sets and the quality of data you have. That will differentiate it, and then how you build the agentic workflows and what use cases you have, because it should be high impact, low risk. So those things actually differentiates, rather than anything else.
Thank you so much. I know we have another question.
Yeah, so Uday, you shared your own experience of your own data being shared.
Yes.
So how did you felt, in India when somebody is sharing your data and without your notice, right? That is first question to you. And next to you, compared to the other countries in Asia, how India is placed in terms of meeting those guidelines and compliances, in terms of making sure that the data sharing is being taken care very seriously.
I'll answer the first one, and then I'll hand it over to the experts to order the second. It was very scary when they told me that they have my track record for the last 10 years, because I used the same hospital for the last 10 years. I'll tell you why it's so scary. Because in the United States, where I live on and off, your past disease history is directly correlated with your ability to get insurance and the coverage. So we do our best not to show up in hospitals in the US. Very different than here for that reason. So it was very, very scary to understand that. I mean, I don't care people knowing what my history is, as long as it doesn't have a monetary impact on me. So my big concern was, what monetary impact is it going to have for me? And there's a few other things that I could have talked, but yeah, very scary experience, yeah. Thank you. Part two of his question, if you want to answer, please, yeah.
The data, right? The data.
Yeah.
Mainly compared to the Asian countries, how India is, mature, or what actions we are taking to make sure that, these kind of things are not happening in India.
Venkat, you can also answer after this.
Add to it. So in India, if you see, right, we have DPDP, the data privacy regulation, which has just come. I mean, that came earlier, but from 2026 it will be implemented. And
so this
all
happened
the
to me before 2026.
Yes. It came, but it was, delayed because people were not ready. And in 2026, it has to be in effect. And there is always a rush with every company to get themselves compliant. So there's a big market for DPDP, what I could see. And everything, started with GDPR, which came in Europe. And it is such a complex, regulation, the right to forget. How do you balance privacy with the data you have to keep as well? So it's a very tricky, and it's very interesting. So to answer your question, now we have a regulation in India, and companies are rushing to comply to it. Let's see how this year goes.
Yeah. Venkat, you have 30 seconds of answer, yeah?
It's about the same. I thought that this is fairly good when you compare it with the other laws. That,
okay.
The changes are really good. I think government has really put through some serious thought into it.
We're doing good. Yeah, one last question. Organizers, is that okay if I do one last question?
Absolutely.
Yeah,
I think we are having a great piece of information.
All right, sure. Go ahead, please.
So while conducting experiments...
can you speak louder? I can't hear.
Can you hear me now?
Maybe you should a little louder. I don't know. I'm sorry.
I think you were good.
Can you hear me clearly now?
Yes, better.
Okay. So, So while conducting experiment, there is a lot of tacit knowledge which is lying in scientists' head. So what I want to understand is how AI can help in capturing this knowledge without putting much stress on the scientist.
So if I understand your question,
that's
you're
where
saying...
he was mentioning, how do you train the model? How do you develop in terms of prompt? And that's where I also alluded to is, it's not that it's totally replacing the human.
Yeah.
Judgment is still, in pharma at least, I can say with 200% confidence, still with the scientist. The judgment, the ethics, the regulatory compliances, everything is in human control.
Yeah, my question was something like, how can we capture those information?
How do we capture
So
information that's...
in the formative stages, I think you will have to use the prompts, what they call.
Is that the answer you're looking for? Or?
Yeah, rather than putting much stress on the scientist, is there a way where in which probably some use cases using AI we are able to capture?
It tends to be iterative, you know. You don't have one size fits all ready from the minute go. But each company might be differing.
I think just to add to that, my experience has been human intuition and intelligence is far superior to what you can get off of these essentially data. I'll give you an example. When Lipitor, which is a atorvastatin, was launched, it was the 7th statin that was launched. All marketing predictions were you're not going to make even $10 million. But when the study was done, there was a differentiation seen. Nobody had actually predicted that differentiation. And it went on to become the 7th launch product, but the highest selling ever. So I think, and it was my boss who pushed saying, let me do one clinical study because I think this is going to happen, and that was allowed. So I think oftentimes blockbusters have to be intuitive also. Just Me Too mentality is just going to be very difficult, I think. These are all anecdotal tools. I mean, these are accompanying tools that you use. But at the end of the day, 30 years of what I have learned is probably not even captured in the database there. So, yeah.
Lipitor was all about judgment. If I remember well, I forget his name. Pfizer CEO went out and bought it from Warner. Warner.
Exactly. Maybe the answer to your question lies in the topic itself. That's where the quantum computing comes into play. When you said rather than putting stress on the scientist, for example, a new phase 1 molecular target, so it creates simulations and look at drug targets. So maybe quantum computing will create that facilitation so that the scientists are not stressed, and you have so many simulations for a drug target, and you can play around with this, saying which is working better. So the scientist gets that kind of support through QC, apart from AI.
I think we'll stop the session now. Thank you so much. Please give a big hand to all of these experts who I think made the session a very exciting one. And if you need to talk to them, some of them will be around for lunch, I guess, so you can take selfies with them or whatever you want to do. But thank you so much for your attention.
Thank you very much. I think it was a very exciting session. May I now request all of you to be in stage for about a minute or so. Can I request Sai to please come on stage and have the speaker appreciation mementos given to all our esteemed speakers over here. Thank you very much. Thank you all. Thank you very much to our esteemed speakers, and apologies for the delay for the lunch, but I guess we were having information for lunch today. So that should have filled our appetites quite a bit, but now it's time to fill our tummies as well. Okay, so we'll regroup back in about 40-45 minutes. We are just trying to catch up on time over here. So I hope you had a good chance to reconnect, recharge, and continue meaningful conversations with experts out there on healthcare. Let us carry forward the momentum and have an engaging afternoon ahead. Our next panel is on the topic that is both deeply personal as well as increasingly urgent: longevity and wellness, transforming old age care. As populations around the world continue to age, we are confronted with a fundamental question: how do we age with dignity, vitality, and independence? True longevity is not measured in years alone, but in the quality of life, in the ability to live fully, remain engaged, and maintain well-being. Moderating this important session, we have Mr. Murali Krishnam, Vice President of Product Strategy for Biopharma Enterprise AI at Solix Technologies. Can we have you on this dais, please? Along with him, joining Dr. Shivaraju, Senior Consultant Physician and Diabetologist, KIMS Hospital. We also have Professor Dr. Malik Singaraju, Senior Oncologist, Founder, Singaraju Cancer Foundation. Please welcome him on the dais. We have Dr. Chandrasekhar Manchala. He is a pediatrician and he's with the Mallareddy Medical College for Women. We have Dr. Mir Raza Ali. He is a Director, Medical Operations and Quality, Multi-Specialty Units and RAS, Citizen Specialty Hospitals. We also have joining with us Vikram Kumar, CEO, Multiplier AI. Murali, over to you.
Thank you, Akshay. Hope everyone had a good lunch and refreshed. So what I do is that before profession. We have Dr. Chandrasekhar. He's a pediatrician. So he's going to bring the perspective of wellness right from the early age. Then we also have Dr. Raza. He manages medical operations. He's an expert in that area. And he's going to bring the perspective of putting empathy into practice at every stages of age, right? And lastly, we have our tech geek, so to speak, Vikram. I won't say Dr. Vikram, but Vikram, who's going to bring the perspective of impact of AI, right? So with that said, I'm going to start off with high-level questions. So, all right. So I'm going to start off with a little bit of high-level questions. When I call out the panelists, maybe a quick introduction about yourself.
Good afternoon. I am Dr. Shivaraju, working in KIMS Hospital, Secunderabad for the last 20 years. My main focus of interest is preventable lifestyle-related diseases, and I stress more on awareness about the disease, and at the same time preventing infections as such, and preventive cardiology. So I think prevention is always better than cure, and we can spend less, and we can save our lives, and we can also educate the public to a large extent. So I think I'm practicing for the last 20 years. I've seen a lot of cases, patients, and I've done a lot of research. I've been a principal investigator. I've done scientific programs as well. So I think we look forward for a better discussion. Thank you.
Thank you, Dr. Raju. Maybe I'll start with a question to you. If you look at the current India as it is, maybe if you can talk about maybe a couple of the biggest gaps that we see, right, in terms of aging, could be social, could be financial. So what do you think are the two biggest gaps? Maybe if you can talk about it.
I feel, in my perspective, the first and foremost is awareness about a disease or a health issue. If awareness is not there, then we don't know what we are having or what we are going to face in the future related to the diseases or disorders. That is the first and foremost thing. And the second thing is access to the health care. I usually try to look at geographically into different areas like cities, urban areas, and then rural areas. I think if you see the awareness, it is maybe the lowest in the rural areas. I think we have to reach out there, maybe thanks to the AI and the technology that is going very strong, and it will give us a lot of scope into this. And the other one is the urban and of course the cities, they have better awareness, and most of them, if they are middle or upper middle, I think they have better idea. Most of them they are staying abroad as well. I think they can get access as well as awareness about any particular. This is mostly in the elderly. So that is one. And then the finances also plays an important role, even though there are a lot of government schemes like RBC and other PM whatever the schemes are there, but they are not reaching each and everybody. And I think financial issues are definitely a big task, especially if they go to a corporate centers. I am working there, I know the bit of that. But even though insurance has to play a major role, it's not up to the fullest extent that I have seen. So I think finances definitely make a burden. Nowadays, most of the nuclear families, like both father and mother are there, but the daughter are outside, they are trying to fall in love, and nobody will take care of them as such, especially elderly people. There are a lot of husband and wife who are old age, they come to us and have recent lot of experience because they are trying to talk to me on phone if they have an emergency, or they are trying to relocate the resources, whatever available in India, and try to do the things. I feel that these nuclear families and then the burden, financial burden is affecting middle weaker sections, and maybe depending on the severity of the medical problem or surgical issues. So I feel these are all the important gaps that we have to fill, and it should be reached to each and every one. I think not only at the city level, but at the grassroots level, we should all strive for it. I hope things will be better, maybe in the next 1 or 2 decades. Thank you.
So bottom line, it's really about lack of access and affordability, right? So thank you, Dr. Shiva. Maybe I'm going to request Dr. Chandrasekhar if you can do a quick introduction about yourself.
First of all, I just want to thank the TAL initiative for inviting me for this wonderful discussion. I am Dr. Chandrasekhar Manchala. I graduated and post-graduated from All India Institute of Medical Sciences. with a fellowship in pediatric cardiology from Boston Children's Heart Hospital. I have over 3 decades of experience in the field of pediatrics, neonatology, and pediatric cardiology. I have a lot of interest in research. I've been doing a lot of research on this longevity as well as mitochondrial metabolism, which is the basis for all this longevity. And I'm a professor and HOD at Mallareddy Medical College for Women in Hyderabad itself right now. I worked with many big institutes around the globe like Boston and Birmingham Children's Hospital, Ministry of Health, Kuwait, and Indira Gandhi Memorial Hospital, Maldives.
Got it. No, thank you, Dr. Chandrasekhar. So the question to you is, given the fact that you engage with patients, or rather citizens right at early age, now if you had a chance to do a reset, right, in terms of how you want to set the path, would you prefer to advocate adding years to life or life to years?
Life to years, definitely, because most of the whatever we are seeing in the adulthood, whatever the problems we are facing right now, they have their seedlings in utero. They're not born overnight. It happens in utero. You need to have a proper what kind of, everybody is made up of what you eat and what you think. You can program your baby when the baby is in the mother's womb. Like first 1,000 days of life is very crucial to get a baby. If anything happens during that period, you are not going to have a good baby. So what happens is, if a mother is born to a diabetic, that is only during the pregnancy, that baby is going to have asymmetric septal hypertrophy, that is left ventricular outflow tract obstruction. They can have some congenital anomalies. If the baby is born small for dates, that is low birth weight babies below 2.5 kg, they tend to have future atherosclerotic cardiovascular problems. So all these things can be prevented in utero itself. The kind of food you eat, if the mother eats a specific food, there is a flavor bridge. The same flavor goes to the baby, so baby gets that flavor and gets used to that food. So many people are picky eaters. Many children are picky eaters. So what happens is, when they don't eat right kind of foods, they eat all junk foods, ultra-processed foods, and all these things are leading to obesity. You are seeing a lot of obesity in the children nowadays. Being a underdeveloped or developing country like India, we are seeing around 30% people are going to malls. Earlier we are dealing with malnutrition, where you don't have the food. Now what we are seeing is malnutrition. Going to malls and eating all kind of ultra-processed food, that is creating a lot of problems with heart attacks or hyperlipidemias and all these things. So we need to be very careful about what we eat and what we think. And most of the times we have to bring up the baby in a different way, like we have to infuse the ideas in such a way that we get a baby who has thought process is different, and if you eat a lot of omega-3 and fatty acids and 6N, the kind of nutrition you get, you can program your baby and they will do one of the best, like IITs or All India Institute of Medical Sciences. These kind of babies you can get. Most of the times I see many of my classmates are in US and they are very short, but their children are tall more than 6 feet. Why that is happening? earlier I used to think that our genetic problem, but nothing else. If you have a good nutrition, you get a targeted height, definitely yes. There are some genetic issues are there, but definitely both the parents are short, my colleagues, and they have a son 6 feet 2 inches like that. So you can program your baby in the mother's womb itself. So neuroplasticity. Newborn's brain has billions of neurons which are interconnected. When you give a positive thought, obviously the baby grows in a different way. There is a lot of research going on in this sector.
Thank you, Dr. Chandra. That's very insightful. Maybe I'm going to request Dr. Malik to give a quick introduction.
Yeah, thank you so much, Murli. Myself, Dr. Malik Singaraju. I'm a radiation oncologist. I've been practicing in Hyderabad since past 20 years. Currently, I'm with American Oncology Institute. And I'm also founder of Singaraju Cancer Foundation, through which we carry a lot of preventive healthcare initiatives, what Dr. Shuraju was telling. So I'm focused only on oncology aspect. We conduct a lot of cancer awareness programs, cancer screening programs, and vaccination drives.
Thank you. So maybe my next question is to you, Dr. Malik. So if you look at the global clinical trials, Indian population is underrepresented today, right? And so science is as good as the population that participates. So by enabling equitable access to global clinical trials, do you feel the therapies on Indian population can enable better aging, better longevity? Do you see any correlation between the Indian population participating in clinical trial and longevity?
Definitely, even I have been part of several clinical trials as principal and co-investigator in developing several oncology. Because there are a lot of taboo, especially people get carried away looking at movies. In movies, they show clinical trials, means they're doing experiments, making them monsters or something. So there's a lot of counseling is needed to enroll somebody in a clinical trial. It takes an enormous amount of counseling and tracking of the patient. But yes, definitely it is improving.
Do you think better education will help?
Absolutely.
Thank you, Dr. Malik. So maybe I'm going to request Vikram to give a
So I am Vikram. I'll keep the introduction short. You have distinguished doctors. I run a company, Multiplier AI. We bring speed to commercial operations of pharma. We have our own data platform, agentic, insights, orchestration.
Thank you, Vikram. So the question to you is, how can AI play a role in shaping the future of longevity and old age care? And what are the trends that you are seeing in the industry?
Okay, so when you're talking of longevity, it's keeping the person alive. Okay, and keeping the person alive, I'm trying to simplify things so people can understand. And keeping a person alive is ensuring that fatalities don't happen, right? And the top 2-3 things are, stroke, ischemic heart disease. Okay. So these are things where if you're looking at pure play AI, I think they come in probably later in this. They will not have a direct impact. I mean, I'm not saying, I'm just trying to simplify things. So let me give an example. And I'll be giving examples which convey 70-80% of the point, but anywhere, please feel free to oppose. Okay. 50% of people who go into ICUs across hospitals in India will not survive after the next 1 to 2 years. Okay, so that's the statistic in India completely. Okay, so from longevity point of view, if you are wanting to force AI to solve that problem, it may not solve that problem for difference. I'll tell you what are the tools that could be solved. AI solves data problems where you have crunching and other thing. Digital solves connectivity problems, right? Your marketplaces, you are not aware. This is fundamentally a problem that is a human regulatory problem, which means every hospital here, and these are the top ones within Hyderabad, everybody does their analysis, end of the month they know what happened. AI will not solve that problem. It will just do the analysis faster, and what will solve it is a simple one-line regulation saying they have to publish the results. AI is not needed for it, digital is not needed for that. The day all hospitals start publishing what is the mortality rate, okay, by surgeries, in 30 days, at least single digit 8, 9, 10% of that will change because it becomes very public. Okay. So longevity is a problem that will get solved. Second, when you're talking of poor sections, a lot of times when we talk about longevity, it's fitness trackers for the rich. So you have communicable diseases, right? That's the largest way. We can have for malaria good night at our home, and just depriving that cannot be substituted by a drug. So access, what was mentioned, and I think Sai's vision is also about bringing access and other things at a global scale. Okay, so AI comes as a handy tool. I'll simplify it even more. 2020s will belong to solving more problems which are health quality by AI. 2030s will be where your drug discovery and others get impacted by AI. But I'll not take away from the longer discussion. I'll just summarize that in one line why I'm saying that, because I'm making very critical statements. The number one thing when you are talking of health span is you have, cholesterol, BP, obesity, diabetes, depression. These are the ones that cause, keeping away from disease is what will keep you healthy. What used to be a role played by a mom or a wife, which is a nudge, is what AI can do, where your Apple Watch and others are pushing you to it, because what each of the doctors is saying is it's not a AI problem, it's not a science problem, it's a behavioral problem. So where AI can help is in the 2020s will be in getting this personalized nudges perfected, where it will help in 2030s is where it is going and solving with massive data crunching, bringing things that could be generational leap. Yeah.
Got it. Maybe a quick follow-up on that.
Maybe these neurodegenerative disorders like dementia, Parkinson's, where there is a chemical imbalance in the brain, maybe that AI can have a better, like they can diagnose early before the symptoms occur. Anything, any focus on that?
Yeah, so early diagnosis is again an early detection problem, and that can still happen in work. So wherever it's a personalized data detection discovery, so you told the right thing. It's a early diagnostics is one area where 2020s Apple Watches and others will discover.
Dementia, it happens, Alzheimer's or vascular dementia. As the age increases, definitely the chances are very high. Because the longevity increases, these problems will also increase. Maybe a better quality of life, identifying them early through this, and AI should be a better choice.
So on that front, so again, the way to look at it is, Dr. Shiva, you talked about early detection of Alzheimer's. Now, Alzheimer's drugs are effective only if it's diagnosed early, right? If you diagnose pretty late, none of the drugs are effective, right? And these drugs cannot cure, but it reduces the progression of the disease, right? So can AI help to accelerate the discovery of drugs, right? For things like to reduce the progression of Alzheimer's or weight loss drugs, right? Now, can it play a role to accelerate drug discovery that further will have impact on longevity and old age care?
Yeah, you want
Yeah, please
to take? Okay. So, yeah, so you're talking of AI in clinical trials, discovery and research, and I'll put it very short answer. Yes, in computation and finding the other things. No, in phase 3 and the regulatory approvals, if I'm looking at the scale of impact, which means getting a regulator to approve, okay, is a human problem and an iterative problem. So AI can cut down on the finding the target identification, and that's a fantastic use case for it. The last stage approval, it's not, digital will help, which means automating the whole thing. AI is not going to get regulators to believe what is fundamentally a wrong thing in the trial.
AI will help more in diagnostic, like rare diseases, very rare diseases. Like there are so many rare diseases. You find a lot of things on MRI, which a normal radiologist can't pick up. That small speck of thing, but AI can pick it up. Like there are so many, doctor was talking about neurodegenerative disorder, which are all there with us. As a pediatricians, we treat so many diseases, lysosomal storage disorders, GSDs, glycogen storage disorders. All these things, you have something on the brain, which we do an MRI, and we have some clues to pick it up. But most of the radiologists will fail in these situations, but the AI can make a better diagnosis, which is going to replace the radiologist. Even the chest x-rays, best diagnosis is by the AI. Echocardiogram, we look at something and we do something, we make some measurements and all, but ultimately the gold standard is AI. But whatever the data we feed, like you are getting the data from Stanford, John Hopkins, Harvard, like that, which is trusted and trusted data, you can get a 90% sensitivity and specificity. Not all the data which we feed, which when we are feeding a wrong data, we are going to make a wrong diagnosis, ultimately lead to disaster. So AI totally depends on the kind of data we are feeding. Are we good enough in Indian subcontinent? Are we getting that kind of data? Like AIMS is already top-notch institute. Recently, it is ranked 6th in the world recently. And they say they have a lot of research, their data is trustworthy. None of the institutes in the Asian continent are not trustworthy. Only you talk about British school and American schools, School of Medicine like John Hopkins, whatever, Stanford, Cleveland, you get a better data, so ultimately the diagnosis is going to be top-notch.
Got it. On that front, Vikram, since you come from data and AI, what can be done to make data trustworthiness, right? Given you'll have challenges, are there ways to kind of make it more trustworthiness?
I think somebody from Solix would have been the right people to answer that. But yeah, I'll tell you, there are three things, practical, technical, okay, and legal. Okay. So practical, so I'll come to the technical part, which is the easiest. You put traceability lineage so that there is, the source of data, you have a validation set of rules, and do that. For example, doctor's degree. I'm using very practical examples which are very domain aware. Now, how do you validate that? And that's an important part of it, because if you're going to somebody, he's got, all of these have got exceptional qualifications, and they are competing with people who are running Google Ads who kind of maybe claiming that. So trustworthy data is also about being able to first get the technical aspect right, but on the practical aspect, what data is more important to become trustworthy and how it will be used for something, insights and others. So that's a very short answer. I think it's a good panel going on, so I'll pass it on.
It should be backed by research. It should be backed by research with statistical data, significance and everything. You look at it, then definitely yes. Evidence-based medicine is taking out. We are not looking at, oh, it works, it doesn't work. It doesn't mean anything. Now evidence-based medicine is replacing everything. You need to have an evidence when you say something.
And also creating the transparency, right? And end of the day, having transparent data will help you to reproduce the outputs consistently, right? So I think that's important as well. Please.
Can I add something to that?
Please.
We have done a project for the last 2.5 years. We were the pilot project along with Siemens. We did something called the Radiology as a Service. And this project, as all of you were talking about, is basically having various algorithms running and trying to, we started off first with initial CT scans, moved on to MRIs, and then CT contrast with the coronary CT. So our journey has been a lot of ups and downs, and this is not to replace a radiologist initially, and also it is just as a guidance that can come off for the giving better quality of the report, reducing the mundane effects or the common tasks that a radiologist doesn't want to do. For example, when measuring various organs and arteries and stuff like that, so that gets quite eliminated. The radiologist works faster, better, and also has this kind of a guidance support to whether there has been a nodule or less than 2 millimeter nodule can be picked up very easily, as was Sir was talking, and also various time saving whenever it comes to the CT coronary. So these are actually our good findings, where it is more of a where we can rely upon based on various algorithms which are actually there. Unfortunately, our algorithms for the chest X-ray has not been good enough, so that didn't work out. But the CT scan and various MRIs, for example, this spine counting is very, very helpful. So people don't have waste so much of time just counting those spines. So I think there's a mixed bag. Anyways, I mean, AI is probably trying to be the newer thing of healthcare, but it has, I think, this is slowly entering inside, and also the reality is also there. So I think we have to take it with a pinch of salt and slightly move on and be more practical.
Got it. So maybe we'll pass the next question to you, Dr. Mirza. Given the fact that you manage large-scale medical operations, if in 20 years from now, right, if you want to redesign the entire care system, right, both technologically, empathetically, right, so how would you approach to kind of do a reset, like looking next to 20 years down the road?
Yeah, so I think our hospitals in India are not built for geriatric care. That's one. Secondly, I think we are maybe the hospitals in US and other places are probably they are much more ahead. And our geriatric population as of now is growing, and mostly the next maybe 10-12 years will be a larger population where the hospital people will have to consider how we actually relook at our designing of our hospitals. In various hospitals across India, at least now, wherever there is an accreditation process that is being set, at the OPD level, we definitely look at the vulnerable patients, and vulnerable patients are the geriatric population, so we give them priority. So things like that, and then the ER, where we are actually looking for various screening tools, such as whether the patient is having delirium or not. So that is various things. In during the inpatient, whether we have a geriatric ward or not. So slowly these hospital designings will have to include these kinds of lightings and these kind of friendly ways where patients don't fall in the hospital. They don't the designing of the flooring, the friendliness of moving around in the hospital, and also from an operational perspective where we have large fonts for geriatric patients and things like that. Also, most important is the transition, and where either whether at the time patient understands the what medications are being given, how we prevent harm to the patient by not giving the wrong medication, and also most importantly the whether is a transition to home care or not. So all these are very small, nascent in India, I think over the time we will have to think on these perspective, how we can also look at a elderly population and how we want to move forward.
Thank you, Dr. Mirza. So question to Dr. Shiva. So again, it's all about the preventive care, right? As I talked about earlier about the preventive versus prescriptive. If you were to look back, right, when someone is between age 40 and 50, if you can identify risk early on, what is that you would recommend to focus on so that you're not in a firefighting mode when someone reaches 70, 80 and above?
So it's a very important question related to our scenarios. I have seen a lot of young, around 20s, 30s, 40s having a lot of metabolic issues. As we all know that insulin resistance is a big topic because obesity and then having fatty livers, almost 1 in 3, 1 in 4, they're having fatty livers. So I think urbanization, access to food, availability of food anytime, thanks to our who are carrying that. So I think the food habits, lifestyle, then sedentary lifestyle, as we all discuss and we throughout our maybe last 20 years I have been telling sedentary lifestyle is important, that we have to break it up and we have to be more physically active. And then the stress part of it, we cannot define stress, but still stress is carrying by everybody, or it is a positive stress or a negative stress, it is always there. I think these are the important determinants that I feel, and of course habits, smoking, alcohol. If you see any sector, IT sector, anywhere, I think habits have been, we know the warnings, we know the problems that we get, we know the ultimate things that can happen with the smoking and alcohol, but still, is there any drop in that? No. So I think we know most of the things that in, especially the younger generation now, they are getting a lot of metabolic issues at an younger age, which is very pathetic, even including children as well. So I think that has to be clearly defined. We should have a proper protocols, proper assessments actually. We usually do in terms of health checkups, awareness camps, and a lot of things we'll be able to do. And another important thing is they're all silent. Previously, when you take an example of a fatty liver disease is because of viruses, hepatitis B and C. No, it's not. It is a fatty liver, not in males, even in females. So we call it as MASH, alcoholic fatty liver disease, which is causing the liver damage and second, and causing a lot of problems, morbidity as well as mortality. That means we are looking at the metabolic issues, lifestyle issues, which are very important, and they are silent, that we have to detect early means we have to take care of them, they have to approach the hospital or we have to go there. So somewhere there should be, we should draw a line between these two. I think it's very important and pertinent for us to take care of these issues, because nowadays, I think, as you know, even though India is a tropical country, infections are very common, but it's moving towards non-communicable diseases. As already we all agree that obesity, cardiac diseases, and then cancers in the future, they're all taking a toll on these younger as well as future generations or elderly people as well. So I feel that it becomes important for us to have a proper plan and so that they can get involved in large numbers. Mass screening should be done so that to identify them early, because pre-diabetes, we all talk about diabetes, but what about pre-diabetes? How many of them know? There are more than 60 to 70 million in India, approximately. So diabetes, as you know, is the capital of India is the capital of the world. So I think these are all important issues which are, we know it, but most of the times they are not turning into practice, or we are not trying to execute them, trying to identify them. Maybe trials or whatever, the Indian-based trials where we can try to focus on them and bring out the best ways of looking at them and trying to prevent them, because it's not about genetics, it is about lifestyle. So we have to focus on diet, exercise, as we all tell, but how many are really doing it? How many are really implementing it? I think this is very important. I think, as you said, the right question is we have to look at, see them at 40s and 50s or even 30s as well, so that they can try to prevent all these problems in the future. But once they get it, of course, the reversibility is there to some extent, but we cannot completely change because it's multifactorial. Multiple factors add to the problem, whether it is diabetes, cardiovascular disease, whatever it is. So I think it's high time for us to look into this more deeper and try to focus on them as early as possible.
So on that front, a quick follow-up, what percentage of those early metabolic diseases are due to mental health?
I didn't get it.
So what percentage of those early metabolic diseases are due to mental health?
Mental health. Mental health, I feel if you cannot see it in an isolated way, it can be related to the chronic disease as well, or it can arise from any family issues, relations. So mental health is definitely is an important aspect where we usually to discuss AA may not cover it because emotions AA may not cover. So I think this is definitely a mental child at the level of child or at the middle age or the elderly. I think one of the most common cause for mortality all over the world is loneliness, morbidity and mortality. So I think depression, anxiety, I think these are all there either alone or in combination with the diseases or disorders that we usually get. So I think we call it as psychosomatic diseases. Because when they have a diabetes with a problem, they may have definitely some anxiety or depression, which may carry it for shorter distance, shorter time or a longer time. So I think mental issues, they go along with the diseases, sometimes can be isolated or it can happen with in an isolated way. So I think we have to bring all the age groups, children, because of a lot of stress, competitive exams, they are not able to face the things. So I think middle age with the job seeking, a lot of changes, adaptability, elderly people, they are not able to cope with the disease, relationships. So many issues are there. I think mental health should be a bigger topic, and ideal person might be a psychologist or a psychiatrist, but I usually try to look at them as well, so that that part has to be addressed in a proper way, in a bigger way.
Thank you, Dr. Shivaraj.
Yeah, Murli, I'll just add one thing on that. In India, 30% of searches on healthcare are mental health. It peaks in Bengal, where 40% of the searches are mental health, and we had this data because we have some clients, and the first question we get back, is it the men searching or the women searching? That's just different. In cities, Hyderabad is lower compared to all metros, but Bombay, Bangalore, Delhi are still in that 25 to 30%. So there is a desire for those. Okay.
It may be even more, because most of the mental problems, they don't come out. Most obesity, they shy away from the society. So they tend to get into isolation. That itself creates mental problems. In India, the problem with us is we are not proactive. We are only reactive. Whenever we get a disease, we go to the doctor and get treated. We don't have any preventive health checks. Like 50 plus, we have many scans to be done. We need to look at prostatic hypertrophy, colonic cancer, breast cancer, and all these things are done regularly in US. We don't have that kind of system in India. Whenever we get a disease, then only we will reach the specific doctor. That is the problem here. If we can have guidelines like what American Medical Association is doing, then we can do it in a much better way.
Thank you, Dr. Chandrasekhar. My next question is to Dr. Malik. I know that you run your Singaraju Cancer Foundation, where you work with a lot of patients on awareness, advocacy, survivorship. Can you share your experience in terms of what you learned, dealing all those different episodes?
No, actually, we are coming where everybody is talking, starting from mental health to physical health. As I have been observing my own practice since last 20 years, more and more, now I see when we were doing post-graduation in 2002, we used to read textbook. About 45 or 60. So mostly in our OP was full of geriatric patients, above 55, 60 only. We never see young patients in our OPD. But now what is happening, more and more young patients are being diagnosed. What we used to read, example, cervical cancer, most common after 55 years. Now we are seeing as early as 30 years. Ovarian cancer we are seeing, breast cancer we are seeing. And irony is some are unmarried, some people are not completing their families. It's quite young thing. And when we are dipping little deeper, previously when we were studying, we used to tell only one thing, smoking, drinking, or genetic. Only three answers we used to have. When somebody comes up, why I'm having cancer, we used to tell, okay, you have a history of smoking, you have a history of drinking. Otherwise, we don't know answer till maybe somebody, your grandfather must be having, how do you know? We used to counter-argue and send them. But now, we are seeing so many starting from the nutrition, what he was telling, starting from childhood, nutrition, obesity, to mental illness, most of the diseases are psychosomatic or unhealed emotions. They are also reflecting as cancers. So why I brought this aspect is, there are two types of survivors. You are telling about survivorship. One is young people going through a survivorship and entering the old age, and elderly people getting diagnosed at a later age. And even the number of elderly people getting diagnosed also is increasing. One is because of more awareness that there is some problem is there. More and more people are getting diagnosed at an early stage comparatively in urban areas. So with the latest technologies, more and more diseases are being cured. So the survivorship concept varies from an young adult going into old age from the people who are already diagnosed after the age of 60, 65 years. Usually the young adults which we are facing nowadays, they have different set of expectations from a doctor. They have their career, their fitness goals, and their, really I'll tell you, these people who really survive cancer, they are much fitter than you and me, Murli, because they form a very good strict exercise regime, diet regime. They have their fitness goals, they have career goals, family goals. Most of them have uncompleted families. So the counseling survivorship is not about completing the cancer. The whole discussion is what after, because they have 40 years of active life after that. So they move with a purpose. Nowadays this word ikigai is common, Japanese word. So most of them move with a purpose and they want to give back to society. They come back to me, sir, you have foundation. We want to be part of it. Or please welcome. You are the, I call them, you are the, I won't call them survivors. I call them, you are the warriors. You are the winners. You motivate more people. This is one aspect, but the other aspect, when it comes to elderly people who are already crossing 65 years, they have a different set of expectations from their life. For them, independency, functionality, that is their focus. They want to have good quality of life. They are not worried about the numbers. What younger people, we want cholesterol to be this much, sugar to be, they are not worried about the numbers. Okay, fine, numbers, let the numbers be fine. I want to enjoy my life. I want to enjoy my time with my grandchildren. They lay more on emotions. They want to spend time with the family. They value relationship. So they want to have similar companies. So their expectations are a little different. But what I observed over a period of time, people are moving more positively in survivorship than earlier. Previously, once it was diagnosed cancer, there is a word, cancer means cancel. There is no cure for cancer. But now it's not like that. People are living happily after cancer treatment.
So post cancer treatment, do you recommend more of a balanced approach, right, in the lifestyle management, or very tight control of lifestyle management?
First of all, one should be very happy. That's most important, whether you are really following a strict diet or not. First, happiness is the biggest quotient for longevity and quality of life. I think we're already having some numbers here. Okay.
I think we're up with time. So my last question to Dr. Mirza. So earlier you talked about remote monitoring as a tech capability in old age care management. Where else you see potentially AI and technology can benefit in old age care management beyond remote monitoring? Dr. Mirza.
Okay, so I think home care services are definitely on. We're just, I think, waiting for the insurance bubble to burst and cover all that. I think in THub there are a lot of startups that have actually worked on various projects, and their projects are very, very good. And it's just a matter of time where everything will get integrated. So the interoperability of the reports that where we will be able to access all the reports, I think that's one of the very key information that where the home care will be able to access all those reports, and there's an integrated care. I think Government of India is also doing a lot of the Aadhaar number that is now going to come, and now we are being asked to put the number on each OPD and inpatient as well. So I think all of us have that number, so we just need to find out that number as well. The other most important is how we are going to look at various ways in which everything gets integrated in this system. And old age and geriatric care has their own challenges, and how we kind of need to, how the technology will have to gear up to meet all this, technology. One thing good about India is we're a very cost-conscious, nation, and we want to provide whatever services, and everyone knows that we need to optimize those services and offer then that platform. So I think very good momentum there, and initiatives like T-Hub and of course TALHospital as well. So I think the momentum is there. We just need to kind of flow in that momentum, and I think everything will fall in place.
Do you see a future for AI companions?
AI in?
AI companions.
So, yes, but I'll give two disclaimers on putting two top trends for US and for India. You have to understand how US healthcare is thinking now. So 50% of the money is in hands of people who are 60 plus in US and in most developed countries. So that's why when you're looking at high-end stuff, companions and others, they will be there and they will be integrated with a lot of things. In India, the biggest thing happening is digital more than the and I'll just extend from the telehealth. The number one thing happening right now in the home healthcare or other things is basically quick commerce, bringing you whatever tablet you want to your home in 10 minutes. Okay, so there are more consultations done every day on Zepto and Blinkit than done by the entire state of Telangana. Okay, and what that has resulted is in healthcare turning around. So they have launched now home care, ambulances, the entire pipeline coming home. So for the rich people in India, which is this set of people who can order online and others, access is solved, and the end goal of treatment is like I get the medicine I think I want will happen, more than that I talk and go with a continuum of care, that I go to a correct diagnosis, I go to a doctor, I have a companion who gives me a nudge and other things. So in my opinion, I think that's where. Third trend is hyperscalers, which means you have everybody from Amazon to Google, and Solix has a fantastic tech platform who's bringing you companions. So it's becoming easy and easy to get better healthcare companions at a click away.
Thank you all. Excellent discussion. Hopefully this was very helpful for all of you. Thank you, everyone.
Can I say something? Just, I want to give you 4 pillars of longevity. Keep moving. If you don't move, your years will get reduced by more than 10%, 10 years. Keep moving. That is the best technique you can do. If you are sitting for a long time, just keep moving, or do some soleus push-ups like this. It will help you. Keep hydrated. Drink plenty of water. Exercise every day. Nutrition, which I have talked about already. And good sleep. Whatever you are getting a sleep, you quantify your sleep with a good rings are coming. The smart rings, auras, Rincon and all. How much you slept, what kind of sleep you have, REM sleep, NREM sleep, deep sleep. If you can quantify these things, there is no need of a doctor at all. You should have some preventive checks. Above 50, you need to have adult vaccination, pneumonia vaccination, influenza, and meningococcal. That's it. You will do very well. And some supplements to support you, basically. We don't take any supplements. Whatever we take in India, they're not good enough for us to carry forward. We need to have antioxidants, vitamins, minerals. If you can do these things, these are the steps given by one of the famous David Howard Tucker, who lives in New York. He's a practicing cardiologist, 1 or 2 years old. Even now, he sees around 30 patients a day. And he's so cognitive functions are so good. He makes the diagnosis absolutely perfect. But we are declining because we are not moving. because the body needs two circulations. Lymphatics, until unless you move, it won't get circulated. Arterial, anyway, it will get circulated because it pulsatile. Venous and lymphatics, they never circulate. They stagnate and you will have a lot of problems. All these are, and the kind of food you are eating, keep your gut microbiome healthy. Eat a lot of, fermented foods. You start a day with fermented foods, you will live longer. But none of them are doing. People are getting fecal transplants. They'll take the feces and they are getting transplant. Best people's feces are collected and they're making transplant. Even AIG is doing now. They're charging a lot. Why do you do all these things? You have everything in your hand. Why do you buy shit? You need to have your own shit which is quite competent to defend your diseases. That's my sincere request for you all.
Well, that was just not shit. That was the most precious advice that you have ever given out. Our audience has heard about. Thank you very much. May I now request Murli to give the speaker mementos, please. Thank you very much. Thank you, everybody. Well, we have been so very fortunate to have all these eminent people over here and try and give all this advice. I think we feel blessed. Okay, I'm really honored that we have such a great speakers over here. And as we continue our journey, we are going to be talking about the next opportunity that we have as far as the overall growth of availability of the medicine is concerned. We are going to be exploring how the medical access, the global medical tourism industry and India's strategic role. And we have all been seeing that India has emerged as a global powerhouse in medical tourism. And it's basically offering world-class clinical combined care combined with accessibility and cost effectiveness, which is very, very prime when it comes to medical care for the individuals on a global stage. Having said that, our next topic, medical access, global medical tourism industry, India's strategic role. That's the topic, and we have a moderator over here. May I now invite, please, Dr. Bala Vidyadhar Maladi. He is the program head, public health and research at Pushpagiri Vitrio Retina Institute. Dr. Bala. May I also invite Dr. Mahendra Pala, Group COO, Omega Hospitals. Can I now invite Deepika Grandhi, India Business Development Head for Cleveland Clinic. May I invite Dhruva Srinivasa Chakravarti, Global Chief Operating Officer, Human Care Worldwide. Dr. Saptarishi Ghosh, CEO, SCEI, Symbiosis Center for Entrepreneurship and Innovation. And Dr. Annie Thakur, Group CEO, Pranam Hospitals. Give them a round of applause, please.
Good afternoon. I hope I'm audible. Yeah. Very good afternoon, all. We are actually going to discuss, I think, the most relevant section of today's Health Fest. And we thank TALHospitals and the esteemed dignitaries who have joined me in giving me this opportunity to discuss this important topic. So our topic, medical access, global medical tourism industry. It's very important that we know that it's an industry, and what is India's strategic role. So before I go into the panelists, I'd like to just give out a few numbers that are available on public platforms. So of course we know that we have rising healthcare costs, some of the challenges we already discussed across the day. We have aging populations, a lot of chronic disease burden. There's shortage of healthcare professionals globally, at least the qualified ones, and patients are seeking higher quality care at a more sustainable cost. So what is it that India has to offer? First of all, like all of our panelists here, we have a lot of globally trained doctors and surgeons and health professionals with a supporting ecosystem. Our biggest USP, we can offer whatever that the government, that the globe is offering at 60 to 90% lower treatment cost than the Western countries. We have advanced tertiary and quaternary health hospitals and organizations that can match up to any standards globally. We have a strong pharma, diagnostics and medtech ecosystem. Tech has never been our problem. We absorb tech very quickly. And more importantly, we are a diverse country, so we understand cultural sensitivity. And we are an English-speaking workforce. Here we are working in India on a health fest and all of us are speaking in English. So that is a credibility of the Indian ecosystem that we all adapt English. And of course, we are digitally ready all the time. The digital health readiness and the telemedicine reach is something that is on public domain. So according to the government of India's central government website, it says that 2 million patients visit India every year. Now that's a very vague figure, I feel, because how many of them come for medical tourism? How many of them actually come for undergoing a procedure? How many of them come for just getting a second opinion, or even for a Ayurvedic treatment or a wellness tourism? So the numbers, I feel, are vague, and we will be discussing all of these in detail. So I begin with each of my panelists based on the expertise and the domain that they work in. So we will be discussing India's evolution and what needs to be done. So I begin with the gentleman on my left, Mr. Mahindra Pala sir. You've been working extensively with the hospitals ecosystems as to bringing patients from globally as well as the countrywide to Hyderabad and to your ecosystem. Please talk on what India needs to do and what is happening also.
Thank you, Bala, and thanks to TAL team for organizing this event and inviting me for this panel discussion. So before we talk about the medical tourism, international patients, foreign patients, we are sitting in Hyderabad. I think we should talk about what is that Hyderabad is contributing to other states, especially the non-Telugu states out of India. So just to give you some numbers, Hyderabad currently as a landscape, as a market size, is around 1,000 to 1,050 CR per month. Out of that, you'll be surprised, most of the patients come from Jharkhand, Maharashtra, other places, especially in Karnataka and in the central India. And that contributes around 250 to 300 crores of Hyderabad market. And when it comes to the medical tourism, it's very minimal. It is really very minimal. It's hardly 60 to 65 CR per month. The reason? The connectivity. As we go to the national level, because I closely watch the numbers, very closely work with investors. At the same time, I keep a track of a competition landscape. When it comes to India, I'll just give you some numbers on the, for example, Apollo Chennai, it treats around 2 lakhs patients per annum annually. And Fortis has 40 hospitals, treats patients from 88 countries. And most important, at a fraction of cost, Narayana Health does around 30 plus cardiac surgeries per day. So these are the things which attract medical foreign patients. So actually on ground, before we get into the real time on ground, how the medical tourism is working in India, West has taken almost 80 to 100 years to create that healthcare ecosystem of theirs. But India, since the last 2 decades, has rapidly increased their entire healthcare system, which somehow they made it low cost, accessibility, and the most ever we're trying to do the transparency also. As we say this, today, you take any of the metro cities in India, getting a robotic surgery is far more easier than securing specialist consultations in UK or US. So how the really on ground the medical tourism works is, today the foreign patients are looking at not only the hospitals, they are looking at city tiers. So tier 1, especially Delhi, Bombay, Chennai, Bangalore, Hyderabad, foreign patients are looking for the complex, multidisciplinary organ transplants. These are the areas they are preferring for their treatments. Why? The 4 things. One is the specialist, the senior specialist availability in the metros. Second, the connectivity to the metros. Third, state-of-art technology. And fourth, the Indian culture, the people, accessibility to the doctors. So while I say so, the tier 1, tier 2, the people, especially when it comes to Pune, Ahmedabad, and these places, people go for a very selective procedures like laparoscopic surgeries, IVF, urology. Because here, the people, why they're preferring is, it is 25 to 30% less in price compared to tier 1, and more accessibility and faster recovery. When it comes to tier 3, like Surat, Indore, and Trichy, people are going for a very low risk diagnosis and regular procedures, and most important, the most affordable, and one of the most important is access to the doctors, the personal access to the doctors. While we say so, there are some wellness hubs like Goa, Trichy, and Goa, Rishikesh, and Kerala, where a lot of global travelers attract and prefer for yoga, Ayurveda, and these Ayurveda and preventive things. So in 2026, there are only 2 things which really work on ground, and the most important thing that matters would be the cost and the turnaround time to accommodate patients without compromising on the clinical outcomes. So that would be a game changer for the India.
Thank you, Mahinder sir. I now move to my extreme left, Dr. Chakravarti. He heads Human Care Worldwide Limited, and he's extensively working in the process and the pathway for creating world global tourism access, medical tourism access. So please elaborate on the structures that are available. What are the pathways for a patient to come to India? How do you operate? What are the roles of the stakeholders? Please elaborate.
In adding to Dr. Mahindra's wordings, in my practical experience of medical tourism, I feel the real opportunity for India is not medical tourism. The real opportunity is India leading as a medical tourism hub. The leadership is very important for an Indian context where we attract the more crowd. Now, how will the more crowd come? Today, the future is not where the patient travels. The future is how care travels with the patient seamlessly. So the care should be traveling with the patient seamlessly. Are we providing it or not? The leadership matters here. So the strategic growth comes here. What patients see is not where he's getting the treatment, but he sees at the commitment, he sees how easiness it is, and what is the outcome, and faster, the speedness, and of course the transparent pricing structure is much required. So what I feel is India as such should be a global healthcare medical tourism hub by changing the concepts of the leadership where it becomes the medical tourism leader in the market.
So I also wanted to ask you about a little bit on how is international finance and insurance support happens currently, and what can be improved upon.
Yeah. So yes, as such, there is a lot of drawback in this medical tourism industry where there is no cross-border care, proper insurance is being happening. So we should be starting like TAL took an initiative of bringing all the platforms under one. We should have a digital wallet, health digital wallet, what we call is, where all they are directly connected with the global insurance, where there is no middleman available. The patient can directly contact to the hospital through the platforms that are available. So digital wallet is one option what we can have. And we can also have a global concierge model where all the travel, means a case manager should be allotted to them, where he takes care of the insurance, the process, the methodology, the admissions, the discharges of all the patients across the platform. So the platform should be supporting in that way. And even the insurance companies, there should be a policy reform where anybody can go ahead and take care of insurance globally. That can happen only when all the insurance companies come under one platform at the global level. There should be major policy changes, what I feel.
Very interesting. I now move to Ms. Deepika, ma'am. You've been heading Cleveland Clinic for some time now, and I think what are the key points that agencies like the Cleveland Clinic look for when they are wanting to collaborate with bodies? Is it quality data? Is it having a platform like Sir mentioned? Is it a registry that is validated? Or what are the things that you look for, especially in an international organization?
Hey everyone, thank you so much to TALHospital Group for giving me the opportunity to share thoughts. And having worked 10 years in the US and 10 years now in India, I think the answers have not changed. When global organizations such as Cleveland Clinic come to India or seeking collaborations, or when vice versa, when hospitals in India want to collaborate with organizations such as ours, it's a very simple ask, which is transparency of outcomes and data. I think whether it is a patient traveling from India to outside, whether it's outward tourism or the other way around, I think one cannot undervalue the importance of data and transparency. So I think that's number one ask. And I hope to see more and more registries in India and more transparency when it comes to public reporting. I would say the government's role will be instrumental. And one example I'd like to share is that of UAE. In the last 8 to 10 years, there have been more than 200 hospitals from that country that have achieved JCI accreditation. And it's come from a government mandate and government support. And when hospitals or patients are looking to India, I think that's going to be a huge enabler.
Thank you, ma'am. And it's a nice segue. Now I move to Dr. Annie, who looks at what Madam has suggested, that is having accreditations, standardization of quality of care, and training your HR. Can you elaborate on what can be done or what is being done with respect to creating a standardization of care?
Thank you, Dr. Bala. Good evening, ladies and gentlemen. I'm Dr. Annie Thakur. I'm the Group CEO of Pranam Group of Hospitals and almost 28 years in the industry, last 18 years in the CXO level. Apart from that, I'm a NABH Principal Assessor. So coming to the question, what I believe, because I'm a person who is traveling globally, being a global CEO as well. I've been in African countries, in Malaysia, Canada, a lot of countries where I have traveled. My main interest was to see the medical, how it is getting in these countries, implemented, what is their process, and how do they take care of the TATs, various TATs. Maybe it can be the consultation process, it can be an admission process, or getting the comfortability of the relatives, patients, and preventive health checkup. I see something very interesting. Believe me, I'm always proud to be an Indian. I think even every country I go around, I still be an Indian, because our medical tourism, our medical accessibility is best in the world. So what I observed was that, here in India, we do have everything experts. I mean, if you take the doctors, they are experts. If you see the infrastructure, it having an expertise. I mean, everywhere, end to end, we do have our expertism, which is one of the showcase for us. So coming to the medical tourism, I mean, when we talk about medical tourism, it is only concentrating on individuals. But I would like to elaborate in a different level, that is medical access diplomacy. It is focusing on the population. So India as having the hub for the medical treatments, it has the position to keep India as a medical access diplomacy through various governments and various accreditations and showcasing our excellent clinical services. So many of the major things, when we do know it is the best, we do have some issues within us. Number one is trust, because any foreign national, they don't bother about the financial aspect or it is a clinical outcome. And first thing what they wanted to have is the trust, they are treated well. And second comes the clinical outcome, what we promise to deliver. And third comes the financial part. So I think this is one of the area, the quality, because before it was something like JCI accredited hospitals and even NABH having an MVT accreditation. Any hospitals in India, any hospitals you wanted to have for a medical tourism, you can check in the website of NABH. It is an MVT accreditation which will easily, it is recognized across the world. There are a lot of accreditation prosperities for us, but then how this accreditation is going to help the people, are we going to step up? Are we ready to step up into the expectation of the people around? And second, are we going to give the same importance to our domestic patients? Because many of the time what happened, the treatment given to these two segments, domestic being in Indian and medical tourism being a foreign national, what is our stand of it? So when it comes to HR, I think hospitals infrastructure is important and even medical facilities are important, but everything goes into a toss if the manpower who is dedicated for the care is not delivering the way that has to be. It can be a surgeon, it can be a physician, it can be a nurse, it can be a housekeeping, or it can be a security who is. So it is a chain of the things when you talk about the thing. So I truly believe India has great potential and one of the greatest nation in the world, which we are now into 4th level of economy in the world, where we needed to be. I think it is our major responsibility, and also we can do it if we do have a collaborative way of managing everything, getting medical access diplomacy in place, because that covers the population, not the individual, and it brings the India into a medical hub in the top one in the world. That's all I want to say.
Spoke like a true quality person. So now I move to Dr. Ghosh. Now why I kept him towards the end is to combine all of this through effective technology. So as sir at Symbiosis, you are nurturing startups, you are teaching people how to use AI ethically, you are teaching people how to use tech in multiple different sectors. Sticking to healthcare, how do we use it for creating a good, effective medical access through innovations and technology?
Thank you, Bala, for this wonderful question. I would like to thank TAL and a very good afternoon to everybody. So before we go to technology, a lot of panelists here have spoken about the right intent. It's very important to prioritize the right intent. And my co-panelist just now spoke about the need for what you call as transparency, digital transparency, as well as procedural transparency. It is also important to have good governance. I think that is a fundamental question. Do we have that? We are fortunately in the city, what we call as the city of biryani. So if I have to understand where do I get the best biryani in town, possibly I'll have a dime a dozen apps which can tell me the types of biryani, the spice levels, the reviews, and so on and so forth. But then, if I have a cerebral hemorrhage, and I want to understand the same level of intricacies in terms of which doctor to go, which hospitals to go, what are the cost implications, what are the, what we call as insurance that are valid. Forget about people coming from abroad. People who are pretty much part of the same city will find it very, very difficult until unless they know somebody personally or they know somebody who knows somebody in the ecosystem. Fortunately or unfortunately, India works on one-on-one connect. So AI will obviously further the approach. But then what we need to do is we need to understand that it has to be a unified approach. It cannot be a hospital-driven approach. It has to be a neutral body, like a platform. So it's very important to create a platform. So when you create a platform, you bring everything together. You promote good governance, you promote transparent practices, and there's an effort that you need to take in terms of capturing all the intricacies. So if somebody, say for example, is looking at India from Middle East or Central Asia or Africa or even SAARC countries, which is where majority, 75 to 80% of our medical tourism happens from these zones. What we need to understand is, are we giving them enough information holistically? So one of the methods by which we can do that is by utilizing a digital triage. And how do we do this? The first thing is, operative practices mostly have multidisciplinary approach. So are we able to bring in a virtual team? Are we able to bring in a virtual team in terms of multidisciplinary approach and consult the person online? The second is, after the consultation, of course, we can tell them to get the reports in place, and how do we use AI to diagnose these reports and give them a basic understanding. That's the second aspect, the diagnostic part using AI. And they can also send it to the doctors who have consulted, so they can also give their opinions on that. And they can take a second or maybe a third. If I do not consider the AI's opinion, then maybe a second opinion. And if I consider the AI's opinion, maybe a third opinion from a different set of doctors from a different hospital base, as to, are these people all in sync? So this gives a lot of credibility to the practice at large, which I think is the missing link. So this is something which has to be created. So everything under the system has to be built in, right from the visa access to the hedging of currency, because there'll be currency fluctuations, to the hospitality aspect, because the patient will be accommodated with multiple other people. So the hospitality access in India, the hospital access in India, the procedures that are being given, the timelines, the dates, the cost, the associated pre-operative and the post-operative procedures, if in case they are going back, if it is a therapy and if there is a pre-operative therapy which can be provided in India, what are the locations, what are the cost of these, what are the time durations that you need to avail these. If you have to go back, are you having hub and spoke model with hospitals or clinics in other parts of the world, wherein those doctors fundamentally who are associated with the principal hospital here in India, they speak and they do consult those people once they go back to their native countries. So all of this has to be built in as a platform. So this integration of all these data points is very, very critical. Of course, AI will give you results. AI depends on the models that you feed in, and those are the data points. So until unless you have the right data points to feed in, AI will be short-charged as a tool, is what I feel. So the idea is to create a platform. The idea is, this has to be a collaborative approach, and we have to look at it not from an individual perspective, but from a holistic perspective, from a nation-building perspective, and this is how we can go towards a Viksit Bharat. Thank you.
Excellent point, sir. And again, giving me a good segue into governance. You mentioned governance and creating, the ecosystem for a Viksit Bharat. So I want to discuss the role of the government. I know it's a challenge. We all have challenges. We want to discuss what it can do from a policy-wise, from infrastructure-wise, from a branding perspective, and from the digital innovation space. So I'd like to give back, again, I would give it back to the panelists, to Mahinder sir. Can you discuss on what are the challenges that are existing with respect to policy, governance aspect, whether it is visa, whether it is insurance? Please elaborate.
I think apart from the treatment, there are few critical gaps beyond the beds. I think government has to seriously look into. First is about getting the medical visas. It is minimally, I think it is taking 2 to 4 weeks. That's the biggest challenge. Maybe we need to partner with fast track services, visa fast track services, or activate Ministry of External Affairs to resolve these things, maybe trying to get this medical visas maybe from within 72 to 96 hours. So that is one part. Second, even the coordinators, when there is a lot of problem with the coordinators, especially after post discharge, the continuum of care is again that is the internal challenge of hospitals, not the government. But otherwise, this has to be we seriously see that it's a critical gap there, and especially when it comes to the patients from Saudi and other places, non-speaking English people. Again, the interpreters, there are the challenges. When it comes to the government, I think the one more area would be like the connectivity. The connectivity, we have to boost the connectivity to the metros. When it comes to Hyderabad, I will talk more about Hyderabad because being this TALHealthFest is organized in Hyderabad. Hyderabad has only direct 22 connections, 22 international corridors. But when it compared to Delhi, Mumbai, and Chennai, it's quite far. So the more the connections, the more the people. So as I said, the numbers are also very minimal compared to the entire market size. And second, as the international insurance tie-ups, I just learned from Chakravarti that there is a channel to get the international insurance tie-ups, but especially Tier 1, Tier 2, and Tier 3 cities, people are not aware of that. Maybe IRDA has to pitch in and say that there should be a separate vertical who can manage this international insurance company tie-ups, so that people, when they search, as I said earlier, people are searching not only the hospital, they are searching the cities also. So that would be the second point. And third, what I see that just for information, during the COVID, Hyderabad was the only hospital which has done maximum number of lung transplants. So that part of time, there was a lot of, the government is supported. Still today what we do is, whenever there is a cadaver transplant going on and the organ shifting, they do create a green corridor. Can we do something similarly like health highways? I know, and the government has to think about that, the health highways. I think Hyderabad is a little bit infra-wise, it is mentally prepared and done some work, because once you cross the airport, for Cyberabad zone, which is health hub now, just 10 years back, there were 2 hospitals. Now there are 16 hospitals with more than 250 to 300 beds, and consolidated has more than 4,000 to 5,000 beds. And this is connected through ORR. So these kind of things, I think government should get into the health highways and connecting people, and getting the international insurance companies through IRDA and boost connections to our airports. Thank you.
Thank you, sir. I now move on to Dr. Chakravarti, sir, who's extensively working in air ambulance, global medical support, global consultations. Challenges in the infrastructure, in the ecosystem that you've observed, sir, because you've been working extensively in that.
Yes. See, we shouldn't concentrate on any strategy today. It is a decade. In the future, after a decade, countries will not fight for tourists. They're going to fight for patients. Sure of it. So keeping that in mind, first thing is we have to strengthen our leadership, our cross-border inbound leadership in the society. So let us not treat healthcare anymore as a service sector. Let us treat it as a national diplomacy. Let us go to that diplomatic level where India has to be enhanced by all means, by quality. Now, we are talking about quality. Quality shouldn't be end with a paper. It should be visible, it should be verified, and it should be trust building. Till now we spoke all about frames, prompts. Now, in medical tourism, we need to talk about trust calculation. So we need to have a global register of trust calculators, of hospitals. Let all the Indian doctors be given the rights to do telemedicine across the globe. Let us have a corridor, a green corridor, as sir told, not limited to our country. It should be cross-border corridor. Any patient who wants to come on emergency care to the country where he wants, of course, where he wants to go to the country, how they attract with their leadership in the medical tourism, how they improvise it. As I told you, trust score. Once you start giving the trust score, the more the trust score, the country is in demand regarding the medical tourism. The data should be transparent. The data should be visible. It should be calculated in such a way that as AHRQ does, they publicly display the value. So blockchain should be implemented where the data cannot be manipulated. The outcome should be registered. So the trust comes through outcome. So now medical tourism is not only single country, it's a global healthcare. So keeping that global healthcare in mind, some small changes in making it as a national diplomacy topic, small changes in bringing in the rights to the Indian doctors where they are more talented, more clinically talented across the globe, giving them the rights to practice everywhere, at least by telemedicine, giving the first consultation, second consultation. Now when the patient comes, create a corridor, India-Africa corridor, India-GCC corridor, India-Saudi corridor, create a corridors so that the corridor plays as a role of a visa on arrival. Well, let us not talk about visas at all for critical cases. Let it be visa on arrival because they're coming for care. So these small things can be simplified, but everything can be done in India only by creating the real-time factor, building the trust core, and making it as a national diplomacy. Only such changes only can bring in change to the medical tourism.
Excellent, sir. So you have a point.
Actually, as mentioned by Deepika, that UAE government has promoted this JCI and NABH accreditations. I think it is a responsibility of the government to also as a part of Heal in India campaign, they should promote these accreditations to the hospitals, not only tier 1 but also the tier 2. That is becomes very, very important.
Thank you, sir. So now that sir has mentioned creating trust, I move to Deepika ma'am. How do international agencies trust an organization? What is it that you're looking for apart from data and the registry platforms? How do you judge whom to collaborate with? And of course, how much you can share what you can. You don't have to share everything. How do you create that trust, and how do we promote India basically as a medical access hub?
Sure. I think I want to divide my response into two aspects. One is from a patient standpoint, whether a patient is traveling from India abroad or the other way around, and the second aspect is really clinical collaborations. So I feel based on the hundreds of patient inquiries I get and a lot of patient journeys that I have mapped from patients traveling from India to US, UK, UAE, I feel patients really make emotional decisions before they make financial ones. And India clearly has a financial cost advantage compared to many countries across the globe when it comes to high quality care. But like we talked before, how do we enable that trust? And I want to give some examples of at least how we have enabled trust among patients traveling out of India. And I really believe Indians are very smart, smart shoppers. So when we get those inquiries for when patients want to travel abroad, the first few questions they ask is, what is the experience of an operator or a surgeon? The second question is, do you have any data that you can share? And then, of course, everything else is experience and logistics. So we've plugged in a few technology and data aspects in our workflow. I would say one is the CVs and bios of our physicians. They're very transparent. Every Cleveland Clinic physician has a bio, which is very standardized. It talks about which medical schools they've graduated from, the years of experience, how many procedures they've done, some of the patient story videos. All those links are there that we can easily share with the patients. And then we give them an option to do a peer-to-peer teleconsultation call with their local treating doctor. And this is a very comprehensive call where we collect their medical imaging data, the symptoms. It's very comprehensive. It's a 1-hour call where the surgeons or the physicians go over the suggested treatment plan in detail. So they talk about why this procedure is necessary, what is the urgency, and what is the surgical approach also. They go into the details of how they would approach the procedure. And last but not the least, then we share financial estimates at that point and refer them to our Global Patient Services Department that will again talk about the logistics. So that's typically, a patient journey. Now, in terms of the second question as to what a US hospital or an international hospital is looking for when they collaborate with India, so of course, I would say data first, but we're also looking at other aspects. One is stability in leadership of the hospital, stability in the government, availability of governmental support. We also look at the culture. So we have a survey sometimes that we roll out. It's called cultural alignment, where the leadership values, are checked against each other. So it's, I think, multifactorial, the decision. And of course, whether there is an inclination for patients first culture, which is Cleveland Clinic mission and motto, and if the organization is research oriented and research driven.
Thank you, ma'am. So now that you've highlighted all of these places, again, the platform comes back to how do we create that data. So I'd like to ask on behalf of the government. So for something that the government have to do, what kind of innovations are available, Dr. Ghosh? What kind of innovations or opportunities are open for, the digital aspect of this to be standardized for the government to uptake or to monitor?
So the government basically operates various incubators, business incubators across the country, primarily under two heads. One is the Department of Science and Technology, DST, and second is the Atal Innovation Mission, AIM, where you have the Atal Incubation Centers, AICs. So there are a lot of grants which are available, especially in deep tech. If you are talking of blockchain to standardize data, if you are talking of AI to interpret those data points, there's a lot of grants which are available. There is a lot which has happened in the past, and there's more which is happening as we speak. So far as governmental support is concerned, there's a lot of support. Also, another very pertinent thing which government has done is it has directed corporations to kind of utilize 30%, that's the max level, 30% of the CSR towards promoting innovation. So that's a huge welcome step from the government, and that will really help in taking things forward in terms of med tech and tech-enabled healthcare services. So there's funds which is available, there are platforms, there are some 1,200 odd incubators in this country right now, and it's only increasing. There are expertise available, it's the best time now. If somebody wants to do something in tech, especially targeted towards medicine or healthcare, there are a lot of private equity, venture capital, angel and family business fundings also which are available. So it's the right time. There are a lot of people who are trying it, but then again it is interdisciplinary. You need to bring in a good confluence of people from the medical side as well as the tech side. So this is something which is what is the challenge, because under the current regulations, if I'm talking of the academic regulations, the people who study medicine do not understand so much of tech for obvious reasons, because the curriculums are different, and the vice versa. This is also something which we have been trying to build a bridge across at Symbiosis, and to some extent we have been successful as well. So as we speak, we are also trying to form some collaboration with the help of Solix and come up with a drug discovery lab. So we are working on those platforms with on those technology levels. So I'm sure that others are also doing it, and there will be a lot of technological enablement which will happen in near future. Thank you.
Excellent, sir. So we've discussed infrastructural and ecosystem challenges from the data standpoint, what are opportunities for innovations, and we've also discussed what kind of training and ethics that we need to maintain whilst we build our capacities with respect to our hospital ecosystems and our healthcare ecosystems, and how governance covers all of this. So I leave the panel open to all my panelists. What does the future look like? How do you foresee India's position in the global medical access movement? It's an open question. What are one aspect that you think that we have to stress on, whether it is trust, privacy? I'll start with Dr. Annie because she's...
Yeah, here I just want to highlight one incident which I have, came to notice. I mean, I was just been a witness for it. While I was traveling to Nairobi, there was a hospital, there is a hospital now, they have closed it, owned by an Indian doctor. So there was some issue, and there was legal issues coming because it was a transplant unit, and somehow there were a lot of non-compliances related to government policies and all this stuff. Ultimately, the hospital was closed down. So while I was visiting the doctors across, and I was just talking about our facilities, they were just laughing at me saying that, see, your doctor has come and done like this. So I think one of the major important thing is, like, while we are talking about the policies and the things in India, we also need to have a protocol and policies for the Indian hospitals or Indian groups who will be putting up hospitals in foreign countries as well. Because ultimately it is a nation's name, nation's trust, because something happens there, they will not have that trust to come to India to take the medical, because they are seeing it in their own land. So that is one of the area I think we need to have a major deliberations to see that are we going to have a uniform protocols, policies in India and outside India. Second, what is our criteria to ensure that different players in the market can have the medical tourism. Same time, it can be a bigger hospital, it can be a smaller hospital, but then the outcome is never compromised and the trust is always built in. That is some of the deliberations we need to look in when we look in for the future. But as India has a great future and it is going to be one of the world top medical hub for the world, but then in order to keep it sustained, to reach in the level, what is our activities as the people we need to work on, and at the end we are the winners.
As of now, medical tourism in India is working in silos. It's mandatory we need to bring in an integrated system. And the system should be in such a way that the entire world sees India to be, I can trust India with my life. So this slogan of India should go across the globe, where once we create that system by creating small things, create medical villages, recovery villages, so much of space, so much of people, so much of facilities we have in India which are unused. Create such atmospheres where the foreign people, anybody feels that yes, India is safe to me by all means. Rehabilitation, corridors, airport lounges, whatever we can do. There's so many things that can be done at a very less cost, but everything is again connected to the diplomacy in India as a policy making situation.
Dr. Ghosh?
So there are 117 unicorns as we speak, and 7 of them are from people who are medical practitioners. That's the good part. So there are lots and lots of medical practitioners who are becoming entrepreneurs. That's a promising aspect because it's easy for them to understand technology rather than tech people understanding the science of medicine. It also kind of extends to medtech as well. So there are various programs which are launched across the country, and we are also launching one such program. The idea is that more such medical practitioners can become entrepreneurs, develop these platforms, develop medtech products, and launch it in the market because they understand the nuance better. So I think that's the way forward. The intent is there. The platforms, as in the enablement ecosystem is already there, and all they need to do is walk the path, and which is what is happening as we speak.
Great. Ms. Deepika?
I think India is very uniquely positioned in that it provides high complex tertiary care, but alongside we have a very rich history of Ayurveda and Ayush. So I think wellness, lifestyle medicine are some of the areas where the world is looking to India, and I'm so grateful to the current government to have included all of that as complementary medicine in addition to the traditional medicine. And I think the future is going to be around personalized medicine, genomics, and I think India is the North Star. The world is looking at us when we are talking about AI. So I think we are well positioned to set the stage for medical tourism.
Mahinder sir?
We should, the outlook can be, you see, we should continue to keep our cost low and also accommodate patients. That is the minimal turnaround time. While we are doing so, I think there are 2 things what I strongly feel the next 4-5 years. If you can correct the connectivity to metros, tier 2 again, direct international corridors, that is one thing. And medical visas, which is really on ground, there is a real problem. People are struggling. After 4 weeks when they come, they have to go for redo all the investigations because there will be a lot of changes, especially when they come for treatment of oncology. So I think these are the major things what I strongly feel. As Deepika said, we'll be definitely very proactive in extending the quaternary care at a fraction of cost. I think that should be focused. India, as a government, they should promote not only the accreditations to the hospitals, but outside world they have to promote all this quaternary care, especially the transplants. Thank you.
Spoke like a true operations head. So if the organizers permit, we can take 1 or 2 questions from the audience, if any. We are running out of time. Yes. So thank you once again, TALHealthFest, and everybody who's involved, the organizing group, for giving us this opportunity. I thank all my panelists. We look forward to more discussions. Thank you.
Can I request Suresh to please come on stage to give us the speaker moment first, please? Thank you. Thank you. Thank you very much. Thanks, Suresh. So let's now turn our conversation that has long been spoken about in whispers, but must be addressed openly and compassionately. It's a topic on mental health, which is primarily thinking and beyond the burnout, digital mental health, and breaking stigmas. Well, mental health is not a luxury. It is a fundamental human health, productivity, and quality of life. Creating access to mental health support is essential to building healthier individuals, workplaces, and communities together. To guide this vital conversation, we have with us, let me invite on board Dr. Joe Lancaster. He's Vice President of Enterprise AI at Solix Technologies. Let me also invite Dr. Uday Gautam, Managing Director and Chairman, Gautam Neurocare Hospitals. May I invite Dr. Vijay Praveen, Managing Director, Lead ENT Consultant, Meraki ENT International Hospital. Dr. Purnima Nagaraja, Psychiatrist. Ms. Anukrishna, she's Horizon Aware Women's Community. She's from the Horizon Aware Women's Community. And Rama Irugavarapu, she's the Managing Director for TAL Radio.
Hello, everyone. Let's go ahead and sit down. So, unlike my wonderful panel here, I am not a mental health expert, but my wife is, and I'm happy to facilitate this discussion. We have a wonderful set of panelists today, and this is a very important topic, very serious topic, and it doesn't get enough, I think, attention anywhere in the world. So, let me, I'm just going to, given we're running a little behind, I'm going to just kick us off here with some questions. And you guys take them as you wish, some general questions. And just go ahead and introduce yourself on your first response, please. All right, so first question for the panel here. When you look at mental health beyond burnout in today's India, what has changed the most in the last 5 to 10 years? And what is the same? What hasn't changed? Anybody want to take a crack at that?
Hello. Yeah. I think there's a lot of changes happening when in respect to mental health talks in the country. There are so many Bollywood actors who are coming out. They're publicly opening up about their health issues. they're not afraid to speak about what they've gone through and what they have done to come out of all those psychiatric issues and burnouts. So in this part of the city, people coming to the psychiatrist and the psychologist has gone up a lot. Previously, they were not interested to seek out help. Mostly they used to have self-medication or look for the content online, and that's the final end of it. Nothing used to be done, and currently at least patients are willing to see the doctors. That much change has come.
Would you like to introduce yourself?
Sir?
Would you like to introduce yourself?
Yeah, I'm Dr. SVJ Praveen. I am a senior ENT surgeon, and I'm also the managing director of Meraki ENT International Hospital, Kajagoda. We have 3 branches in Hyderabad. I'm also the head of the department at ESI Medical College, Sanat Nagar.
Hi, I'm Dr. Purnima. I'm a psychiatrist and a psychotherapist. I work out of Hyderabad, and I've been here for 32 years now. And what's changed? What changed is that the media has taken up mental health rather seriously. And before I go on, I must compliment Rama, an old friend, who started this 25 years ago on a TV platform, on a Telugu TV platform. She brought mental health to Andhra Pradesh and Telangana. And since then, many channels have taken it up, newspapers have taken it up. So the change has been gradual, but it's there. It's been gathering momentum after AI and after the various social media platforms also have taken over. And so what's changed is that we are more aware, youngsters are more aware, and they're not afraid to seek help. What hasn't changed is the stigma that surrounds mental health. What hasn't changed is that psychiatrists are considered to be witch doctors who give sleeping medicines only. So these are the things that still have to change. But I think I'm very optimistic. Places like TAL Radio, also I've been associated with them. We've been doing podcasts on mental health for youngsters, for adults, and for even geriatric patients. So the change is happening, and I'd like to thank TAL actually for bringing about so much change. And in a tearing hurry in the past 3 years, I think things have been happening so fast that I think we are also unable to keep up with the change that's happening. Thank you so much for all of this.
Hi, I'm Anu Krishna here. I'm a mind mastery coach and also the founder of Horizon Aware Women's Community. So this community, I've started to give women a common platform to come together, learn, support each other, and uplift each other. So what has changed in the mental health platform is we are coming together to discuss about mental health. This itself is the biggest change, is what I believe. So I have worked with Western clients and Indian clients. The major difference which I see is on the Western part of the world, they are more proactive and they are more open to say, I have some problem here. But in India, the stigma is still there, the fear of being judged. This is the biggest challenge which is stopping a man or a woman or a child, anybody, to open up and ask for help. But it's slowly changing, and that's why we all are here today, I think, to make, accelerate the change. Thank you.
Yeah, I'm Dr. Uday Gautam, neurosurgeon and managing director and chairman of Gautam Neurocare Hospitals. We have in Kukatpalli and Kompalli. And I'm very much thankful to TALHospitals for inviting me for this talk, and thanks Mr. Joe for organizing this panel. So as far as stress is concerned, it is becoming more prevalent nowadays. So earlier days we rarely use the word stress. It is confined to high profile job employees and some certain families only. Nowadays, irrespective of age group, even children, middle-aged women, are in professionals, everyone are having the stress. So they are speaking about the stress. Now, when visiting to the neuro hospitals and psychiatric clinics has been increased nowadays, that is better improvement in terms of getting the healthcare advice. So collaborating the neuro hospitals with psychiatric clinics and arranging the corporate talks and arranging the stress identifying camps and healthcare workshops in schools and colleges would help in alleviating the stress management and getting the help to whom they have to consult. We need to give the awareness to the public. Thank you.
Hi, I'm Rama. I lead TAL Radio. It's a 24/7 kindness radio. So what I observed is, as Dr. Purnima mentioned, we are working on this area from last several years. But then we used to do the shows with our own questions and answers. But now we are getting mails from people asking about their problems and asking for the solutions. So now people are proactive and they are ready to take the advantage of media to getting, even though they cannot directly go to the expert, they want to consume the right answers and content from the experts. That's what I see the difference from last several years.
So I think, TAL radio is sort of, if you think about it, it's a radio is a medium that's been around for 100 years, right? But now with the digital advent, the internet, you can get a much wider reach than what the antenna could, hit back in the day. Are digital mental health tools, how do you guys feel? Is that like, online forums or even AI chatbots? How do you guys see that impacting what you guys do for work? Is it a net positive, net negative? Do you have any feelings on that?
I feel most of the young children or teenage group or the software guys, they first seek the help of LLMs, say OpenAI or Perplexity. And what these LLMs do is they hallucinate. They give you 5 to 6 diagnoses, and the patient walks into our OPD. They come with the diagnosis because they already have a thought in their mind. Just because they gave the symptoms of what they are feeling like, even sometimes they will not be correct. They might be lying with the chatbot, and hence the diagnosis will be something else, and that worries them more. Sometimes we get panic calls at night saying that this is what I have, how to seek help. And that's not correct. Going to a chatbot for every help, especially psychiatric help, it's not suggested. That is what psychiatrists and psychologists are good at. And it's better to seek help from a trained specialist.
What AI and the various social media platforms is doing, it's bringing mental health to the forefront, and I'm grateful for that. So sometimes the information may not be just right, and I think it's up for us, those who indulge in these, to do our fact checking, because there's a lot of fake news that goes on, fake influencers. So I think the danger of being influenced by the wrong people, by the wrong platform, now that's pretty high. The other thing is, as doctor said, yes, you might not give the entire picture to the chatbot, and therefore the advice you get may not be right. Chatbots are not yet, I think, fully trained, or may not be ever fully trained, I'm hoping, to detect emotions. While, I wear a smart ring, and I'm told right now, but the next generation of smart rings will also be able to detect stress, or by, or sometimes by facial expressions or something. They can just detect basic emotions like joy, happiness, anger, and depression. But how much of this is going to be accurate is something that we really need to worry about. And as we know, there are no laws yet that govern these kind of things. So if there is an eventuality because somebody got the wrong information about something or did not represent themselves correctly, who takes responsibility? And the last point I'd like to make here is that just 3 days ago I met a young lady who is developing an app in the US that creates a holographic image of the doctor, like a mirror image of the doctor. So if somebody wants mental health support immediately, like talk therapy immediately, and the doctors say fast asleep at 2 a.m., they can talk to I think the bot or the mirror image of the doctor and take advice. While it sounded very fascinating, it also scared me. I mean, what if my duplicate or my mirror image says something that I would not have told the patient? Or what if the patient is misrepresenting because, you know, you're talking to a bot and, you know, your facial expressions and all that may not be too visible. And what if some advice goes wrong? Who takes responsibility for it? Is it because it's me and that's my mirror image and that's I'm supposed to train it? But then you see there is something called machine intelligence, there is something called machine learning. It starts improving on itself and sometimes you might lose control. So who takes liability for such things? So these are all questions that I think, you know, will be answered over time. But will a chatbot or will AI replace human touch and a doctor? My answer is a categoric no.
I recently typed in my date of birth on ChatGPT and asked it to provide my predictions in terms of my finances, relationship, my business prospect, future, everything. So it said, don't worry, you're going to make a lot of money, your business is going to prosper and everything. Just for a change, what I did, I just changed the year. Okay, just the year, the date and month were the same. The prediction was completely opposite. So then it's very evident, right? The AI is trained already by a human being. I'm not very clear about AI. I'm so sorry if I make some wrong statement. But it's machine learning, right? You teach the machine with all the information. It's similar to Rajnikant's Robo movie. It learns all the information from the book and it tells you what you want. So, but when it comes to emotional well-being, mental health, as ma'am said, a lady came to me. She was in a severe relationship challenges, and the moment she started talking to me, she told all the ChatGPT statements. Nervous system calming down. Like these, there are certain sentences which are very evident, you can find out, right? So she has been talking to AI for the past 3 months. And she is asking me, how can you say that you, a coach, a counselor or a coach is better than ChatGPT? This is a question she asked me. Okay, I asked her just this thing, does a ChatGPT know that you're telling the truth? Obviously no. It just responds. You ask, give me the biryani recipe, it will give you the biryani recipe. You ask it curd rice recipe, it will give you curd rice recipe. That's it, right? But when you talk to a human coach or a counselor, we know how to question you and get the truth out of you. We don't go by your words. That's why we are expert in the field. Whatever a person comes and tells to me, it's 99% false. We don't go by the face value. I'm sure ma'am will also agree. We question you, ponder, go deeper inside you and bring the fact out, which is very uncomfortable for you. That's why you don't tell us the facts. But unless you tell the facts to a lawyer, a doctor, and now to a coach and a counselor, you can't heal, isn't it? So, yes, human, I don't think can replace in the emotional part at least. No, AI cannot replace. I'm sorry, that's what I wanted to say.
Yeah, the AI and ChatGPT or whatever the technology is revolutionary, there is no doubt, and it plays important role in healthcare also. But as far as mental health is concerned, it is better not to tell everything to the chat box. It is better to open up with your consultant. So when you open up only, so the consultant or doctor will be knowing what exactly is your stress levels. So just as a clinicians, we observe the patient's feelings and expressions, the level of stress while they are expressing to the consultants. So exchange of thoughts and emotions, and that reduces the much burden. 50% of the burden will be reduced while speaking out regarding the mental health. Instead of telling everything to the chat box, that no doubt that will give some suggestions, but that cannot reduce your burden, cannot give the exact pharmacological treatment and everything. That's my opinion.
Yeah, I mean, I can imagine, and I know that when a lot of these, like the Apple Watch and a lot of these, digital health devices came out, and they had the ECG or EKG built into it, and you come in with AFib, right? It had a high false positive rate. The cardiologists hate these things because they spend all their time, basically dealing with false positives. And that's overstating the fact, right? But it's the trend. And I think that, you know, rationally one might think, well, maybe I'm afraid to go talk to a mental health professional, right? I have a, you know, I just never done that before. I don't know what it's like, and I just don't want to go. I'll just go talk to this chatbot, right? And if you look at the way that these things are trained, they're trained exactly like you said. They're trained by people with human reinforcement, and frankly, they're pretty sycophantic, which means that they tell you what they want to hear. They flatter you, and they're not going to push you to drive. And then the other thing that I've seen, and maybe you guys have experienced this on the body side, is, you know, you go Google symptoms, or you go ask ChatGPT or Gemini one of the symptoms, and you've got every disease, you know, possible. It's like that old show House MD. You've got every disease on the list, and now you know, if you've got anxiety, you're up there and having worse time. So I imagine that this provides a extra burden, even for the body physicians that have to now be working more on the mind. So I don't know, do you guys feel that that's your experience?
Yeah, like I said, we are overburdened. We have to spend more time with the patients, because the chatbot, which is hallucinating and giving them wrong diagnosis, which makes the patient more and more apprehensive. Sometimes I inform the patient that you are having obstructive sleep apnea syndrome, which is the root cause for all of your symptoms, and I'll try to explain him that obesity, burnout, chronic sleeplessness, having a lot of screen time, having less social connections, and all of these are the root causes for what you are experiencing. And they're not in a position to understand that. They constantly keep nagging that this is what I have, can you treat it? That is what they continue to say. So that's where we waste a lot of our time. It usually goes to 30 minutes, which used to be a 15-minute consultation. The time will be prolonged. That's the issue we are currently facing.
So we've covered a lot on the mind, and let's talk a little bit about the connection between the mind and the body. Could you talk a little bit about how these kind of factors you just mentioned can also affect the physicality of the person?
Yeah, I would like to break this discussion into two parts, one with regards to the adults and one with regards to teenagers and elderly kids. So when it comes to the adults, what's currently happening is there's a lot of screen time for most of the software guys. And more so at the nights, they're forced to work with huge screens which emit a lot of blue light. And chronic sitting position, there is no physical activity. They're overburdened with a lot of work, therefore the stress levels go up, and they have erratic sleep habits, and more often they have insomnia, and they have very short sleep cycles. So all of this will eventually lead to one particular thing, that is obesity. And obesity will eventually lead to obstructive sleep apnea. And I'm sorry to say, diabetes is not the mother of all ailments. Obstructive sleep apnea is the mother of all ailments. Obstructive sleep apnea leads to diabetes, hypertension, coronary heart disease, and eventually death. So stay away from obesity, stay away from chronic stress, have good socio-economic relationships. And the first statement what we read in our textbooks is man is a social animal. Try to socialize as much as possible. If you're not socializing, then you are eventually going to have some problem. So decreasing the work stress, having good sleep, and having good family relationships and societal connections is what helps beat this burnout issue. So with regards to the elderly kids and the teenagers, one problem what we continuously identify in our clinics, especially in ENT clinics, is adenoiditis. What is adenoiditis? It's a small lymphatic tissue behind your nose, and usually it has to go down by the age of 14. But if it is beyond grade 3 and grade 4, then the kid or the teenager will have chronic mouth breathing and snoring, because of which the upper teeth will come forward, and he'll be a continuous mouth breather. In the morning times, the kid will be irritable. He will have very less attention span. And the mother will complain that the patient or the kid is mouth breathing throughout the night. And some kids, they urinate in the bed itself. There is constant bedwetting, and they will not sleep in a particular position. They will be rotating in the bed. So these 5 signs, when we come across this kid, then we should think that the patient has adenoiditis. We order an X-ray, and when we see adenoid grade 3 or grade 4, we'll operate. If not, we'll advise steroid nasal spray. So chronic sleeplessness for the kid is what is causing attention deficit hyperactivity disorder. And many of the child development centers and some psychiatrists and psychologists even miss this part. So look for adenoiditis, look for nasal obstruction, especially in the kids, more so in adults as well. Most of the adult Indian men beyond 35 years will have snoring, which is often neglected. So snoring is the root cause. That is my personal experience. Once we take care of the snoring, we do an adenoidectomy or we do a septoplasty, snoring will go down, and all these symptoms of burnout, obstructive sleep apnea, psychiatric disturbances will drastically go down.
That's great. I would love to, it's an incredible perspective from an ENT perspective. Dr. Uday, this is really your area. Would you like to maybe give a wider view on some of the other symptoms or conditions that might result from screen overuse, or these other kind of chronic sleep deprivation?
Yeah, ultimately, the overusage of screen, digital overload. So that increases the screen time, that exposure to the blue light, especially during night times, that hampers the production of melatonin. That is a natural hormone that helps in sleep. So the decrease in the production of the melatonin ultimately leads to a chronic sleeplessness. That chronic sleeplessness leads to ultimately stress. So all these symptomatology, the chronic stress and the sleeplessness and digital overload, all that dysregulates the hypothalamus pituitary axis and dopamine pathway, and increases the neurotransmitters that obstructs the autonomic system. All these together, they present in different various symptomatology, like brain symptoms and mind symptoms. When we talk about the symptomatology of the stress and the chronic sleeplessness, they look similar, so they overlap. And as far as the neurological symptoms concerned, the patient usually complains of severe headache, chronic migraines and tension type of headaches, any tremors and dizziness and restlessness, sometimes neuropathic pains also. So in chronic stress, the patient feels the neuropathic pain. It doesn't, when we investigate, so we don't find any structural pathology in the brain or in the spine. So these are the neurological symptoms, and in addition to this, the patient also presents with anxiety and low level of depression, poor concentration. So all these are just because of the sleeplessness and chronic stress. So we have to identify initially. So many of the patients comes to the neurological clinic only. So we need to identify the triggering factors. So extra questioning the patient about any recent stress events. What sleep patterns also we need to ask him, and if there is any underlying cause to psychological trauma, we need to address immediately. In addition to the advising the pharmacological treatment, so we have to advise the patient to consult a neurologist, psychiatrist or psychologist. So in all these chronic stress and sleeplessness, again the exposure to the excessive screen time, again that leads to another symptomatology, that is brain fog. Nowadays, the many patients complaining of brain fog. They come to the clinics and asking the doctor, my brain is not working properly. So constantly spending much time on the screen, so the patient finally feels restless. So when he stops scrolling, the brain, he will constantly, calm down, so he doesn't do anything. And that indicates the severity of the brain fog. So in that situations, he may face the poor concentration and increase the incidence of migraine headaches and depression. And finally, suicide intenses. And already in epileptic patients, there may be some functional symptoms also they may appear. So non-epileptic seizures and tremors, gait also, that is, it becomes some imbalance. That indicates the severity of the underlying chronic pathology that is not structural. That is because of the stress, majority of the emotional and the psychiatric symptoms. We need to address the underlying causative factor, or we need to encourage him to consult a psychiatrist immediately.
Yeah, Dr. Pamina, do you want to respond?
Considering that stress is a given these days, I don't see anybody out here who's not stressed out, myself included. Stress comes in many forms. It could be work stress, it could be the stress of being perfect, having the perfect body, the perfect mind, the perfect score in your exam. So stress comes in many forms, and it can be induced also in many forms. Recent studies have said that even a newborn baby can show signs of stress. If the mother was stressed during her pregnancy, or if she was anxious during her pregnancy, or if there was substance abuse during her pregnancy. When night became day and day became night, when the IT industry started blossoming, you see, mental health issues also started blossoming in many, many ways. So sleep deprivation being one, working long hours became the next thing, parenting, relationship issues, all of these things kind of, just sprung out, and started creating and complicating, issues which were at one point just work related. So sometimes you see we have a husband who's working night shifts and the wife is in the morning shift, so they hardly meet. So, and then you wonder why the relationship is going awry. So when you think of stress as a given, and everybody, right from a newborn child, as recent studies say, to children, to adolescents, to adults, and the geriatric are suffering from stress. Reducing stress is probably something that nobody can do. But yes, managing stress, managing our emotions that are regulated by stress, and taking therapy and taking help whenever needed. Having small groups where you can talk, safe spaces where you can emote. I think this is the need of the day. And while stress is one of the causative factors for anxiety, depression, PTSD, and CPTSD, there are other factors, human factors, abusive parenting, substance abuse, domestic violence, all of these things which are on the rise because of various reasons. Also because, and now we come to know about that because of the awareness. These are also causative factors for psychiatric illness, apart from the inherited and the genetic factors which control bipolar disorders or schizophrenia, which are serious mental health issues, or even the neurodiversity spectrum. So when we're looking at multifactorial issues, I think both medical management, awareness, I think right on top should be awareness, medical management, talk therapy, and creating safe spaces where people can actually talk about their issues is, I think, of paramount importance.
So when I got this topic, beyond burnout, so I wanted to keep it towards more about women's mental health, since I work predominantly with women. So again, I went back to ChatGPT and asked a question. On an average, how many women in India, working women particularly, go through burnout? Thus, the answer was really surprising. It said 45% of women go through burnout, stress, and the byproducts. And it just didn't stop with the Deloitte survey. It gave 2-3 surveys below, and it just said, on an average, it is 40 to 55% of women who are going through burnout. Now you know why your wife is always upset, isn't it? Right? So that is why I always focus on the women's mental health. Because if your better half is happy, or all the women in your life is happy, you're also happy, right? Your problems are 90% sorted, isn't it? right? So when it comes to women who are high functioning, it's not because like, no, they don't break down because they are weak, but they have been holding it for so long. They have to show that they are strong, right? As a woman, and we are 3 women here, and there are many women in the audience also, you all will agree with me that we are conditioned, to put up a brave face and show that I can handle things. I have to handle family, I have to perform at the workplace, I have to prove. There is an extra, a need to prove my worth at the workplace because I am asking for equal rights. Then they tell me, you proved it. So I can't be emotional there, right? The word emotional. And then I have to handle everybody's emotions at home. Child, parent, in-laws, husband, everybody's. And on top of it, I can't be emotional. So we are very trained in showing off that everything is going fine. Everything is going good. But internally, what we are doing is we are suppressing anger, stress. We are continuously doubting ourselves. Am I enough? You can ask any woman, is she has a self-doubt? She will say yes. Am I being a good mother? Am I being a good wife? Am I being a good employee? There is a constant doubt going on. They just don't stop there. They criticize themselves also. You had to focus on your work. You didn't focus on your child today. What kind of a mother you are? And vice versa. So we are always conditioned to go through this hot, cold, push and pull kind of an emotional roller coaster. Though we put up a brave face outside, but internally we are emotionally collapsing. So if you see a successful woman, like a successful CEO or a manager, or a woman who is handling her chores very well at home, it doesn't mean she's emotionally well. It doesn't mean, because this performance, right? It beautifully puts a curtain or masks that the collapse that is happening inside. So it's very, very important to have that clarity, have that awareness of what am I feeling inside. I don't have to wait for someone to come and ask me, are you okay? Can I ask it to myself? As doctor said, sleep apnea is the mother of many challenges, right? Do you know which emotion is a mother to your stress, anxiety, depression, panic? Anyone? There is one emotion which is a mother. And we all of us have in us, it's worry. Worry is the mother. You just need to worry about something. Right? That's it. Just worry about something. Okay? Then see where you are going. It will take you to a level where you have lost hope in your life. That is the power of worry. And there is a father also, fear. He is the dawn. Okay? And there are many types of fear. When these two emotions join hands in hand, you will know what can happen to a healthy human being. Happiness is lost. That's all.
So what we consume makes us like how we think and how we act depends on what we consume. Agree? So what we are consuming nowadays? We are consuming negative content all the day. At least 7 hours we spend on consuming the negative content. So that's where TAL Radio strongly believes. We believe that positive content makes people be positive and think positive, act positive. So that's why our radio called Kindness Radio. We ask people to be kind to others, also themselves. Like it starts with being mentally resilient and strong. So that's where we have many shows talking about mental health. As I said, Dr. Purnima Nagaraja and Anu Krishna are experts from several years. They are doing several radio shows and podcasts and also doing social media reels also to give awareness to the people. So our TAL Radio content always focuses on uplifting, inspiring and educating people. we never ever use some words like even suicide, rape. We are very particular about being, because media should be very, very responsible for the well-being of the people. Like, because we all are consuming more content and we are depending on media for the news, also entertainment. So then we must be very responsible while creating a content. That's what we believe, and we are very much into that. And I think Dr. Purnima should add point here, how particular we are when we are doing a show podcast about suicide, about a particular hero. I asked her, please never mention suicide in your podcast, but you must talk about that suicide. That
So she drives a tough game. So she tells you what words not to use. So when we're talking about suicide, we talk about and deliberate self-harm. We try to explain the situation without using these words, because that will give you ideas. If you're not in a great state of mind, that will give you ideas. We also don't use words like toxic. We don't use words like, negative bias. These are all actually, mental health professionals do use these words. But I think over time, working with Rama, even in my own practice, I've learned not to use these words, and I don't, and to be very, very non-judgmental. It's been a growth for all of us. And I think all of us as human beings, and as well as mental health professionals and other doctors, we need to take a non-judgmental stand. And when we are talking to our patients, and everybody's a therapist on their own. Now, it doesn't mean you have to be a mental health professional only. Every doctor has to counsel their patients, has to reassure their patients, and that is talk therapy. So if you are able to skirt around certain words and not be harsh with our patients, and not be harsh with people who are already stressed, who are already suffering, who already have issues, I think we can make a difference to mental health as a whole.
So I got a question for you, Dr. Vijay. So this is dovetailing into the conversation earlier about, the fascinating link between obstructive sleep apnea and mental health issues in this vicious cycle. How do you handle conversations where, a patient may come in and maybe they have something ENT related, but they may also have other things? How do you make sure, or do you make sure that there's a way that referral, or that, we call it wraparound care in the US, kind of happens?
Yeah, what we recently understood is patients still have the stigma of visiting a psychiatrist. So if we refer, mine is an exclusive ENT hospital. If I am referring my patient to a psychiatrist clinic, they're not willing to go there. So what I do is I call the psychiatrist to my clinic, and we tell them that you are having a consultation in the same institute tomorrow at the same time. They're more than willing to come. And one more thing is, we call my psychiatrist to all of our conferences, because OSA and psychiatric issues go hand in hand. This much we have understood. There is a clear-cut correlation between sleeplessness and psychiatric issues and burnout. This is a vicious cycle, and adding obesity and screen time to this, and the patient will be in a very horrible state. So now we have made a good team. We have a good anesthetist, we have a psychiatrist, we have a child psychologist, we have a sleep specialist, we have an in-house sleep lab. So we work holistically, and we assure the patient that this is the situation you are going through, this is the sleep study report, and this is what the psychiatrist says. You are already on 3 to 4 medications to have good sleep, and we assure you that if you can take a bold step and take this therapy, like using a CPAP device or undergoing a small surgery to your nose, you'll be perfectly fine in the next 2 to 3 months, and you'll be totally off the medication. That is what we reassure them. And believe me, there are so many success stories. We are operating at least 2 to 3 patients every week. Patients who are on a lifetime of lithium, which is usually used for mental illnesses. They have totally gone off the meds. Patients who are on 6 to 7 antipsychotic drugs, they're totally off the meds. People who have huge dermatological problems like dark circles, pimples on their face, they don't understand that sleep is the root cause for all of the ailments. So we have developed a holistic team. Like I said, we added a dermatologist to our team now. So once the patient with dark circles comes to us with psychiatric issues, we educate them that the dark circles are because of the sleeplessness or the fatigue you are currently facing. We are also taking care of the emotional issues, say relationship issues. Like Madam said, when your wife is happy, your life is happy. So we are including a psychiatrist very well. We have a slot for the psychiatrist. And this is a holistic approach everyone should look at. Multidisciplinary team approach is mandatory to save a soul.
Dr. Vijay, you want to respond? I'm sorry, Dr. Uday, would you like to respond?
Yeah, always. So many patients to our neurological clinic, they come after post-trauma or post-stroke or any patients with chronic migraine. So many patients are complaining about the sleep disturbances. So if you treat the not only trauma or stroke or any headaches, we have to treat the sleep also. So we have to ask the patient to what are the triggering factors and how to alleviate these symptoms, how to get the sleep properly without any pharmacological support. That is very much needed. In case of severe sleeplessness, we need to add initial drugs in case if we are capable. Otherwise, we need to refer the patient to the psychologist and psychiatrist. So we need to give the much importance to the underlying the cause and treating it.
And from a hospital systems perspective, do you think of some practical changes, that you might suggest that could help create or prevent, prevent burnout-related problems before they become an emergency? Do you guys have a thought on that?
Yeah, that's what I said. So when many patients comes to the clinic, we need to identify initially during the interview with the patients. So by the junior doctors or any consultant, we have to identify initially the severity of the stress symptoms, or we need to identify any depression or any anxiety, any tremors. So as usually patient comes to the neurological clinic, he will complain about the headache or tremors or any seizures. So he will not say about the underlying the stress or any depression. So we need to find out and in the initial stages or in the mild stages. So if possible, we have to arrange the psychiatrist or psychologist consultation in the same sitting if possible. So in that way, we can reduce the severity of the panic attacks and attending to the emergency or clinics. So in that way, we can reduce it. And so integration is neurological clinic, the psychiatrist very much needed in as per many setups, very much needed.
Thank you.
I'd like to add something here. Just a quick how gender expresses itself in mental health. As you see, the world perceives men differently and women differently, whether it comes to role modeling or role playing, or the basic societal role. And then now we have a third gender also. So I run a queer affirmative clinic, and it's been on for past 30 years. When it wasn't even popular, I lost clients because of that. But what I need to tell you is, as Madam said, that if a woman is happy, the family is happy, but the men also need to be happy, isn't it? So we need to think about stress in men also, because it's not being a man to express your emotions. You have to be stoic, you have to be in control at all times, you have to be the breadwinner and the patriarch of the family. So that's the men's stress too, isn't it? While caregiving needs are very high for women, I think being stoic and to control his emotions is very high. So health-seeking behavior. Women seek health more often than men, particularly when it's mental health. As we know statistically also, women attempt suicide more. Successful suicides is a dirty word to use, I'm sorry, but successful suicides are more amongst men because of the suppressed emotions. So we really need to look at the world as a whole and not just in parts. Yes, women have their issues, men too have their issues, and we really need to, in India we don't even have laws that protect men. So we need to also think about that aspect. And children have their issues, adolescents have their issues, sexual expressions are becoming varied now, and so also are gender expressions. So all of these things are also causing a lot of stress in society: acceptance, non-acceptance, discrimination, stigma. So all of these things need to be taken into account when we actually assess a patient for mental health problems. As doctor said, sleep is, you know, the mother of all issues. OSA is the mother of all issues, but it can be the other way around also. If you're depressed, you won't sleep. If you don't sleep, you're depressed. So it's like a vicious circle. So we, you know, it's a little difficult sometimes to understand whether the sleep deprivation came first and they became depressed, or did they become depressed first and then did the sleep deprivation follow. So these are all issues. I think, you know, we all need to, you know, the medical fraternity needs to work as a team. And unfortunately, you know, the medical fraternity has a slightly stepmotherly attitude towards mental health and psychiatrists. So I would also, you know, probably advocate for more and more fora where all the medical specialties come together and discuss such issues.
Well, I think that's great. Thank you for wrapping us up here. Let's thank our wonderful panel here. We're out of time. And thank you guys for joining us. This was a great discussion. Really appreciate it.
Thank you very much, Joe. I'd like to request you all to be staying there itself. We have speaker mementos. Can we have the mementos over here, please? Joe, you may want to give the mementos. Thank you very much, Joe. Sorry, Ramagaru, you're part of a family. Okay, let's go for a group picture, please. Thank you very much. Great thoughts over there. I think I must share an experience that we had some time back. A few months back, I think Ramagaru might recollect that experience. We came across a very young kid, a bright kid. He was an automotive engineer, son of a lawyer. But then he was very, very quiet, and he started crying just for nothing. So then we discussed with him as to what the problem is. We later on figured out that he was going through a lot of mental health issues. A lonely guy, no one to care for, separated from father, no mother. That's when he came to us and he started discussing and opening up, but crying in loneliness, never had any friends. So me and Ramagaru, we had a good chat with him. He was not opening up for any help, but after a while, he came by himself and requested us to put him on to somebody who can help. Through a TAL radio platform and TALHealthFest platform, we were able to connect him with the right people so that they could take care of his mental health issues. Thank you, Ramagaru. Well, we now move into a session focused on something each one of us can influence every single day. That's about optimizing health span by leveraging lifestyle changes. The future of healthcare is not about treating the illness, but it's also preventing the disease and sustaining vitality. Small daily choices that we make, we heard that earlier on in one of the sessions, and these daily choices sustained over a period of time have the power to transform lifelong health and well-being. That's the topic that we have got. May I now invite Mr. Raju Pusapati, Vice President of Life Sciences at Solix Technologies, who is moderating this session. And along with him, we have Dr. Krishna Mohan Yarlagadda. May I invite him? He is the Director of Virinchi People's Hospital. And Dr. Anupama Upaluri, Chief Doctor, Advanced Ayurvedic Hospital. We also have Uma Aisula. She is the Global Director of Communications, Access Health International. And we have Dr. V.K. Shashidharan, Dean for Symbiosis Medical College for Women. And last but not the least, Dr. Raghunath Buri. He is Director AI Pharma at Solix Technologies. Please give them a round of applause.
Great, thank you everyone. So just start with a round of introductions. Myself, Raju Puspati. As you can see, I'm working for Solix, studying the life sciences. My background is I'm trained cancer biologist and pharmacologist. I would start off requesting each of our panelists, wonderful panelists, to introduce themselves briefly in the interest of time, starting with Dr.
Good evening, everyone. I thank TALHospitals for giving me this opportunity to interact with all of you. I'm a surgical gastroenterologist and bariatric surgeon. Worked with many corporate hospitals in Hyderabad in the last 3 decades. And presently I'm with Virinchi. Thank you.
Good evening, everyone. I'm Dr. Anupama Uppuluri, Chief Physician, Advanced Ayurveda Hospitals, Hyderabad. I have been practicing Ayurveda since 20 years, and I do take care of many neuromuscular cases and musculoskeletal, skin disease, and gastro, mainly in my hospital. So I'm more interested in my preventive medicine rather than treating a disease. So that's what this topic is very interested to me, and I'm glad to be a part of a conversation today. Thank you.
Good evening to you all. I'm Dr. Shashindran, Dean at Symbiosis Medical College for Women. I'm an ID specialist by training, and over the last 8 years I've been interested in aging biology and now do a lot of geriatric work. I've been a medical teacher for almost 35 years, and so deeply involved with medical education. That's my background.
I'm Dr. Ruma Isola, and over the last 39 years, I have seen healthcare change. So the areas have been in hospital and health administration, health system strengthening, social impact, public health, wellness, amongst many of the other areas that I have chosen to work at the grassroots level, start ideas and grow them to concept and scale. So grateful for TALHospitals for giving us this opportunity and giving me this stage to speak.
Thank you.
Good evening, everyone. I'm Raghu. I'm a data specialist, especially pharma and healthcare. I'm specialized in AI/ML application development. I'm working in Solix. Thank you.
Okay, thanks, panel members. So today I think I'm lucky in the sense it came in the end. My panel is at the end, and the stage was set by Murali's panel as well as the previous one from Joe's, talking about mental stress and lifestyle choices. So we'll not talk about mental stress, but we'll talk about concentrate our focus mostly on metabolic syndromes. So especially in the Indian context. In Indian context, metabolic syndromes, as you know, is a big issue. The metabolic syndromes constitute obesity, diabetes, cardiac health, and hypertension, right? So as you know, as one of the speakers in one of the panel's members, we are the diabetic capital of the world, and we're also the cardiac disease capital of the world. So this is increasingly occurring in 20s and 30s, right? Earlier it used to be a generation or 2 generations ago, it used to be 40s and 50s. So as you can see, now it's occurring in 20s and 30s. So we need really to intervene and hopefully do not even move even younger in the teens, although we've seen some cases in teens as well. So this is a great panel. panel to discuss different perspectives and different aspects with Dr. Arlagada, being a surgeon, GS surgeon, bariatric surgeon, robotic surgery, and from Ayurvedic and traditional medicine perspective, and Dr. And Isola, and also on access health and community health perspective, and Dr. Sheshindran giving his perspective, and finally, not the least, Raghu from Solix, who is trained both in drug discovery and science as well as in technology. He will giving a perspective what is Solix is doing from technology perspective, contributing to health span and the lifestyle. What they're doing also has impact on on health span and lifestyle choices. So as you know, all these metabolic syndromes have genetic component and lifestyle component. Obviously, we cannot change genetic component. So how do we address the lifestyle choices that we make, and which I think most of the panelists will talk about, because you cannot change the genetics behind that. Also, some of the lifestyle choices we need to take is also dependent upon, keep in mind our Indian culture, which includes food, so which is heavily on high carbs, and also sweets and other things. But we need to take into consideration that it's unrealistic to make drastic changes in Indian, asking our patients and people to drastically make unrealistic assumptions on changing the very nature of the food they eat. So that'll be great to talk about all these different aspects. So the first question is common to everybody. So how early in the years should we be talking about health span and making lifestyle choices, considering we are seeing all these issues in 20s itself? So starting with Dr. Krishnan Mohan.
See, for the health span, that is quality of life is very important than quantity of life. In my practice as a bariatric surgeon, I see people walking into my office with 100 kilos and above or 150 kilos above. So these are the people actually they are looking for why they are taking such a decision that please operate on me. So it is because of that they tried everything, and ultimately they are coming back to the surgical line and asking for the best approach. But before going for this, I think there are many lifestyle choices which one can optimize themselves and see that they need not go under the scalpel. And at least in my experience, when patient comes to the office, it is something like they're all stressed out because of not fully informed about the health approach and not fully informed about the surgical approach itself. So why we operate on these people, not on everybody, definitely. They must have exhausted all the lifestyle choices, and ultimately imagine a person having 150 kilos and thinking about the quality of life. It's very difficult. So those are the people, actually they get help from the bariatric surgery. But I always feel for the lifestyle approach, the only 5 pillars which already the panel really they spoke about at length. Simple things like eating, sleeping, and exercise, stress management, and of course the 5th pillar, you can think about your social connectivity. These are the 5 things which we can manage. Anyway, I don't go into those things. Anyway, my other panelists, they can elaborate on that. But the last one, which I am talking about, the sense of purpose. If somebody loses the sense of purpose in themselves, then the stress comes. The stress is nothing but sympathetic pathway activation in your body. That is always you are on fight or flight mode. So a simple thing like pranayama can help you to stimulate your vagus nerve, and parasympathetic pathways can be stimulated. So these are the simple choices which one can adopt before going for any further things. Anyway, I asked.
Your 40 years of experience. The question is how early are you seeing now? Earlier, maybe how early in the years are you seeing the request to do bariatric surgery? How early in the age do you see, last compared to 30 years ago, last 10 years, do you see younger and younger patients?
Yeah.
So what's your experience on that?
Definitely, in the last 3 decades, I started bariatric surgery in 2005. I was the first bariatric surgeon in South India in those days. And since then, these days I am getting children also. Just aged 3 months back, we operated a brother and sister. The sister was having 197 kilos with diabetes, hypertension, OSA, whatnot, everything. And she is on insulin.
Age you said, sorry?
16.
16 years?
Yes, please.
Oh, so it's coming into teens.
And brother is 15 years old, 163 kilos. And both the people, of course, family brought them to me. They tried everything. And ultimately, after 1 year, they came to me. And there is no option for us. At that tender age, that it looks surgery means very harsh decision, people think. But it is really, it gives life. Suppose if you don't operate on them, 197 kilos, that girl, we don't know when she can really become. And but in couple of years, you see, people, she can come down to ideal body weight. So these things do happen. So, but all this because of, I feel, one is the nutrition, the kind of nutrition. Somebody said, we used to treat malnutrition, now it is malnutrition. That is, have people having nutrition in the malls. So it is true, some panelists told just today. And these are the things which drive toxins into your body, because we don't know how many plastics are involved into it and how many substances, chemicals which are really involved, so that your good bacteria also will die in the colon, and which may lead to chronic physiological stress. And that goes your sympathetic pathway activation, and this chronic stress never goes off unless otherwise you realize it. That's why the age, previously we used to see 25 and above, and now we are seeing 15 and above. Even young children, they are coming with very too much of weight.
Thank you. Dr. Anupama?
Actually, lifespan is what, how many years we live. That is our lifespan. Health span means how many of those years we live with quality of life, without any disease, without any metabolic diseases, no chronic joint pains, without any mental diseases. This is the health span. So what Ayurveda says is, when we are in 20s, we need to take care of our health. From the 20s, the impact will be visible. So during 20s, when we are healthy, then only we have to start our healthy lifestyle, because we see so many diseases starts in 20s, but we don't know they are started. Once we diagnose the disease, it already become 40s. We diagnose the disease at the 40s, but the disease already started in 20s. So we have to take care of health. Actually, we say from childhood itself, but as an adult, we are talking about the adults here. So it's better to start our healthy lifestyle from 20s, because as other doctors are there here, so insulin resistance silently starts in the 20s. It becomes metabolic disease, PCOS, PCOD, and diabetes. These kind of things happens in 20s. The seed starts at that age. So we always suggest in Ayurvedic perspective, as early as possible in the childhood or at the age of 20s, or we have to change our lifestyle and adopt the healthier lifestyle choices. That's what I say.
Yeah, I think I would go a little further down the line. If you want to make good lifestyle changes to have a good lifespan, then you should start even before a baby is conceived. You know, when we look at something, we have a concept of epigenetics now. If the mother is obese and if the father is obese, the genetics of obesity are carried on to the baby. So we should be counseling parents even before they think of having a baby. First, set your lifestyle in order. Lose weight, be healthy, and then you conceive. Then you're giving the child a good head start in life. The other thing which happens is, because today young mothers are juggling careers and homes, so they don't have, time is at premium. So one of the easiest ways they can feed their babies is they switch on the TV or they give the mobile phone. Now, if you've seen a child who's breastfeeding, the baby will stop feeding the moment it's full because it's concentrating only on feeding. Now, the moment you give a mobile phone or switch on the TV, the child is distracted. Child doesn't stop eating. So you are overfeeding the child. So childhood obesity starts at that time. And it starts with the actions of parents. Now, if parents have a healthy lifestyle, they exercise regularly, they sleep at right time, the children will also learn it. So it's the parents who set the tone for the health of their children.
Absolutely.
So a lot has already been said. I'm just going to add a couple of things. One is that if you look at how communication takes place amongst the families today, it is very different from how it was 30 years, 40 years, or 50 years ago. There was not enough money for us to go out every time to find a meal at quick, just at the click. 20 minutes I get a Zomato or Swiggy. And if what is made at home is not liked by a child, then you have somebody who says, order what you want. So even money is at their disposal and they are able to do it. So you are setting them up for options which we didn't have. If Karela is made today, my father will be sitting at the table till we all finished the portion of Karela before he got up, even if he had finished his meal. So the options are through communication. You cannot expect a child to understand discipline at a certain age. Like he said, it starts before they're born. But at age 2, 3, where chocolates become easier, they reach out to a bag of chips and Pepsis and Lays because they are addictive. The salt is higher, the sugar is higher. Their behavior change happens because of that. It is very hard for people to say, I'm going to stop this because there's so much peer pressure. There are a lot of children who are watching other children who get it from their parents, and when you don't give it, there's a tantrum. How are you going to deal with those lifestyle changes? So communication on one front, and being a mother of a nerve of steel, or a father or a caregiver with a nerve of steel, to be able to say no and stick to it.
Excellent. Raghu, I'll come back to you on the technology side. You'll have the final word. So I'll come back to Dr. Krishna Mohan. So you mentioned bariatric surgery, right? Teens at 25. So once they've done, they've lost the weight immediately at surgery, that's not the end of it. That's the beginning, right? So you cannot keep on the same lifestyle that you've been, that led to the obesity to start with. So what precautions or what lifestyle choices they have to make, or make modifications to their lifestyle choices, including foods, whatever that causes obesity? Because if you continue the same way what happened before bariatric, you would expect to gain weight back, right, in a few years. So how do you manage those, and what do you tell your patients after the surgery?
Yeah, we have a team follow protocol with these patients. One is how to eat. Again, we need to teach them. It is something like even in adults, we see the breakfast, some people, they don't eat anytime. Some people, they eat breakfast almost 10 o'clock, 11, 12. And actually, there is a circadian rhythm where you see you have to align your food intake with the light availability. So, morning, the sunrise happens, your cortisol starts increasing. It reaches to the peak. That is the stress hormone. For 2 hours, it will be there, 2.5 hours. That means 8:30, you have to finish your breakfast. And if you take 9 o'clock, actually the brain already, the platform is prepared and all your vital organs are working. Now, if you have breakfast, it is like war. If you wanted to take breakfast then you have to reduce the meal timings. Like 3 times a day, usually all of us we have meal. If you wanted to have late breakfast, you must have only 2 meal program. That I'll come to that. The second meal, if somebody is taking 3 times, so second one is the second peak of cortisol that happens with the mid noon time. So that is 12 noon. One should have 12 to 2 hours. That means that is the cortisol time again. So that is the second peak which you can have your lunch. And dinner, sunset to 2 hours. That is 6 o'clock, 6 p.m. to 8 p.m. These are the circadian rhythm timings where you have to align your food intake. This is what we tell everyone. Otherwise, if somebody is diabetic, then we tell them go on intermittent fasting. And intermittent fasting, people define in their own way. This must happen only in 8-hour window, and that 8-hour window must be between the, after the cortisol goes down, that is around 9 and 10, that is your first meal. And the last meal of the day will be before sunset, that is 5 to 6. Nothing after 6 except water. So these are the eating habits we teach them, everyone, to follow up. Second one is sleep timings. Sleep timings also, people say that I have 8 hours of sleep every day. But it should not start 2 a.m. in the middle of the night, because your body follows again sunlight. So 6 o'clock to 10 o'clock is the cortisol zeroing time. So by 10 p.m. there is no cortisol in the body. Then melatonin starts from your pineal gland and it gives you that calmness and sleep. So if you don't sleep by 10 o'clock or max by 11 p.m., so naturally again there is war time inside. So that is the reason whatever the food you like, you try to eat in the middle of the night. Next day you feel like indigestion. I don't want to have breakfast. Kind of stories we hear. All this is happening because you never followed the melatonin time. So one has to sleep by 10 p.m. ideally, if not at least 11 p.m. one has to go for the sleep. And 6 hours of sleep is quite good enough for an adult. That means again you can get up by 5 o'clock and do whatever you want in the morning. And the third one is exercise. Exercise is the one, it is like a pill. It's like a drug. So that your telomeres will not get shortened further. So at least have 30 to 45 minutes of walking. That's what we tell everyone. And the last one is, of course, the stress management, which elaboratively we all heard just now. And social connectivity is very important to not to have chronic stress. Friendships are very important, positive friendships and positive thought process, to feel sense of purpose, why I am here, why I am on this earth. So once you feel that positively, then our thought process also will be much more positive. And this is the regular teaching which we give post-operatively, and we follow up with them, at least for first 6 months. Usually 7th month onwards, everybody becomes a guru, and everyone says, you see, most of them at least, they follow. And some of them, they don't follow also. Particularly, we face problems with alcoholics.
Alcoholics.
Alcohol is also energy.
Yes.
I'm not eating anything, but every day I'm having a liter of beer, then story is different.
So many carbs and so much energy.
Naturally. So, alcohol, smoking must be curtailed. At least socializing is okay. That is, usually I say 30 ml or max 60 ml. Nothing more than that. And this is the lifestyle which we follow up with them post-surgery.
So one last question before we go to Dr. Anupama. So how many of your, just for statistics purpose, curiosity, how many of your patients who underwent this surgery follow these rules that you just mentioned, or lifestyle choices?
Usually 80% of the people they follow.
That's good to know.
20% they don't follow. So some of them I reoperated.
Oh, wow.
So in bariatric surgery means it's not one technique, it has total 5 techniques. So we use much more harsh operation where I create forcefully malabsorption in them.
Great.
That's how
Thank
it
you.
happens.
And the next question is to you for, if you had to suggest one simple evidence-based Ayurvedic practice for sleep, obesity, stress reduction, hypertension, all these metabolic syndrome, what would that be for a busy working adults? This is for all adults, that's where the topic is. So if you can, from your experience and practice.
Sure. Dr. Krishnamohan, whatever said now, it all comes under Ayurveda Dinacharya. So whatever you follow, the process, yeah, okay. So whatever he said during this daytime, this Dinacharya, getting up in the morning, having breakfast on time, and sleeping on time. So 3 meals per day. These are all comes under Ayurvedic Dinacharya. At the same time, I wanted to add one more thing to that. There is Rutacharya, seasonal regimen we follow here in Ayurvedic perspective. Seasonal regimen means when the season changes, there is changes occurs whatever in the environment, the same changes happens in our body also. So we have to follow this some process we said in Ayurveda, we have to follow. Otherwise, what happens is there is a digestion problems may occur, infections and allergies, they may see all during these seasonal changes. So that is, that's along, I just wanted to add those things. And regarding my question, so again, sleep, evidence-based sleep means if everyone knows that sleep is very important for us. So without sleep, we are getting more than physical issues, we are getting mental issues nowadays. All the other team, they have told all these things from childhood itself. So sleep is very important. It should be 6 to 8 hours depending on their body nature. We go with the body constitution of each person, like Vata, Pitta, Kapha. So basing on that, we advise how many hours they have to sleep. The basic first 6 to 8 hours is a common sleep for each and everyone. Then again, the sleep time should be, as doctor said, definitely, actually Ayurveda says from Suryastamaya to sunset. Suryodaya to sunset. Suryastamaya is the time we have to work, and Suryastamaya is the time to sleep. But as practical things, it's not possible nowadays. So we can just modify according to our convenience to 10 to 11. So that is the right time to sleep. And then it comes to stress managing. So definitely yoga and meditation and positive affirmation. These 3 things should help a lot, because I advise my patients always these to manage stress. So with the meditation, it happens, what happens is our neural pathways and autonomic nervous system become very strong. And positive affirmation also gives positive neural pathways. So, and these are little difficult for sometimes for some people, but at least meditation, 5 minutes, slow meditation, slow deep breathing. Like Anuloma, if anybody can do means simple things, right? So Anuloma, Viloma kind of your pranayama, or at least a slow breathing is the things can be done for an adult. He can do wherever he is, in office, in home, anytime when he feels stressed, they can start doing this one. Definitely they see the results with the calmness, and they can get better solutions if the stress levels is managed. Then you're asking for digestion again. So other thing.
Sorry?
Stress, sleep, stress, and whatever you.
All these metabolic hypertension.
Yeah. So
all these are related.
These
diabetes also, right? All
yes.
these 4 things.
Okay. So again, I'll tell some things about the digestion. So we have to make our digestion better. We call it as Agni. Agni should be maintained properly. So Agni means our digestive power. If Agni is not there, then there is no immunity, then there is no longevity reduces. So we always believe that gut is the main source of all disease and all health. So having a good healthy diet, so timely diet, not a healthy, instead of that, timely diet is very important. Healthy timely diet I suggest to everyone. So breakfast time between 8 to 9, and lunch time 12 to 2, and dinner time around 7. So because the pitta is maximum at midnight, because pitta is a reason for our digestion. So we always say when sun is up, the digestion is good. So if we go with the nature, the circadian rhythm is matches with our biological clock. So when there is sun, the digestion is more. So that's why we can have heavy meal during lunch times, and moderate breakfast and light lunches. These are the basic things we can follow. But again, it all depends on the body constitution of the person who comes to us and who I see. So we'll advise more. But this is the basic things I advise the people, and I see very good results with the small changes, not big things, very small changes in the diet. At least they can move 1 hour either sides, then they can see the results. So just follow this circadian rhythm which aligns with our biological clock. That helps to maintain body health, maintains healthness.
Thank you. And Dr. Shashindran, as a physician and as a dean, so how do you take lifestyle choice not as an afterthought to the students, but inculcate them to deal with including the treatment of patients at the very beginning of their careers?
So when we look at talking to students and young doctors about and telling them about lifestyle, I always ask this question to any audience that I have. I say that, today our lifespan is steadily increasing. My grandmother lived till she was 90. I know that we'll all live up to 100. Now, if you look at today's world, people in their 30s are getting diabetes and hypertension. So if you're going to live up to 100, for majority, 2/3 of your life, you're going to be popping a handful of pills into your mouth. Is that the choice you want to make? So that is the first question you should start thinking about. If you don't want to make that choice, or you say that is there an alternative, it's good lifestyle. And the choice starts in your teens. Now why does it start in your teens? Now, your brain stops growing at the age of 18. And between 18 and 30, only the interneuronal connections are increasing. Your muscle growth is maximum up to 20. And from 40 years, you start losing muscle mass. 1 to 1.5% muscle mass is lost per year, and 2 to 5% of muscle strength is lost per year. Now, if this is what is going to happen to you, then we should be addressing all these things in our youth. So, good lifestyle advice should start in childhood. So, teens, you should say, have good diet, sleep well, exercise well, build muscle mass, because that will be required when you become old. Most important today about the crisis that our generation faces is mobile phones and social media. They all live with virtual friends. Real friends they don't have. So there's a very beautiful Japanese concept called moai. Moai means you build friendship in childhood and carry it to old age. Last weekend, my mother, who is 87 years old, her friend of 65 years came to visit her. She couldn't travel alone. She brought her daughter and son-in-law along, but she was greatly motivated to come and visit her friend. So this is lifelong friendship which continues, and these are the relations which actually sustain you through life and keep you healthy. So I feel that these are very important. All lifestyle choices that you make about good diet, exercise, sleep, everything starts in childhood. Second, good friendships very much required for you to live healthily and be happy. Last important thing is about stress, which everybody talks about stress. I always tell people, you should only worry about things which are in your control. Don't worry about things which are not in your control. And if you can just implement this one principle, half your tension goes.
Great, very well said, thank you. So, Uma, I have a few set of questions. I will not go with the what people are reading today in ChatGPT. The previous panel really addressed that in ChatGPT long. In the interest of time, I will ask you how to deal with in community, so in the area of chatbots and social media, how to deal with, from the health perspective, mis and disinformation. That's one question. Second question is, why don't people practice what they already know? Because a lot of people, at least educated people, know a lot of it. But whatever the reason, they don't follow. So if you can quickly address these two.
Quick, two things.
Yes.
We recently had COVID about 5 years ago, and we've already forgotten the hygiene that we learned and implemented very rigorously to live well. Today we are taking it as influenza as it comes. Do we remember that we were supposed to hand wash, wear masks if we were not feeling great, not be in crowded spaces when we were not feeling so good? So information is something that we already have. Dealing with misinformation is also something that we also have. Everybody has an opinion on every lifestyle modification. And if you open your reels or whatever, from how to move your fingers to how to eat to how to generate your own lifestyle, is all displayed over there. How much do we know about it? We do. Do we implement it? There is a fear psychosis. There is something that we look at when we say, am I being lazy about it after a while? There's always a lack of time because something else takes precedence over whatever you need to do in terms of making healthy choices.
Always.
Yeah. And there are excuses galore. So if you don't want to prioritize your health span, there are two things that can happen. One, you know it all and you'll end up in hospital. If you have the money to pay the big bills, you'll still come out of it. If you don't, you may not. The second is that you have that information. Don't spread it to others. Don't give grief to others, your immediate family members who are concerned about you. It's a disrespect to people who want to be a part of your life if you don't take care of yourself. How often do you want a child to come from some distance to look after you as you age and you start looking at your health span as being difficult? How often do you want a parent to stand with you in a hospital when you're not taking care of yourself? So 3 or 4 things to say is respect those people around you, even if you don't respect yourself. So if you want to start respecting yourself and looking at your health span, make those choices. They're not difficult to implement. Smoking is the next sitting. Sitting is the next smoking. You get all kinds of information. If you look at any of the bottles or any of the packages that you look at, everything has information on it. Read it, digest it, and make sure that you live it. Because it's your life and not somebody else's that you're living. So I'll stop here.
Thank you. And last, Raghu. Just one curious about what is Solix, and you are working in the technology sector that will impact health span or health in general, and also lifestyle choices, both from life sciences and healthcare perspective, what Solix is. Quickly, yeah, we're running out of time, yes.
Yeah, one thing I want to tell, Uma Madam rightly mentioned, there is a lots of information is available. For me also, health span is a high dimensional data problem. Solix visionary management try to build a AI-driven lifestyle intelligence platform on that one. You can see here, Solix Healthcare, I have a 3 productive layer. One is the personal, and another one is connected and predictive. These 3 productive layer we are focusing on it, and our intelligence, lifestyle intelligence platform will be protecting the healthcare span. That is the one. And personalized means it is a kind of image analytics. What food you are taking, how many calories you are taking, how many calories you are going to take out. That is the optimization it is analyzing by AI powered that intelligence also personalized to the what you are taking the food. It is indirectly it is a metabolic profiling, and analyzing that food energy. It is AI driven, can able to recognize it, how many vitamins, what kind of vitamins, and how many calories we have with that food. For example, if we take the biryani and how many calories you burn in that day, how many is remaining. Like that is an intelligence platform able to do personalized analysis. Another one is the connected layer. It is the wearables. For example, you have a Apple Watch like that. You can see that based on that wearable platform able to analyze your connected data and clinical inputs, and also herbal databases, so that you take what you are taking, what is you are lacking, can able to recognize it. That is the advantage if you have a healthcare applications. What is Solex is focusing. All are AI driven, and it is optimized towards your personality, like similar to the Ayurvedic, say that Vata, Pitta, Kapha kind of system. It is personalized towards yours. That is the way applications also working on it. And last one is the predictive prevention. It is a very critical one. It able to tell you that what is your lacking, what nutritions you need it, what kind of profile you are building in respect of plan, and what is the sleep period, and how to improve it. Those kind of information it able to provide by Solex healthcare applications. So if Uma madam says if you like to increase the healthcare span, you can use the AI powered application, and you can able to schedule it. You can able to make that use of the technology to improve your lifespan or a health span.
Excellent, Raghu. Yes.
You asked that why most of us we know this information,
yes,
but still why we don't catch up. See, personal stress, professional stress, which leads to chronic stress, and that amounts to the cortisol production, which is stress hormone, and that leads to ghrelin production, that is your hunger hormone, and that leads to eating, and that eating becomes hedonic eating habit, where you see for pleasure eating. When we are stressed out, we eat something. When we are free, we eat. When we are busy, we eat. And when we meet, we eat. So without our knowledge, we go into hedonic eating habits, and this never stops. And then it affects the family communication.
Yes.
And the parental communication will not be there with the children, and they also follow the same thing, and it leads to familial obesity. And it's a vicious cycle. I think maybe AI can help, where now so many digital twins are there. I think CGM patches and how glucose is being really monitored and all.
Yeah, we are using AML to train our models. That will eventually impact. We are just 1 year into all this, but we'll make the goal, and we are ambitious to make an impact on the lifestyle with all the data and training the model and individualize to care.
I have a question, whether AI can tell me how much stress I have today.
No, AI cannot tell that. It will learning from data that we get from hospitals will be able to train models, not to be prescriptive, but for wearables and all that, right? That will help us.
Maybe something was there.
So we're not doctors. The doctors can use the data to fine-tune their treatments better. So
Maybe if stress is increasing, BP is increasing, or something like that. You see, some advisory. If AI can come up, I think it may help along with CGM patch,
yes,
and something you wear, and try to modify your eating habits.
I think we ran out
One
of
thing
time.
I want to add, there is a stress markers able to predict AI based on the question and answers. Similar to the doctors, different questions it will ask based on answer, your answers, it able to predict depression or stress. This is the one.
How clean it will be, we don't know. Hallucinations,
Yeah, that is a
hallucinations we are
very,
talking
very
about.
specific models need to be improved. Yeah.
Maybe those digital markers must come along with the inflammatory markers. If you combine
want to
inflammatory
add.
markers.
Yeah, one last word because we really
Yeah,
ran out
I
of
just
time.
want to add, there are people who train as physicians, doctors, and everybody, and they put their life into it. There are 10, 15, 20, 40 years. When you walk into the room, they know what's going on with you. They don't need 50 tests or AI to help you with that. So let's give it to them, and the big round of applause to say that they can be supported with AI, but you cannot replace them with AI.
As in the previous panel member mentioned, AI can never replace human intuition and doctors. Yes. With that, we run out of time. Thank you, everyone. Thanks. A big round of applause to the panel members.
Yeah. Thank you very much. May I now request Rajagaru to give the speaker mementos, please. Thank you very much. Well, this is going to be our last panel for today. It's all about community change makers, ladies and gentlemen. And now our final discussion that we have, this is a conversation that focuses on force essential to healthcare transformation, activating community change makers for healthcare. And healthcare does not begin in hospitals alone. It begins in communities through grassroots leadership, local action, and collective responsibility. Lasting change happens when communities themselves become part of the solution. So moderating this session, may I now invite Mr. Gopal Garg, Director of Ecosystem and Partnerships for Project Aspire Ashoka Foundation. And may I also invite Evita Fernandez. She's Fellow for Royal College of Obstetricians and Gynecologists, London. And she's also the chairperson, Fernandez Foundation, Natural Birthing and Midwifery Championship. May I also invite Anshu Gupta. She's Foundation Gunj and Gram Swabhiman. And Mukti Bosco, founder and secretary for Healing Fields Foundation. And Vasi Reddy, he's co-founder and CEO for Rian Foundation. And last but not the least, Suresh Mani, Vice President Engineering and Chief AI Architect, Solix Technologies. Thank you.
Okay, so welcome everyone for this panel. Last but not the least, yes, one caveat I was given is maybe the minister is on the way, so in case if he come, we have to give a 10 minutes gap. So please bear with us if that happens. Otherwise, we are good as long as he comes in. So I'm wishing he comes a little late so we can complete our panel. On that note, let's begin, and I'll not go into much introductions. I'll directly jump into the conversation. As we all talk about communities, as we all talk about patients, I think we have given enough name to the person who need the health care. Okay, so maybe I want to jump into the quick question with Anshu, because while we were talking outside, he talked about a customer, how a for-profit world looks at a customer and how a not-for-profit world looks at a customer. It is not to separate the two worlds, but just try to get a perspective on how we look at the customer, who is the person who needs healthcare here. So yes, Anshu.
Okay. No, I think just to give a perspective, if you see the difference in the for-profit and the not-for-profit world, fine. I mean, of course, health sector somewhere comes in between, but the fact remains that the for-profit sector is largely looking for a happy customer, right? Happy customer to sell your services or sell your products. But if you see the not-for-profit sector, from where many of us come now, I mean, of course, our career started with the for-profit, but now moved to the not-for-profit. So maybe a little bit we understand both. We are unfortunately looking for a person in grief. Our entire life is actually spent in just looking for people in grief. Right? And it's very complicated to handle grief of people. And then with that also you need to look for an okay life and all that. And the other thing is that the way the for-profit sector keeps looking for a much happier person in many product range, that okay, this you can afford, now I need to move to the next level, I need to sell my iPhone 17 kind of stuff, because you already have iPhone 16. I think the irony of this sector is कि हमको और दुखी लोग चाहिए, you know, that is the worst thing. कि okay, this segment is okay, they are still okay, government is taking care, other people are doing it. Now can we move to the other places where people are, you know, facing problems?
Great. No, thanks, Anshu. And that's what we want to set the context here to see how do you look at the person you're serving. So are you looking at that person as a client or a customer or the person whom you're trying to really transform, and also equip that person in the process of transformation so that the person can get more empowered in the whole process. So on that note, I will go to Dr. Evita here. And the question is, her work is very deep and transformative in the midwifery initiative. And you have turned nurses and midwives into strong community anchors for respectful maternity care. So what have you learned about how to identify and nurture such grassroots champions inside the public system?
Thank you. Thank you for inviting me to be a part of this panel. When you're talking about a midwife, I need to just explain to the audience here. We are not talking about the traditional birth attendant who would have birthed our grandmothers. We're talking about a nurse who is trained to global standards and who now takes charge of two lives, the mother and the baby. A nurse generally takes orders, but when she trains to be a midwife, she takes charge. So she actually takes care of pregnant women who are healthy, who have no complications, which today form about 40% of the pregnant population. So when you empower a nurse with knowledge and skills and say, now you are capable of offering care. So considering India has 25 million births a year with 60% in public hospitals where there's overcrowding, and a woman, when she's giving birth, it's the most significant moment in her life. And if there's a death, most of the deaths happen around childbirth. So these are preventable. So when you've got this new professional cadre and put her into the community, she becomes an agent of change. And that's what's happened in Telangana, Andhra, where we have trained. In Telangana, we've trained 353 nurses who are now posted in clusters across 50 district hospitals. So where you have midwives, they ensure, because the philosophy is based on respect, kindness, dignity, privacy. Skills and knowledge is a given, but this comes with the midwifery philosophy. And so you don't see disrespect and abuse. Mothers today in public hospitals have a birth companion and can birth in position of choice. So it's transformed the landscape for the poorest of our poor women who are forced to go into public hospitals because they have no choice. But today they have a voice because the midwife is there to advocate for these women.
Great, thanks, Evita. And also just to follow-up question on that, because the women in labor is always looked at vulnerable, and how do you turn around from that perspective of the other person from a respect perspective? So would you like to highlight that point?
Yeah, I think your question is, how do you transform the nurse into becoming a more compassionate?
Yes.
Yeah.
And how do they look at not just the patient who is delivering,
yes,
but there is a new birth happening.
Yeah.
So how will that perspective comes into the person who is helping that happen?
Right. So this was the first time I was training nurses, and we had a small group. I had a midwife from the UK. So how do you get that transformation of bringing that whole perspective of looking at a woman not as a patient, but a woman who is pregnant? And how do you bring compassion? So we started with talking about birth stories. And I discovered that women remember everything surrounding their birth. So when a woman is traumatized because the staff has been disrespectful, her privacy is not intact, it remains with her and she's scarred for life. So in this first batch of 30 nurses, seasoned nurses, I may tell you, we spoke about birth stories, and then the penny dropped. Because out of 30, 25 were mothers, and they began to talk about their own birth stories, and each of them was traumatized. So what began as a lecture turned into a transformation, and soon these 30 nurses said, "Good God, we've never spoken about this, but we carried this trauma for years. We will never, ever treat a woman in labor the way we were treated."
Thank you. That is really, I always get goosebumps and really amazing, Evita, on how you are looking at very differently and not the top-down approach which is always looked at, sorry to say, in the hospitals or in most of the places. So I'll go back to Anshu and then to Mukti. So Anshu, Gunj and Gram Swabhiman have shown how surplus can fuel dignity first, community-led change, and what conditions need to exist in a village or a basti for a true health change maker to emerge from within.
I think we are still struggling with the very basics. Fine. I mean, there's a simple example of any disaster. The moment a disaster happens, a lot of material comes from the cities. And what we get, even in medicines and all, or this medical support, what we get from the cities is maybe some medicines for hypertension, to diabetes, to cancer, whatever. And what that particular region right now need is just maybe some basic medicine for your stomach, for some pain, or some ointments or something for the injuries, okay? Or maybe a lot of betadine kind of thing. Fortunately, we can say a lot of bad things about RMPs, registered medical practitioners. We can say a lot of bad things about it, and of course, I'll not say that this is the best possible system, but this country already has a very vibrant culture and education of, say, RMPs, and more importantly, the entire Asha worker, segment with different names and all. So you already have those, right? The only important part is that how do we build their capacities till the time we have much better healthcare. They can handle it, and to be honest, COVID was one of the biggest proof of that. Every single medical system which was ignored or discarded by this country, right? Whether it is a small PHC in the village, or a ASHA worker, or an RMP, at the end of the day was there to give vitamin C, crocin, whatever was needed at that particular time. Otherwise, we would have failed miserably. These were the people who were there. So what I'm trying to say is that it exists. We need to recognize that. We need to equip that with the very basics instead of thinking like a very ultra modern stuff. Right now, whatever exists need to be better. That's the most important part. I mean, we work massively on, we were the first people to talk about menstruation in the country, right? And it started in 2004-5. I was there in a place called Firozabad, next to Agra. And that is where a lady shared that how one of her sister used a piece of blouse which had a hook, and she died of tetanus. Right? That was an absolute eye-opener. We never thought about it, although we started working on the issue of clothing, but we never knew about it. And then we started exploring all across the country that what is this happening, and it's not this issue limited to India. This is a global issue. That how even today, millions is a very small number in India. We all know, sitting in this place. Crores and crores of women and girls are using sand, ash, jute bags, rugs, racks, newspaper, grass, cow dung, anything and everything which can stop or which can absorb. Right? The biggest reason for uterus removal is lack of that small piece of cloth. I mean, I am saying cloth, but it could be anything. Now, the problem exists. Okay. Solution is not very expensive. I am saying that till the time we provide proper sanitary pad to people, even if we just work on the education and tell people that all these boils and itching and white discharge also happen because of this, right? And you don't notice this because this is a very simple women's health story in India and in many other countries. We don't even question that. We take it as part of life. So see how if we just make sure that even if the product is not available for the entire country or the entire world, a good kind of very desi, very localized information and awareness is available. Okay? Things will start changing. I mean, we created out of a piece of cloth. And you'll not believe, Gopal, after using that, we all can debate, kapda acha hai, nahi hai. I mean, in the world where, if not my mother, at least maybe her mother must have used a piece of cloth. Okay? But when they use it for a month or two, that is where they are able to realize that it is a health issue. But after using something clean, because they never had access to a clean thing. So that's what I'm saying. Infrastructure is there. Just little bit of our effort and willingness and understanding that it's not a women issue, it's a human issue. If we just solve this little bit of problem, half of health issues in village India or with the communities will not even happen.
Great, thanks. And this also highlights how the bottom-up approach happens, and the most important thing is respect towards the person who are giving healthcare. And when you see people who are needing and providing the healthcare, that's where Mukti's work is through the community health entrepreneurs, where she empowers, she brings up those women who become healthcare providers. So Mukti, how has been your experience? I know it's not easy journey to train people, to bring them up to this level. So what is that inflection point you think has helped them to become community health providers?
Okay, at Healing Fields Foundation, till date we have trained about 8,000 women, more than 8,000 women in that many villages across India. Before we went on the journey for the community health entrepreneur, we were doing health financing and micro health insurance, and we said that we need to provide cashless service as all of us have. We were the first ones in the country who came up with a post-hospitalization treatment as well as a co-payment, so that there could be, that the people can question the healthcare, the hospitals for overcharging, etc. We had a facilitator at the hospital. So after treatment, the facilitator would go into the villages to train the people and how to prevent illnesses. At that point, about 25, 26 years ago, what we saw was basic information was not there. We did not have even Uncle Google, neither did we have AI, none of that. And so one of the women, that time, a lot of people would come to us with vaginal inflammatory diseases. I would send some of them, if 16-year-olds, to Evita because some doctor quack there has said do a hysterectomy. And what we realized is the woman there who had come to hospital for a vaginal inflammatory disease and was admitted in hospital and went back, and the doctor had given her suppositories. When our facilitator went into the community to check on her, how she was doing, this lady said, oh, that hospital, networked hospital, the doctor is no good. When we asked her why, she said, how can we swallow such a big capsule? Nobody had bothered to tell her the suppository is not to swallow, but to insert. And people were coming to us with repeated infections. And one thing, of course, like what Anshu said, is menstruation is a huge problem. And then the other one is contaminated water, food, which basic health and hygiene, which all of us take for granted. That was a starting of the training of the women. Now, who's the women that we pick? We go to the villages, spend a lot of time with the panchayat leader, with the Asha worker, with the Anganwadi worker, with the SHG women to identify one woman who will stay in the village. Who will stay in the village, who can communicate, who the community trusts. We do not take adolescent girls. We do not take young women because they would get married and go to their husband's village. So it has to be a daughter-in-law of the village whose youngest child should be a minimum of 5 years. Why is that? Because by then she would have been embedded in her community. And she will have a voice within her own house. And the child can start going to the Anganwadi center because we expect them to work for about 2 to 3 to 5 hours. A person who is trusted, not a medical person, not a degree holder, but who is willing, open to learn, and feels empathy for her community. That I need to learn something for myself, for my own betterment, as well as to the community I want to help. And we put them through a structured training program. The inflection, ours, if anybody wants to know more, I will talk to you all later. But the inflection point is after in the 3rd or the 4th month, they undergo the American Heart Association's first aid certified training program. And that training program becomes the inflection point because anybody falling from the tree and a child has broken an arm or a leg. This is the woman who is called. Can I take a minute?
Yeah.
In remote UP, where women even now are with gungats. They live in joint family. So we had one of those typical UP woman in a remote village, and she was a community health entrepreneur. One day late in the night, one of us got a phone call and this lady was crying away. We were wondering what had happened, and she said, my brother-in-law is asking me to leave the house and go. Now where do I go? So immediately we got the staff activated to go and check out what was happening. Next day by 6 o'clock in the morning, our training coordinator and field coordinator was in the village. Her husband's cousin, it was harvest time. They had harvested. You would have seen this huge tractors with trailers where they put the hay and they were taking it. And this guy fell from the top down. And everybody around came running, but nobody can do anything because he's bleeding, he's injured. So this lady also ran to the place and she was trying to tell, somebody told, "Ha, CHG didi hai, kuch karegi." And this lady stopped because this is a stranger. even though it's from the same village, but as a UP Bahu, she is not allowed to touch anybody else other than her father, brother, husband, and sons. So she can't do the first aid. So she was trying to tell them how to stabilize the leg, how to put the sling for the arm, and nobody were able to do it. Then the husband says, "What are you talking so much? The guy is in so much pain. You come and do it." So she went and did it. She stabilized the leg, got the bamboo, splintered it up, and got a bed sheets, got the bamboo, made a stretcher, and got them to transport this man to the nearest hospital. The hospital, of course, the doctor said, "Who is this lady? Who has done this first aid?" And when he figured that this was a lady who was semi-educated, and he was really happy and saying that saved his hands and legs, and the bandage to the head stopped the bleeding. Brother-in-law comes and says, "How dare you touch a strange man? You will have to be thrown out of the house. You have to be excommunicated." It's a joint family. Next day, father visited the hospital. The doctor said, "Badai ho, your daughter-in-law saved this man's life." And everybody comes and tells the father-in-law, "You have a fantastic daughter-in-law." The fight is still going on in the house. He comes home, tells his younger son, "You want somebody to go? Because of you, till date, I have not had any pride. You get out of the house, my daughter-in-law will stay."
Wow.
That is the inflection point. That is the inflection point and the change that happens.
Gopal, just to what you were talking about, the infrastructure.
Yeah.
This story tells you that how much wisdom, how much great, how much everything is available locally. I mean, in this entire story, except knowledge, nothing went from the cities or went from outside.
Absolutely.
That is the story. I mean, that's what villages or the communities are.
Absolutely. And this also, thanks Mukti for bringing the story up, and it's so evident. As we all know, the number of people stay in the villages. I don't have to talk when we are sitting in a place like India. And we have talked about the health infrastructure in city and other places, but what is happening to these places? And imagine if every village has got the community health entrepreneur which Mukti is training, what kind of a world it look like. At least the first aid, at least the first response can start happening. So thanks a lot Mukti for bringing that story. So we have an interesting panel here, just want to bring to everyone's notice. So we have Dr. Evita, Mukti, Anshu, they are the Ashoka Fellows who are part of the largest Ashoka global community. We have 4,000 such Ashoka Fellows across 96 countries. So they are part of that network. So I'm really happy to see our fellows sitting here and talking to you all. And we have people working across sectors, not just health. And interestingly, on the dais, we also have two interesting friends we have Sri, who comes from a tech background, moving into health. Of course, he don't want me to tell him like a techie, but I still want to insist and want to bring all of you to his own story on how he started his journey as a tech entrepreneur in the US and then move into founding something called as Rian Foundation, where he's building platform to see how people can get help. So maybe on that note, Sri, and then I'll come to Suresh's story also. So Sri, you want to bring up the point, you have heard the three stories of how Evita, Anshu, and Mukti is doing, and you're trying to enable them. So how do you see that enabling, and I want to really bring your frustration out to the audience here, like what are you most frustrated about?
No, thanks a lot. I come from a perspective, just to lay the ground, there's a lot of emphasis on access to care, which is very important. When we think about care, we're talking about, can I see a doctor or a patient? But if you magically solve that problem and 24/7 it's free for everybody in the world, I believe there'll still be a healthcare problem remaining because we as individuals are very bad at complying with the advice of our doctors, right? We take, even very educated people, if you had a surgery or your parents had a surgery, you're given a lot of information. When you go home, then all the doubts start popping up. Can I eat this or not? How do I do my physiotherapy? Those kinds of things, right? So now to bring it back to, if we take a health worker, ASHA worker, now we talk about COVID, they are bombarded with, they are the solution to every problem, like, maternity care, COVID, hypertension, TB. Now think about, you keep on getting these trainings. How do you remember what is needed when it is there? So we all retain hardly 10% of what we learn. But when we have a need for it and when we can get access to that information is when we really change. That's one aspect of it. The other aspect of it is the whole of public health is set up in such a way that they're collecting a lot of information on paper, and all that is good for statistically at some district level, state level. For that individual's health, there is no clear answer. So what motivation would that individual have when that ASHA worker shows up next time asking to fill another form, right? But that's how this whole thing is structured. And, as technologists, we kind of tend to take a hammer and try to find a nail. But the real problem, I think, I still don't know what value we add. So the need, nobody argues. There is always a need from a patient perspective, needs a companion to advise them exactly on what to do. Health worker needs that knowledge, right? From a value perspective, it's very easy to jump in as a technologist to the solution. But we tend to ignore that whatever we come up with needs to fit with the existing workflows. And it needs to reduce the cognitive load. So don't ask them to collect even more data. Give the actionable insights that they can do, right? So these kinds of solutions, unfortunately, we bring very less to the table, and we get surprised. And from their perspective, there are 100 technologies coming at you with a hammer. And they don't want any technologies in their face. Right? So it's really being able to associate yourself, understand the need on the ground, and not what ChatGPT tells you or what brilliant people told you, right? So getting to that, I think, is the real problem.
Great, thanks, Sri. And we were also talking because one of the major issue which Sri was telling is when he tracked people's health indicators, and then he also helped people remind on taking tablet, but then also they miss taking tablets. So the question we were asking is, if AI takes the tablet, will it solve the problem?
Yeah. So I tend to say, AI is nothing is going to solve that problem in 100 years. AI is not a solution to that problem, right?
Yeah. So on that note, I want to go to Suresh, who is really from a product mindset, working at Solix of technologies. And so Suresh, you are seeing so many solutions being thrown with a hammer and looking for the nail. So how do you see this solving, because there are more solutions for all of your information than the problems. So how do you see, one is this gap, and also how do you see the problem of adaptation? Because there must be some gap, because if there are more solutions and less problems, but the problem is not still solved. So what is happening here?
Yeah, thank you, but great stories, amazing work actually, because that's the core part which I will touch at the end, where technology meets the care. The basic fundamental when technology enters a space is for two things, right? Initial cost is high. Challenges will be there. But the purpose of technology over time, you can see in any space, is to scale and to reduce the cost, right? These two are the major problems in any non-profit activity too. You can see it from day in and day out. Whatever care we are trying to give, these two are the critical ones. Now, what Solix and our TAL initiative is to create a platform around this as much as possible. Yes, we are building up the specialities in that platform, but technology has its own bound. It will stop at some point, because the point of care is critical. That's where I love the story each one of you brought in, because technology has its breadth and depth over time, and it can scale massively, but at the point of care, somebody has to use that, right? And has to educate that, bring that awareness to the community, because at the end point, not everybody has got the access or in terms of having a smartphone, downloading the app. They won't have it. But with right awareness, right help, the end care, it will definitely scale. That's my first take on this, actually.
Great, thanks, Suresh. So you can see the bridge where we need social entrepreneurs like them who bring that adaptation in place, which actually make it more contextual for the person who need the care and what technology is providing. So I'll go back to our 3 change makers, what we call them, and want to ask each one of you, if you want to get the audience here engaged, how do you think they can engage? So we have the entire health fraternity here. How do you think they can be better engaged in activating the community more and more so they take charge of their own health and don't look up to for the outside help? Of course, they need outside help, but for the first responders, what do you think the room can do to join you in your missions? Any 3 of you? And of course, I want all 3 of you to answer this.
From the maternal health perspective, because I look after pregnancy and childbirth, so we're looking at birthing the new humanity. And I would urge every young man here who's going to be a father or who is planning to be married and to be a father, get your wife to be empowered, take charge of her health, get all the information she needs before she gets pregnant so she can be fit and give birth to a healthy child, because the next generation gets a better deal. The other thing I would urge everybody who's connected with young women who are going to get pregnant, there's nothing better than a normal birth as against an unnecessary C-section. There is enough data to show today that children born through C-section are deprived of the immunity protection from the mother's microbiome, but they lose because they don't come through the normal birth canal. So these children are starting life already on the back foot. So these children, when you actually follow them up, they end up with obesity, childhood diabetes, asthma, and many other conditions, including autism. So please, take charge, encourage your wives, nieces, sisters to look at normal birth rather than an unnecessary C-section, because we are talking about the next generation. Thank you.
Thank you very much, Dr. Evita.
I think the death from a financially weaker section person in that society cannot be taken for granted. I mean, we have been arguing about this, that every single woman goes through a very complicated 9-month process. It's easy to say कि इतने बच्चे हो गए and enjoyment and all that kind of nonsense thing, but the fact remains that in the toughest scenario, women are giving birth, and again, and we know, because when we talk about, when we deal with people, and I think all 3 and many of us know, many times the women actually, the first thing which she asks for is a tablet. And the tablet because she does not want to give birth to one more kid. If that is happening, that is a failure of us. Fine? No one is willingly doing that. So it's very important that we really get into some deeper issues and see that deaths are not taken for granted. It's emotional, it's physical, it's a whole lot of burden. Number 2, we all know, even in our families who are comparatively much more privileged, that if one person is hospitalized, the entire earning, the hard work of the entire family goes away in one go. Whole lot of us have lost a lot in COVID. Fine, a lot of people have not come back to the normal life that way. So how do we really take care of that? And the third part is that I think I always say that this is a fight between killing a mosquito or treating malaria. Fine. The small example which some of us have given, or the small example which I just shared about a small cloth-based sanitary pad or any other solution, is about killing a mosquito. Once you kill that mosquito, you do not have to treat malaria in any case. So whole lot of us with so much of experience, with so much of resources, with so much of knowledge, which to be honest, I didn't have. I was not a doctor at all. You know, I'm sitting with a doctor, but I was not. And none of us in our team. You guys are really, really much more experienced, much more talented. You are not looking for happy customer like us. In any case, people in grief only come to you. It's very important that all of us just get into treating these, or rather killing these mosquitoes, so that the malaria doesn't happen. It's very simple, and that's in your hand.
Great, thank you, Anshu. Yes, Mukti.
Yeah, what is it that the people from outside and all of you can provide for the poor? One of the things that we always say is the trained medical professionals treat an illness. They are very important, very vital. But a trusted person within the village to be available so that the person can go to this person and ask questions that they are not comfortable asking the doctors. I have nothing against the doctors. It is just that we are all a privileged group. And our language, even though we speak the same language, is different. And that woman, that elderly, that young girl is more comfortable and not intimidated. So we need to have a person. Apart from that, technology. Anshu talked about COVID. You talked about telehealth. During COVID, I mean, that was a very, very important point in the 25 plus years life of Healing Fields and in my 50, 60 plus lives. That is the one-time event that all of us saw, life event, pandemic. We sent from Healing Fields about 50 buses to the remote villages. By then we had our women calling. People, migrants were coming into the villages. There was so much fear. Nobody wanted them. Even the family members were not allowing them to get into their homes. There has been a lot of suicides because my own mother, my own father, my own wife is not allowing me to enter into the houses. And there was a silver lining. When the people were coming back from Bombay and Delhi and Chennai and Bangalore, they were all going back. And the village said, CHE Didi ka paas jaiye.
Wow, wonderful.
And the CHE Didi, believe me or not, group of them called us. We quickly set up quarantine centers in the primary schools, in the panchayat bhavans, in the high schools. We supported them online. They had no clue of online technology. They started attending classes. We educated them, sitting in our comfortable homes about COVID. These women took charge, cleaned up, men separate, women separate, community kitchens were done at the community level. We set up telehealth centers with doctors who were calling. We airlifted paracetamol. We airlifted zinc and vitamin C from Hyderabad to these places because Bihar and all, the stock was over.
Yeah.
And the Asha workers, government people were being chased out of the villages because there was a whole lot of rumors and fake news going around. The CHE took charge. And those days we used to get about 10 to 20,000 telehealth calls a day from these quarantine centers from the villages. Today we get about 60 to 100. And the difference, we looked at that and the difference. At that point, there was nobody available. So technology and WhatsApp calls took a leap. But today, we still need that one person. It has to be high technology. It has to be high touch. High touch is you need to have a trusted person.
Wonderful.
Just last point. Health still has the same emergency.
Yeah.
you don't have to wait for COVID to sort it
to
out.
have
I mean, that's what we all need to understand.
Great. On that note, I know I'm also getting indications. Just one last point, as I can see also Minister Garu is here. How do you, just one question and any one of you can take, how do we bring care, trust, empathy, respect, love before the technology or medical science come into place? Because I'm realizing that is most important as a first responder, and then second, the medical science or technology comes. So any one of you would like to take that question?
My point is that by listening and by respecting as it is, I mean, by respecting the, because people are born with self-respect, we might be very privileged that we have studied in the best possible universities and all, but we cannot challenge the traditional wisdom. I mean, at the end of the day, COVID, everything which the village communities have been telling us, lesun khao, adrak khao, nibu piyo, all that kind of thing. Ultimately, we all were dependent on that, but that's the wisdom.
Yeah. So on that note, on respect and care, I would like to conclude this and really thank you, Tal and Sai and team, to giving us this opportunity. And thanks to our fellows and Sri and Suresh for joining us. Thank you very much.
Thank you very much. May I now request Suresh to give the speaker mementos, please?
Sure. And I know if you have more questions, our panelists are here for the dinner. So please catch up with them over dinner. Thank you.
Thank you very much. We'll take a 1-minute pause just to get the stage reset. Thank you very much. Thank you, ladies and gentlemen. That was a very interesting session that we had. Now we're going to go into our last session with the fireside chat and closing ceremony. As we approach this conclusion of TALHealthFest 2026, we are deeply honored to welcome distinguished leaders of the government over here, Government of Telangana. And we have with us a visionary leader who continues to shape Telangana's remarkable journey across technology, healthcare, industry, culture, and governance. May I now invite first Mr. Sai Gundevelli, CEO of Solix Technologies, and Mr. Kishore Gadiraju, Chief Evangelizing Officer, TALHospitals, and last but not the least, our Honorable Minister, Sri Sridhar Babu Garu, Minister for Information Technology, Electronics and Communications, Industries and Commerce, and Legislative Affairs, Government of Telangana. Thank you, Minister, sir. May I now request Sai to please honor the Minister with the bouquet.
May now request Kishore to honor the minister with the shawl. Thank you. Kishore, over to you.
So, good evening, everyone. I know we are delayed a little bit. I think we have completed pretty much all the sessions we wanted to complete today. I see a lot of people are coming to me and telling me, like, how effective these sessions are, and I'm very happy today, so that, people are getting what they wanted from this conference. So we'll talk about it. Sir, first of all, thank you so much, sir, for joining us today. I know you have very tough schedule today, but still you made it here. Thank you so much, sir. So just a brief summary, sir, from the morning to today. So we launched this session today, TALHealthFest. This is the third edition, sir. The first one in India. The last two we had in US. Bose Raj Garu inaugurated the session in the morning. We had a good start. And we have a lot of panels. We talked about the medical tourism, the mental health, AI and technology in healthcare, the longevity, and then community healthcare, various topics, and a lot of senior professionals and experts in this space came from, of course, some of the people came from US, some of the people came from Pune, pretty much all over India. They came and participated in this session, sir. I think, thank you, everyone. Thank you for making this event a great day today. Sir, everybody want me to ask you some of the questions because everybody want to know, I know Telangana is already a leader in various aspects and many verticals, especially the pharma, healthcare, technology is already a big technology hub. So they would like to ask us, a few things so that you can give them overall vision for the state. So my first question is, already Telangana is a leader, as I said, in many spaces. So they want to hear from you. So what is your expectations in terms of outcomes for, let's say, 2030 or 2047? So what is your vision, sir?
First of all, I have to congratulate, especially, I know people, dear friends, Mr. Sai Garu and Kishore Garu, for hosting this, apt session, convergence of medicine with technology. TALHealthFest here in Hyderabad, and we would like to really welcome all the eminent leaders from both the professions, from the medical field as well as the pure technology field, for coming all the way here from US, from different parts of India. We welcome to this part of our city and to the state of Telangana. In fact, when Kishore invited me a couple of times, and Sai Garu also invited me over there to US, we couldn't able to really make it because of pressing engagements over here. In spite of our pressing engagements today, we have the second level of our elections going on right now today. Almost is on the end of the results right now going on. But still, I thought this is very important for me, not only as a IT minister, but I have to literally share our focus of a government to the future leaders of tomorrow. Maybe it's about all the change makers here. Lot many MPOs are here, and people from CSR field are also here. Our government, especially, we're thinking about how do we leverage the medical facilities, basically the healthcare, to the poorest of the poor. The basic simple line is to see that democratize the technology in terms of the healthcare, where we literally see the inclusivity is there as our basic agenda. That's how we are trying to put it across. And few of the initiatives I would like to really share, Kishore. One is trying to profile each and every citizen of Telangana, health profile, each and every citizen of Telangana. And through that, we can literally provide the healthcare facilities to all our citizens, cutting across, all the barriers. And second thing, what we are trying to is, our health minister and our chief minister have started cancer detecting, especially for the women. And thirdly, of convergence. In the morning, I had gone for to inaugurate a big GCC over here. That's where we have seen the convergence of the pharma, the basic expertise in terms of pharma, where we converge with technology. How best results can be derived. The same thing what I'm doing right now is to talking to the eminent persons over here, many eminent doctors I can see over here, was doing great service. Now, when the technology is disrupting time, every minute you see the disruption. As when you're here, when you're coming up with some solution, some other guy sitting over there, either in the Silicon Valley or in, IT field from this, trying to disrupt the technology all the time. I just met a couple of people from the quantum. So that as technology is breezing ahead, how do we take the special emphasis on healthcare is most important. And while we are coming up, thousands of patients come to us. I take the pride in our state doctors, in our state health institutions, and also people from, private sector too, who attracts thousands of patients from, mostly from Middle East and from other countries who visit and try to get the treatment. So our government has come up with a new medical tourism policy right now. After state has been formed, this is the first time ever we just thought the medical tourism policy initiative has to take in place, and our health minister has come up with a medical tourism policy. This will attract many people who are coming unorganized over here. We would like to give an organizational pattern for them and try to literally see that the best treatment is being done for the patients who come over here. Whether it may be the cosmetic industry or it may be in different fields of the medical faculties. And we are literally have thrown this, and we are coming up with a health city. In upcoming future city, what we are trying to bring in and try to construct a new city altogether. So these are all the initiatives what we are trying to do. And the convergence is rapidly taking place. Now, if I see, I represent an area which is very remote area and absolutely rural based constituency of mine. Recently, patients have been telling me they could able to access the medical care on their mobile. And, the technology has gone deep rooted. Now, how best I can take the services of the eminent doctor or the best physician or the best gastroenterologist or the best thing what a small doctor can suggest. They can't, that will save their time, energy, financial resources. And that's how technology is pervading. And one is that case. And the second thing is the advent of the artificial intelligence, AI, which is taking place in a rapid way. We are just trying to synchronize how our health institutions, maybe the primary health centers or, area hospitals or the district health centers, how we can leverage on using these technologies. This is the next scope, what we are literally thinking, or our medical department is literally thinking and trying to shift. Not only pertaining to the core domain expertise of a doctors, how do we take the domain expertise or the eminent doctor's advice to the remote part of our state. And we would like to correlate that with the technology. Through the technology only it's possible. So the fest like this definitely will help us in trying to put our policies in the right framework. We are coming up with proper regulatory frameworks too. And we are inviting, especially the institutions like this. You know, as I was mentioning, I gave a formal invitation to the Solix and, you know, led by Mr. Sai and the team to come over here, stay put over here, how they have advanced their technology in terms of the, especially in the health tech industries. So we would like to literally take the advantage of it and try to prove that they should become one of the core area where the technology converges, fuses, synergizes with the best of the doctors who have the domain expertise in this field, and try to literally see that their skills, their expertise spreads all over the world. This is where we are trying to put it across.
No, thank you so much, sir. Like, you know, when we can see the vision, like, you know, if I can recollect some of the key points that the Honorable Minister Garu is saying, the personalized medicine, right? Like, you know, kind of DNA sequencing every citizen in Telangana so that they can really get a personalized care. And I wanted to recollect, like, you know, a couple of years ago when I met him, like, you know, sort of first time, and we were talking about some of the challenges. And like, you know, in the discussion, it came up like, you know, sir, there was policy is really key for medical tourism. And I can see his action. Immediately, he called multiple departments, like health department, tourism department, like, you know, their IT department. And he conducted a meeting and said that, yeah, there is no one good policy for medical tourism because this kind of spans across multiple departments. And he said, I want a policy, new policy within a month. And as he mentioned, like, you know, now they have a policy, and I'm not sure if any other state have a better policy than Telangana right now. So thank you, sir. Please give a big round of applause for all this, like, you know, for leadership, for his leadership and for the vision that he has. Sir, my next question is, during the last budget sessions, the central government announced the health zones. So that's a great step forward. I think India has a huge potential to become a health hub. So just want to hear from you, sir, like, you know, how Telangana is going to take advantage of that. So we have a lot of innovators, investors watching on live. So in terms of adopting digital health or improving, obviously you talked about medical tourism, how can we or people can take advantage of these medical zones that central government announced, and from the state of Telangana perspective, sir?
Yes, you know, I would like to really appreciate the efforts of the central government coming up with the new initiative. I have a director over here who hails from my area too over here. In fact, we are trying to put all our strength behind to get one of the centers over there in Hyderabad or in the tier 5 city or tier 3 cities where things can happen, start from early lead to the next level of the research and all. So we are trying to work it out because it's only 15 days since the central government has come up with this policy. And we would like to relate ourselves with our medical tourism policy. And the new initiatives, what have been the profiling of the citizens, and also in terms of basic core areas where, you know, nothing has been mentioned in that right now. What are the guidelines which has been mentioned? We would like to really analyze what are the guidelines and how do we correlate with the systems existing right now here. And there are many policy initiatives of the central government which we try to imbibe into our system. And tomorrow, in the, you know, in our annual budget too, we are trying to put it up where we can really, you know, relate ourselves with the central government policy and try to enhance from there. So this is what we are trying to do is, and basically the few things what I've been mentioning about is the health institutions what we have on the government sector. We have to take it to the next level. Once, if you have seen the Rajiv Aragyasri, which is a role model for anybody in any part of this country, Likewise, we are trying to devise this health profiling system where the technology experts can be involved in that and AI experts can involve themselves. And the future quantum friends can involve in that. How we can literally do that. We have Center of Excellence for AI, and now we have come up with AI Innovation Hub, where we literally will provide a platform where the doctors or the NPOs or the clinical specialists can come, do some sort of a research in that space, come back with some sort of a niche solutions, especially in terms of the healthcare that we are trying to do it. So we will try to literally analyze what the central government has come up with a policy and the guidelines has not been framed. And in the next budget, where we provide in March, we'll try to some way correlate. That's a basic discussion what we have.
Thank you so much, sir. Thank you so much. So, from our perspective, sir, we are doing a lot of CSR initiatives from Touch a Life, and we have launched a digital platform called TALHospitals for providing pro bono healthcare services. And also today we launched something called TALMedo, and we are trying to create a network of doctors, only for doctors. It's kind of a LinkedIn, but LinkedIn has all kinds of content because we want to really help doctors and patients to create a good content so that they can learn from each other. So we launched it today, sir, for your information. So we are contributing again. It's completely a free platform. All doctors are welcome to join, and they can take advantage. And of course, people can be benefited from the content they're creating and sharing the knowledge, sir. So with that, sir, so because now the healthcare is kind of becoming global, and people are traveling from one country to other to get the treatments and all, and the governance and the trust of securing the data is becoming a big challenge, sir. So I know, I understand the government of India is coming up with a new governance, data security kind of rules and compliance. So I just wanted to hear from you, sir, from the state of Telangana. So what kind of initiatives are you, promoting to secure the patient's confidence, their data protection, so that they can come back here and safely and securely they can get the treatments from here, sir?
Actually, adding to what you have said, this is the only state where we have a platform. We have open access for a platform has been created, Telangana Data Exchange. A platform is created where data can be available to each and every citizen, to each and every investor and each and every industry partner over here. This is the first time ever, and we are trying to literally see what will be the regulatory issues tomorrow if we have to face it. And the new policy, a new law which has taken by the central government of data safety and data security, we're trying to analyze about it. And times to come, data is the key. Data is the oil for the AI. Right. And as such, we would like to literally see that if somebody is interested to see and use the use cases, because the government hospitals, for example, everybody knows, for the past 60 to 70 years, the data available in the government institutions is huge. And they can use the data as use cases and come up with some sort of solutions. And that we can share it, and it's open for everybody.
Sure, sir. Thank you so much, sir. And then, obviously, Telangana is known for a great talent, and a lot of resource skills and pools are here. I know the technology is evolving, like AI and quantum and things like that. I know for sure there are great upskilling initiatives that you're undertaking, sir. Just for our audience and people online, if you can highlight some of the initiatives that you're working on for improving skills for the people.
Yes, we take pride always in the talent pool available here in Hyderabad, and that's how we could able to really attract many partners in terms of the pure technology. And we have done so much over the past 30 years, 3 decades. Now it's not been done in a decade time or a 5 years time or 2 years time of mine. It's been there for the past 30 years. And the talent pool, for example, we graduate about 1.5 lakh from the core engineering colleges and from the STEM. And the talent pool which is readily available for the industry, which we create, we want to fine tune it because we found there is a gap between industry and academia. And that's how we just thought of bridging a gap between industry and academia. And after our government has taken governance 2 years back, we have come up with a niche idea ever done in this country to come up with a university that is called Young India Skills University, where 42 disciplines of the industries are associated. It's totally industry driven. And Anand Mahindra, a tall industry leader who everybody knows, is the chairman of the university. And many industry partners have come and associated with the university, and government is only acting as a facilitator. And for example, Kishore can come and try to train the students who get admitted in that university and try to train them in terms of how you can converge in your core domain expertise with the technology. And it is a win-win situation where the industry will take back the people who graduate from there, and less remaining is provided to the market. So this is one of first ever initiative taken by our government, and it's running super good, I would like to say. And many industry partners are coming, and they are trying to put their expertise into this university. And that's coming up near the future city. And in maybe 3 months' time, the infrastructure will be in place. Right now we are running in a temporary office over here. And likewise, we would like to do, if anybody has any niche ideas in terms of your medical healthcare combining with the technology, if us, the leaders from the technology people who are here, we can given them whatever is required from the government and try to create the skill force which are required by your industry. So our basic principle and vision of our government is to provide the skill required, and they have to be employed on the day one without the industry wasting their time, energy, resources in trying to train them. This is our basic objective.
No, I think this is great. I think some of the people on the video, right? So two major things from this initiative. So they are creating resource pool. They are basically productive from day one. They are taking all the hard work. They're doing all the groundwork to train them, so that if somebody is coming here for a specific skill, they have the people from day one. And whatever the Young Skills University Sar is talking about, and they are bridging the gap between the academia and the industry requirements. So great, sir. Thank you so much, sir. And sir, you're also doing a lot of initiatives on the enabling employment for tier 2 and tier 3 cities. I know there's a lot of initiatives, sir. Just you want to make a small comment on that one, sir?
Yes, basically, we would like to make more Hyderabad's, because Telangana is known only in Hyderabad. So in tier 2, tier 3 cities, where the skill is available, where the infrastructure is available, the basic infrastructure is available, where talent is available, and we are trying to reflect this talent, we are trying to reflect the skill, the infrastructure of tier 2, tier 3 cities over. And we are inviting our partners to come stay put there in any verticals of the industry. And for that, we have come up with a niche MSME policy for the micro, small, medium enterprises. And we have given lots of incentives and subsidies to pull in and attract. And this is one. And secondly is in terms of technology, enablers. We have laid fiber all over our state, which is the primary requirement for any technology-led office to have the access to all streams of communications. You need to have net connectivity. So net connectivity is given to 98% all over the state. For example, if you have to put some technology center, we can guarantee them that we'll provide them the skill required, the talented people required, and we will guarantee them the infrastructure required, whether it may be building, whether it may be the power, whether it may be the water. We can guarantee that. And thirdly, coming up to access, roads to the capital, to the Hyderabad. I can say that the access in terms of this infrastructure is absolutely very, very high in terms of the efficiency. And this is how, and next is, while building these tier 2 cities, we are also planning to come up with 2 more airports, one in Warangal and one in Adilabad. Till now, our state has only one airport, that is Rajiv Gandhi International Airport. Maybe in 2 months' time, we are trying to put on ground the Warangal Airport and also Adilabad Airport, where it connects through air too. And we have access, anyway, everybody knows about it. Rail access is there. Basic commuting facilities are very clear. As such, it's a very small state. Commuting from district headquarters to Hyderabad only takes, from any district, it takes only 2.5 hours. So we would like to really put it across to all our industry partners who are sitting over here to come and invest in tier 2 and 3 tier cities.
Thank you so much, sir. So I have a few rapid fire questions, sir. And maybe if any audience wants to have any questions, 1 or 2 questions, if you don't mind, sir, we'll take 1 or 2 questions, sir. So the first question is, obviously we have a lot of technology folks here, we have medical professionals here, and we are live streaming this session, sir. If you want to, the innovators in the audience, if you want to advise them to work on something today and tomorrow, what would be your advice, sir?
So my advice is, in my first point of reference is, while democratizing the technology is most important. As such, anyway, doctors are over here. Their primary duty, objective, and purpose is to give the best of the medical advice, consultation, and also do the treatment for the patient. How do we take it to each and every individual, cutting across all the barriers? That's more important, where the technology has come, and it has to be an enabler for that. Democratizing the technology is important. That's how we are trying to put it across. Democratizing the AI is our prime objective right now. How do we do that? From the school, we are trying to inculcate a subject in terms of AI, where our public institutions or government schools can have the access to the new models of technology. Likewise, our primary health centers, for example, in the government sector, or the community health clinics, or the district hospitals, can have access to this sort of technology. This is our prime focus. Anybody who would like to travel with us in sharing their expertise, in sharing their technology with us, they are welcome, and they can join us, in a win-win situation where they can give their best of their expertise to our people. And this is our own, this is our basic agenda.
Thank you, sir. And just one more rapid fire question is, from the policy perspective, sir, if you want to push one key policy to basically support the medical tourism, sir, what would that be you wanted to focus on from the policy perspective, sir?
You have a different, what I mean to say is, there are few sectors which are attracting many patients from different parts of the world. Now what our government is trying to do is try to put it in a regulatory framework and see that, this is all interdisciplinary thing, where it involves tourism, where it involves medical and health department, and technology comes as an enabler for that. So for that, we are trying to literally, seek your advice too. How best the medical policy, if you can go through the medical tourism policy, if something can be added, we will try to, inculcate those best practices. I think medical tourism policy, if somebody would have done, if, the legal expert who is sitting over here, Nishit Desai, can tell us, we will try to imbibe those parts of it, and especially just as a niche and a very, very new policy initiative what we have taken, and we are just seeing the response coming up. And tomorrow, in times to come, we are inviting the best of the hospitals, renowned hospitals from different parts of the globe, to come and stay put here in the future city. We are trying to give about 400 to 500 acres, which we will name it as a health city. And all the big hospitals will have their, hospital framework over here. Most probably we are getting great response from American hospitals, as well as a few hospitals from Dubai and Middle East too, and many hospitals like very hospitality centers where, multidisciplinary, whether it may be Unani, where it may be Ayurvedic or Homeo, all fused together. They are trying to come up with so many applications. So in that stream of thought, we are working on.
Sure, sir. Thank you so much, sir. Really honored to be to have you here, sir. So with that, please.
Thank you. Any questions from their side?
Yeah, please give a big round of applause before asking questions for sharing all the progression that's happening in Telangana and sharing some of his vision. Thank you so much, sir. Please go ahead, sir.
Good evening, Honorable Minister. I am Dr. Saptarshi Ghosh, the CEO of Symbiosis Center for Entrepreneurship and Innovation. We deal with a lot of youth, and centers like THub has worked brilliantly for Telangana in the past. But the challenge today is, how do you scale up ventures? So especially in the medtech, there's a lot of growth capital that is needed. So there's this government legal directive saying that 30% of CSRs can be directed towards innovation. But can we in future look at some kind of a platform wherein CSRs can converge with people who need it, who are innovating, state-of-the-art technology? Your views on that, please.
Yeah, we appreciate Mr. Ghosh. Anyway, we would like to invite the pro bono thing to come onto one platform to help and aid and incubate the idea, which can be come up as a startup or a great new innovation. Right now, we haven't thought about it. Basically, the platforms like THub and tomorrow's our vision and our policy framework of coming up with artificial intelligence hub, which will be 100 times multiplying enabler effect for these institutions, which will try to encompass, imbibe and embrace the AI and different new technologies into that field. But yes, we would like to really, take up in terms of medtech, what you're saying is the CSR, to come out on platform and try to really encourage this sort of a model. We will try to literally see. We haven't thought about it basically because lot many, incubators are there here. You can see 80 or 90, medtech incubators or startups which moves from here. So they have come up on their own. This sort of platform is being created by the government. These platforms are really helpful for them to incubate their idea and to come up with their niche thinking. So we'll literally think about it. Thank you, Mr. Ghosh.
Thank you so much, sir.
Good evening, Minister, sir. My name is Naresh Israel, Threshing Floor Group Founder Chairman. Sir, all the sectors are working on AI. Most of the founders, all companies are working on AI. So when it comes to the security mechanism, so creating a AI infrastructure is the best move, sir. So towards that own AI infrastructure mechanism, is there any government initiative in future, sir?
Yeah, as we are literally trying to picturize the new technologies, we don't have any regulatory framework for AI right now. No policy regulatory framework is there at the national level or the federal level or at the state level right now. We are still working out. AI as rightly told by the elders over here, is a double-edged technology. Any new technology or any technology is double-edged. You'll have the good and bad. How to control bad is our priority and is our agenda too. So how best the regulatory framework, what we are trying to envisage is most important. We are trying to work on the models. Same time, we are giving great impetus for the cyber security laws. We have certain acts for the cyber security in consonance with our federal act. But still, a lot many loopholes are there, and connecting the dots is most important for us now. And in fact, while we are trying to arrest the cyber crimes, but still we are not able to really do that. That I have to agree as a policymaker too. In that frame of things, what we are trying, every day we are working on few, executive memos, trying to picturize how we can arrest the cyber crimes. Still, we are trying to frame our regulatory frameworks because this requires our federal permissions, and also in terms of many multinationals which are coming over here, we require the statutory permissions from their own countries. So it's a huge network of complexities which are involved here. Because I keep trying to talk regarding these regulatory framework approaches, especially while I was trying to make the policy framework for the AI, I was trying to delve into all those issues. And we may try to come up with the security safeguards of the new technologies. Right now, we have certain few features. We'll be working for it actually.
Thank you, sir.
Thank you.
Can we expand the scope of CS? Today it's able to invest in incubations, but I think if in the area of high tech or otherwise, some 10% of 2%, that also will be a large pool if that is possible.
Sure, sir.
We would government.
We would love to, but as you know, you're a better person to sell. But it's a federal policy measure. We can't increase 2%, and we don't have a mandate by the state governments to literally put either we have to literally frame some laws to put additional cess model. It will again have a burden on the consumer. So mandatory 2% of the CSR which has been done by our federal government, the central government, is that what we can take right now? More than it's on the parliament and it's on the sovereign.
I was only saying whether use can be out. Yeah, of course, central government policy, but if you can.
Yes, we can think about it, but still, we just want to literally see that, the addition. If you have seen, cess in terms of, central government which has put in terms of education, in terms of health, and all put together on an industry, will have an impact on the consumer directly. Many industry partners would have been here, but all this will pass on to the consumer, and ultimately it's the consumer which is more important for us. It's the citizen which is more important for us. So we'll be looking at it.
So I'm not suggesting to increase the use of CSR. 2% only occupy. But today they are not able to invest in the shares of the company of the type that we want. That will release a huge amount of funding. So I'm not suggesting to increase, but some portion which is allowed to be invested only in incubations.
Okay.
Yeah. So that's what I'm saying. Some little expansion of.
Yes, sir. We'll make. This is as a federal law. Then we'll try to put it across because that flexibility is that central government has to give us. Sure, sir, we'll put it across.
Just if I can add one point, sir. So, like Honorable Minister Garu's team actually reached out to us because how this 2% of corporate like CSR funds are being used and what kind of projects or what kind of communities are getting benefited. So we worked with their IT team. We built something called TALHospitals, sir, on Touch a Life. So we wanted to corporates to come to this portal and contribute their portion. We are bringing NGOs to find out the right projects for the community so that the corporates can fund it and the government have the oversight for it. So we just had a couple of rounds of reviews, sir. So I'm sure, sir, maybe I'm not sure they have updated you or not, but I'm sure they're planning to launch in maybe a few weeks, sir. So we are helping from outside. We are creating a visible, projects for the community, primarily from the CSR funds, the 2% whatever they want to contribute.
No, what Nishit ji was telling you about to have the specific in terms of medtech for the incubation. Yeah, that's what he's saying. And we would like to literally put it across to the central government to one more point.
Anybody has any other questions? Okay. Thank you so much, sir. Thank you for your time.
Thank you very much.
Really appreciate coming.
Thank you very much, sir. Please be there. I'll now like to request Sai Gundavali to honor the minister with a memento. Thank you very much, Sridhar Babu Garu. Thanks a lot. We are honored to have you here, and great thoughts and great first initiatives by the government, and we are for sure know that there are going to be many first initiatives coming forward. Thank you, sir. Sai, may I request you for a vote of thanks in a bit?
Hello. Well, thank you. I think it was a great day, starting in the morning, where everybody were kind of really wondering how the day is going to happen. A lot of inspiration, a lot of good content. Hopefully we all learn from each other. There's a fantastic opportunity to change the world. There's an opportunity to live larger than our life, I think, to change the healthcare. Where it stands right now, it's primarily a prescriptive care. I think it can become a wholesome, preventive, wellness care and all of that. And great panels though, great panels and great content. And I know it'll inspire millions of people beyond this room. Thank you very much. Please join us for dinner.
TALHospitals. Healthcare should reach people.
Can you all join us for one big picture? This is going to remain for many years to come. So please come to the stage. We'll all take one picture.